Good morning. Good morning. Good to see you all this morning. We're going to go ahead and get started with our public safety hearing this morning. Today's date is Tuesday, March 11, 2025. We're going to go over the following bills today. And we also have a robust roster of people that will be speaking. And so we'll be moving pretty deliberately today through our robust agenda. And so thanks for joining us this morning. We will be reviewing Senate Bill number 1489, an act concerning regional police forces. Senate Bill number 1490, an act concerning the sale of battery-powered smoke detectors in the state. Senate Bill number 1491, an act concerning a fire suppression infrastructure grant program. Senate Bill number 1492, an act concerning law enforcement recruitment and retention. Senate Bill number 1493, an act concerning the uniform investigation of accident report and certain reports by peace officers. House Bill number 7198, an act requiring a study on how to improve the assignment of conservation officers throughout the state. House Bill number 7199, an act concerning firefighter recruitment and retention. House Bill number 7200, an act concerning bleeding control training and kits. House Bill number 7201, an act concerning supplemental paramedic. And House Bill number 7202, an act concerning law enforcement training. House Bill number 7203, an act establishing a state wildfire commission and permitting a certain council to serve as a subcommittee of the Commission on Fire Prevention and Control. And House Bill number 7204, an act concerning lights on vehicles, penalties for violation of statutes, stops and searches, a phlebotomy program study, inspections of certain vehicles, traffic safety corridors, a pilot program to equip police vehicles with certain devices, and police review of certain recordings. At this time, I would like to see if my wonderful co-chair would like to offer any greetings. We're all good. All right, so we're going to start with our first person, Michelle Williams from the University of Connecticut, who serves as the Chief of Staff to the President. Welcome to the Public Safety Committee. Yes, and Christopher Renshaw, the University of Connecticut Interim Fire Chief. Thank you.
Honorable co-chairs, ranking members, and members of the Public Safety and Security Committee, my name is Michelle Williams. I'm the Chief of Staff to UConn's President, Rebecca Marich, and I'm joined here today by Christopher Renshaw, our Interim Fire Chief. Thank you for the opportunity to provide testimony in support of HB 7201, an act concerning a supplemental paramedic. This bill would allow the UConn Fire Department paramedics, upon approval of the Department of Public Health Commissioner, to provide supplemental paramedic services on the Storrs campus, but only in those instances when immediate ALS skills are on scene, but waiting the arrival of the primary service area responder. The ability of our personnel to provide this level of care increases the likelihood of life-saving emergency medical services when minutes, if not seconds, count the most. I would like to turn the testimony over to Chief Renshaw to share some background on the department, as well as to provide more on our readiness to provide these services.
The University of Connecticut Fire Department, established in 1898, has two stations, one on the Storrs campus and the second on the UConn Health campus in Farmington. In total for 2024, UCFD collectively responded to 3,048 EMS responses, 887 of which were from the Storrs Station first responders alone. On the UConn Health campus, UConn Fire provides advanced life support services utilizing both its paramedics and EMTs within its primary service area. On the Storrs campus, UCFD provides BLS service utilizing all 46 personnel currently within its established geographic PSA. Within the Storrs campus-based PSA, the ALS provider having jurisdiction is the Windham Community Memorial Hospital Paramedic Service. Response to these calls include BLS ambulance response from UConn Fire and ALS resources that begin with the Windham paramedics, and then additional support from other ALS service providers as needed or when unavailable. As all personnel within UConn Fire work at either station location, there is a consistent, predictable level of personnel at the Storrs location who have EMS licensure at the paramedic level, but do not provide this service while on duty due to the limitations placed on the current DPH-PSA agreement. When these personnel respond to emergency medical service calls, they only provide care at the BLS level, while ALS being provided, as noted, primarily by Windham paramedics. The issue at hand is not unique. It is not one of territory, nor is it financial. It is simplistic in being able to provide the highest level of care available by responding Yukon Fire personnel that have the licensure, skills, and experience to make an immediate difference to a life in jeopardy, while the normal business of response by our valued partners is unimpeded. The ability to obtain supplemental paramedic service by Yukon Fire within the Storrs Campus PSA maximizes the relationship between the University of Connecticut, the Wyndham Paramedic Service, and the communities in which we are trusted and sworn to serve. Just this past Friday, Yukon submitted an application for such expanded supplemental service through the established process DPH and the Office of Emergency Medical Service provides. We value the arrangement with Wyndham Community Memorial Hospital and look forward to continued collaboration and saving lives for years to come. Thank you for your commitment to the safety of the University of Connecticut community.
Thank you, Chief, for the testimony. Just a couple quick questions. One, is it fair to say that right now you have firefighters who are on duty doing regular BLS calls or doing traditional firefighting engine company type stuff that are certified paramedics that because of the designation of the Yukon Fire Department, they are not able to practice at the ALS level despite the fact that they are personally certified at that level?
That is a correct statement. Guaranteed at least one and is up to as many as 12 at one time on the Storrs campus.
And the department, because you operate ALS at Farmington, is that correct?
That is correct.
So the department itself has the associated equipment or is willing to do that to meet DPH's minimum standards for ALS.
That's correct. Our OEMS license provides for ALS and BLS.
And is it fair to say, Chief, that in the whole region, looking at the various ALS providers, that at times in that region, there's not enough ALS service?
There are times where the call volume exceeds the resources that are provided.
Yeah, and that's been my assessment too, that we're not stealing crumbs off people's plates. We're adding more resources to the region, which is needed as well. And I appreciate the Chief of Staff being here and kind of putting the weight behind it as well. This is an issue that's been around for a while. And I think at the end of the day, everybody just wants to be able to provide the best care for the students on the Storrs campus at the end of the day, and try to get there. And this is kind of the best agreement here. So, questions from members of the committee? Ranking Member Howard.
Thank you, Mr. Chairman, and good morning. I think I heard you say that you applied to OEMS for this already. Did I hear you correctly?
Correct, sir. We submitted the application on Friday and they began reviewing it yesterday.
If they grant that application, you won't need this legislation. Is that right?
That is an interesting question. There, I believe, is no precedent for this. So either way, whether it's through the application or through this legislation, our goal is to be successful.
So I understand, and we've heard this bill for a couple of years now, and I understand the impetus of it and the need for it. And I certainly understand the frustration of standing there with the tools and equipment to save somebody's life, but not the right shirt or the right piece of paper. It's just kind of foolish. But the opposition to this bill seems focused on that Yukon is attempting to go around an existing process. What do you say to that?
No, I believe that my opinion is that we are following the steps that have been given to us for guidance, which is submitting the application and the opportunity to sit before all of you in regards to this legislation as an ends to the means to provide that service that we have identified as a need.
Well, thank you. I just, looking at the testimony, I just thought we could clear that up. I appreciate you being here. And I'll just say to you, I was telling some folks behind you, I started my career in EMS before I went into law enforcement, and nothing drove me more crazy than I have sitting there with an ALS license, an ALS ambulance, and ALS equipment, but there wasn't an ALS provider from that particular agency there at the time, so I couldn't intubate people. I couldn't start lines. It drove me. I did it anyway. I'll say it on the record. I did it many times, and I'd rather answer to that than stand there and watch somebody die. So I appreciate the situation, and I hope that we can work to get this resolved for you guys this year. Thank you, Mr. Chairman.
Thank you.
Thank you, Representative Howard. And we'll obviously talk about this during screening, but I agree with the chief. There's not a lot of precedent for this. And the way the statute reads now, with an acute care hospital, puts it in a little fuzzy ground. And this is different than prior requests because we're asking for the supplemental, right, as opposed to taking the primary piece there too. But these are all good questions. Other questions from members of the committee? Representative Linehan.
Thank you very much, Mr. Chairman. Hi, thank you for your testimony today. I just have a question, one question. Can you say with absolute certainty that there have been instances where services were delayed because one group was there earlier than the other?
If I understand your question, can I provide an example or give an affirmative answer to where ALS services were delayed because one group was there before another?
That whereas someone on site, just exactly what the good ranking member was talking about, where there was someone on site who could perform life-saving services when in fact they couldn't do that, and the emergency medical service that was due to show up was later than those who were actually first on the scene.
Yes, that happens quite often because of our personnel that have the ALS licensure working on the stores campus in a BLS role because of the license restriction, waiting for the primary service area ALS service, Wyndham Hospital, to arrive. It doesn't necessarily mean that they're delayed, but there is a time gap from their arrival to the scene as opposed to the response from the Yukon Fire Department, which is in as little as 3 minutes.
So you said that the Yukon Fire Department's response is in as little as 3 minutes. And is there an average response for the ambulance service?
Yes, around 9 to 12 minutes on average.
So 3 minutes versus 9 to 12 minutes. So thank you very much. I appreciate that. I think it's extremely important that we get services as quickly as possible on site, and that the person who is capable of doing that is able to save a life. I will say, as someone who sending my child to college in 2 years, and given everything that I remember happens on campus, I would prefer that someone respond to an emergency within 3 minutes rather than 9. So thank you. I appreciate your testimony here today.
Thank you.
Representative Jenga.
Thank you. Thank you, Mr. Chair. Thank you for your testimony this morning. And you mentioned you have 3,048 total calls for the past year.
Yes, sir, for medical alone.
Okay. Can you tell me what the average response times were for those calls?
That cumulative number, when I described it, was for the entire Yukon Fire Department, so both the stores and the Farmington campus. The 887 is the specific number for the stores campus. The average time is we utilize about 3 to 5 minutes as the average time. A specific time, I would have to come back to you with the actual minutes and seconds and subseconds.
Do you have any percentage of these calls that you've met within the 3 to 5 or longer?
Yes, sir, we do keep that data. I would, off of recall, say that the 3 to 5 minutes average response time is the vast majority of our response times.
We know that the first few minutes, first 4 or 5 minutes are crucial, critical. Do you have any idea if you went to this new service, how many calls based on your last year's experience you would get there sooner?
That would be an increase that is variable because it's not just the ALS service coming from Wyndham. We also utilize other ALS services that are further away geographic and distance when the ALS provider from Wyndham is not available. So the time lag can be as anywhere from 9 to 12 on average for our partners at Wyndham Hospital, but it could be much greater if they're not available and we're waiting for resources from Rockville Hospital, Manchester Hospital, Manchester Fire Department, East Hartford, and beyond. At some point, it even goes back to our own hospital medics at John Dempsey Yukon Farmington campus that we would be asking to come to the stores campus to provide that service. We haven't gotten that far yet.
Okay, I think those are critical information, and as you mentioned, the highest level of service is what you want to provide. And in your opinion, obviously, this is going to increase that level of service. And I'm trying to just, how much would it increase? I think I'm in favor of what you're doing.
Mm-hmm.
And because you're going through a normal process by going to OEMS, I would think you wouldn't need our approval. But if you got our approval, I would question then, what would that do that OEMS approval couldn't do?
That is a fair point, and since this is new ground, I would just have opinion. I have nothing to base a factual answer off of. But the greater point here, which I am hoping to communicate clearly, is that our fire department responders having the ALS certification licensure who may be on duty perform that service while awaiting the PSA holder to arrive. So it's that stopgap time
Yep.
when seconds count that we're providing that and avoiding the situation that Representative Howard is describing, where you have to make an in-time moral and ethical choice that risks everything to make sure that a human being lives.
Yeah, that's critical, stabilizing the patient, even if it's done prior to the paramedics getting there. So obviously, I'm in favor of this because of the highest level. I've been involved with the first service in the state of Connecticut since '75, which was East Hartford. And today we can get to well over 90% of our calls within 3 minutes. We have paramedics in every station in East Hartford. We started off and learned a lot. But what you're saying resonates to me, the highest level of service, getting there the sooner you can.
Yes, sir.
Thank you.
Any additional questions from members of the committee? Seeing none, thank you so much for joining us on today. We really appreciate your testimony.
Thank you.
At this time, we'll call Representative Kathy Kennedy, followed by Milford Fire Chief Fabrizi. Please join us.
Good morning, Senator Gaston, Representative Boyd, Ranking Members Senator Ciccarella, and Representative Howard. I'm here today to testify in support of House Bill Raise 7199, specifically Section 8, and that is concerning costs to our fire department following graduation. The simple is we need that in not only just the town of Milford. This is not a unique situation to the town of Milford, but to also many other towns and cities throughout the state. And it's also not unique to fire service. This is something that this legislative body looked at back in, I believe it was 2019, regarding police retention. And specifically, that section is to saving the costs associated with losing firefighters to other departments. And I'm going to turn it over to Fire Chief Anthony Fabrizi to continue with his, thank you.
Good morning, Chairs Gaston and Boyd, Ranking Members Ciccarella and Howard, and distinguished members of the Public Safety and Security Committee. Thank you for this opportunity to testify in support of House Bill HB 07199, an act concerning the recruitment and retention of firefighters, and to add language pertaining to reimbursement for the cost of firefighter certification. I would like to bring forth an issue that many fire chiefs are struggling to manage in their course of duty. Firefighter recruitment and retention has become an increasingly difficult challenge in recent years. When I began my career over 31 years ago, most firefighters within my department were not only many years senior to the incoming rookie firefighter, but were committed to the department in which they were employed. As of late, we have seen a shift in the age demographic and mindset of a young firefighter candidate regarding their commitment to a singular department for the duration of their career. This can be attributed to a multitude of factors, including but not limited to generational values, an offer of employment by a secondary department versus their preferred city or town, and additionally, differences in salary, benefits, and pension structure. The firefighter's decision to accept a position with another department imposes a significant financial burden upon the organization in which he or she departs. In total, an approximate $95,000 investment in the first year alone for a singular firefighter. Fire departments that elect to hire lateral transfers often gain a financial advantage by receiving a Connecticut certified firefighter and bypassing many of the expenses previously described. Currently, no avenue of recourse exists for fire departments within the state of Connecticut. However, legislation was introduced and adopted within our state in the form of Connecticut General Statute, Section 7-294 DD, which covers police departments that have long faced the same issue. The statute allows police departments to recoup 50% of the city's investment if the officer elects to seek employment with another municipality within his first 2 years of service. I respectfully ask that you support this legislation, as it will provide a similar opportunity for fire departments to recoup a fair portion of their monetary investment from a competing department. Thank you.
Ranking Member Howard.
Thank you, Mr. Chairman. Welcome, Chief. Welcome, Representative. Can you just give me, how do you arrive at those numbers? So, like, for example, in police work, the officer is hired and then sent to the academy, right? So for 6 months, it's salary, it's benefits, uniforms, et cetera. I understand it from a police perspective. How do you arrive at those numbers? Is the fire service work the same way?
Yes, very similar. It's not limited to, but the majority is from, we factored the recruit written exam, the physical agility testing, the oral interview process, the background investigation, doctors' physicals and drug testing, department uniforms, a full complement of structural firefighting turnout gear, tuition for the Connecticut Fire Academy recruit program, and overtime coverage for the shift vacancy while attending the Fire Academy recruit program.
So in police work, if I were to get hired in Stonington, say, and then I wanted to go to Groton because I like the chief better and it's a nicer police department and they treat their guys better, for example, if I wanted to do that, I would essentially, and it's not the 2 years, I'd have to go through the police academy all over again. How would that work in the fire service? Because police officers are certified through the state as police officers. They have a certification through post. So how would that work in the fire service? If I got hired in Stonington as a full-time firefighter and 18 months later decided to leave because I'm not a captive, right? I could do it. What does it mean? What would that other agency have to do?
Well, once a firefighter is certified as a Connecticut firefighter, he has the right to move to any department. He retains that certification. That new municipality does not have to elect to send that firefighter back to the Connecticut Fire Academy. However, in Milford, we historically have elected to send those firefighters back through the academy. And that's mostly in part as of late due to obligations in our collective bargaining agreement. However, we look to the future to change that as a cost savings to the city. But again, once again, the certification remains with the firefighter.
I guess that my question becomes, how would you enforce it? So in police work, you enforce it that way. You would say, okay, Stonington, or okay, Groton, you can have this guy, but you're going to send him all the way back to the academy, which is, of course, a deterrent for the guy to leave. How would that work in the fire service? That's what I'm trying to drill down on. So in other words, if we pass this bill and say if somebody gets hired in Milford, they have to stay there for 2 years. If they leave in 12 months, certainly we're not going to arrest them, right? We're not going to put them in jail. So what would be the deterrent? How could it be enforced? And that's, to me, the difference between firefighting and police work. You know what I'm saying? And you don't need to answer that now. I'm curious. That seems to me the loophole, because I agree with you wholeheartedly in the analogy between the two. It makes perfect sense. And I totally understand that you make investments, and I can imagine that people use certain fire departments as a stepping stone to where they want to be because they're much more desirable to that new department because they come with all this credentials already. I understand that. So maybe not now, but one thing to think about that we need to think about is how can we prevent that if we pass this bill? What happens if somebody does it? How is the enforcement going to be taken out?
It's a great question. I think most departments elect not to send their recruits back to the academy because, like I said, the certifications follow the firefighter. They stay with them throughout their career. In the city of Milford, we were slightly different. I said, and as I testified to our collective bargaining agreement, we're held to that. But once again, what a new municipality might do with that firefighter is only one's guess. But again, I think what we're seeing in the fire service now is a trend, what we call a lateral transfer, is where a firefighter is enabled to apply to a new municipality and they're transferred right over, and other than a couple weeks of orientation, give or take, they're put right into service and function in that new municipality without attending the Connecticut Fire Academy.
Okay. So that's something that we're just going to have to try to
Mr.
figure out.
Chairman, if I could add, I'm sorry. So a lot of times when someone's seeking a career in fire service, they applied at a number of departments. So they're on numerous lists. I know that because my son was a fire science major at the University of New Haven. So you're applying to various departments, and you may get on various departments, but it depends on where you are on the list. So the list, you could be anywhere from number 2 to number 72. So you're marketable. And in most career departments, you're required to at least be an EMT. Nowadays, a lot of our firefighters are also paramedics. So you get hired, let's say, by Milford, and they put you through the academy, and you graduate. Now you're not only now a certified firefighter, you also have, let's say, a paramedic certification. Now you're on the list in New Haven at number 3. You are now a certified firefighter and a paramedic, so they can use you right now. They'll cut down the list, and that's what Chief was alluding to about the lateral moves, and they'll get hired. I think what the proposal behind this bill is to bill that municipality for the costs
Yeah.
that the department received. And at this point, and Chief was really generous about it. And like I said, this is not unique to just Milford, but when you're losing 1, 2, 3, 4 firefighters within a 2-year period, we won't even go more than that. That's a real hardship to your, your municipality and also your budget. You've spent that money, and you're not recouping it right now. And I bet you we're in over $500,000 easily at this point. And you want firefighters to stay with your department, and that's your home, that's your new home, and to service that community. So I think I'm hoping that gives you some more perspective of it. That person's certainly more marketable. It's really easy when you're on number of lists
Sure.
to then go somewhere else.
It does, Representative. I actually found in the bill, I was remiss earlier, there's a mandate here that the receiving department has to reimburse 50%. So, all right, I see it. I apologize.
And Representative, if I may, I don't think that would add any onus to the department, because they likely have some kind of a payroll such system. So
Yeah.
it shouldn't be that difficult
Still
for
a
them.
bargain price, still getting 50% off, right? All right, thank you, Chief.
Thank you. Thank you, Mr. Chairman.
Representative McGorty.
Thank you, Mr. Chairman. Good afternoon, Chief, or good morning still. Thanks for coming in today. Good to see you. And Representative, good to see you. And I just want to say, you're not alone. It's every municipality has the same problem. And this is a good bill. It's a step in the right direction. And also with the volunteer departments, volunteers themselves pay for themselves to go to the academy, or the town will reimburse them if it's a volunteer town. And then they get out of the academy, and then they get poached by the career department. So, it happens to volunteer. So it's just 169 towns, and each fire department has the same issue. So it's a good bill, and look forward to seeing it go forward. Thanks for coming in. Thank you. Thank you, Mr. Chairman.
Thank you. Representative Heffern.
Hello, Chief. Do you think it's safe to say that a lot of these lateral transfers are because they're allowed to take their pensions with them?
No, they're not allowed to take their pensions with them from the city of Milford. The only time they would do that is if they're over 10 years and invested into the pension. We're seeing, and what this bill would propose is 2 years or less to mirror the police department bill. So it's looking for those firefighters that come in their first 2 years of service, give or take, which can be discussed on a timeline. It's trying to retain that initial investment and keep them in-house.
So your municipal pension is 10 years to be vested?
Correct.
Okay, thank you.
Representative Lamarck Muir.
Thank you, Mr. Chair.
Getting better at the name.
You did. Thank you. Thank you, Chief, for being here. I appreciate your testimony. I'm going to follow up along the lines with my distinguished colleague over there, Representative Howard. So do you know, or did you look at all and see where most of your officers are going, or your firemen are going? Like, what departments are they? Is there any kind of pattern to what departments they're leaving your department and going to?
No, there's no pattern, but however, there are cities like New Haven, Norwalk, Bridgeport in the past 5 years, and New Britain, I believe, is the half a dozen that have left. Those are the departments that they went to.
Okay. Do you do exit interviews? Do you ask why they're leaving and going to another department?
I do, in fact, yes.
And just generally, without identifying any particular firemen? What are they saying?
It's a myriad of reasons. It can't be pinpointed to one particular reason. Some of it is pension and benefits for sure. Some of it is, hey, I just grew up in that city and I have an allegiance to that town, and they used Milford somewhat as a stepping stone. They said, well, that was the first job offer that came through for me. I didn't know what would happen in Department X. So I accepted the position. I went through the academy. I got my skill set up, and it made me more marketable for that other department.
Mhm. So do you think this proposal is going to, I mean, this proposal is just going to reimburse you financially for the training that you put in before they jump ship and go somewhere else?
Correct. It's not a
Yeah.
perfect solution, but what it is it helps us absorb some of that financial impact and capital outlay, which is an impact to the department's budget in the city and our taxpayer. And I think it levels the playing field with all fire departments. You know, I'm not saying this is a solution to stop what we deem as poaching in the fire service. However, it is something that it levels the playing field for all the chiefs to know that, look, if I want this firefighter, Milford invested X amount of dollars, I'm going to have to come up with 50% of that as a
Right.
reimbursement.
I mean, we call it poaching in the police department too. Um, I just don't know if, I mean, this seems like somewhat of an adversarial situation to set up. You know, if a fire department in New Haven is going to hire someone from your department and then they have to pay, I don't know, that seems a little, I don't know. You're right. It doesn't seem like the perfect solution to this problem, and it is a problem. It's in fire departments and police departments. It sounds like very similar. Um, and I worked for a police department that was just that. It's a stepping stone. It's a big urban police department, hires lots of people, so somewhat easier to get into. You can have a little bit of fun for a couple of years, and then you go to the suburbs. But have you looked at other ways? Have you looked at other ways to incentivize your firemen to stay?
We certainly have. We implore to the city that pension and benefits are a key component in firefighter retention. Maybe not all cases, but in many cases, making them feel like, hey, they're supported by the city. They have the willingness to stay a 20 to 25-year career because they know that at the end of that career, they're going to receive a pension that is consummate to the service that they gave to the city. So again, we do implore that to the city, but I think once again, that encompasses a much larger discussion. It is only one facet of it. I just want to address your comments on, is it adversarial? I don't view that as such. It's not adversarial. It's working for the police departments. Once again, for the fire department, I think once again, I view it as it sort of levels the playing field for all the chiefs. We know, like, look, if I'm going to take a firefighter from the city of Milford, you know, I know what I invest in my firefighters. We have a very strict testing system. We invest heavily into the training of our firefighters. So for another department to poach one of our firefighters in the first 2 years of service, we have countless hours of training, a large amount of money invested in that firefighter and knowledge put in there. They're getting a quality firefighter, and I like to believe, and that's not to toot my own horn. I'm sure the other chiefs would attest to the same. But again, it's a tremendous loss. So we're not only losing the monetary value, we're losing a firefighter who we started to build in that intimate knowledge of the city of Milford, if you will, so they know the citizens in the city and the infrastructure in which they serve. So that's a tremendous loss. So I think asking for a 50% of what we invested, I wouldn't deem that as adversary. I deem that as being fair. You're getting someone with quite the skill set that you don't have to invest in now.
Okay, I can agree with that. The other thing I'm thinking is it's kind of like a sports team draft, right? So if a fireman wants to go to New Haven and New Haven doesn't want to pay you for him, you're limiting his or her ability to go to the fire department that they choose, that they'd rather work for, right? So if you get kind of like, you know, the contract negotiations in football, something like that, right? So if it's going to kind of, and these are just the questions that I have. I'm not saying I don't support this bill, but it just seems like that might happen too, right? So if firemen want to go to another department and that department's not going to reimburse you, then it limits their job opportunity to work where they want to work.
Well, you have to think, what's the alternative for the fire department that wants to hire that firefighter? That firefighter, they may not want to pay Milford, but however, they're going to have to hire a firefighter off the list that still needs to attend the fire academy, still needs all those certifications, which they have to then in turn invest in anyhow. So they're basically getting the same thing at 50% off. So,
No, I see that if you look at it from the fire department's perspective, but let's just say I'm the fireman and I want to work in New Haven and they just don't want to participate in this program. They're not going to pay, right? Then,
Again, I think from a chief's perspective, why would a chief look at it as, well, I don't want to pay Milford, but I'd rather pay all the other entities to get that firefighter up to the level of the Milford firefighter at twice the cost.
Mr. Chairman, can I just add, Mr. Chairman? Sorry.
Sure.
And not to belabor, and thank you for your questions. They're very good questions. And certainly the chief certainly dated me. I started with the Milford Fire Department in 1993 as well. And I think all the fire service people that are in the room right now can attest that the fire service has changed so much over the years. And one of the things, and I understand what you're saying, it's not firefighter to firefighter necessarily. Different departments have different requirements, and that's the thing that you have to really keep in mind here. When you get hired in Milford, you don't have to be a paramedic. There are a number of departments that now have that as a requirement to get hired. It's not just an EMT. Back in the day, it was just an EMT. You didn't even have to be an EMT back in the early 90s. But now most departments across the state of Connecticut, you have to be an EMT, and now many are now requiring paramedic. So I think and I just want to drive this part home, is what the chief is saying. If we hire someone that's on our Milford list, and he's also a paramedic, after he goes through the academy, he's now a certified firefighter in the state of Connecticut, as well as a paramedic. So, and now he has that extra certification. So why not? If New Haven says, hey, they have a certified firefighter, we require paramedics. That's why. So it's really not even necessarily, do you know what I'm trying to say? It's not firefighter to firefighter necessarily if they have the additional qualifications. And so I hope that kind of clarifies it just a little bit more. And Chief, I'm sorry but I just thought that was really important to know that it's not just firefighter to firefighter necessarily. They could have added qualifications. And so I thank you for your time.
No problem. Thank you. Representative DiGio Von Carlo, followed by Representative Palello.
Chief, thanks for being here. And I am supporting this. I don't want you to think I'm not supporting it, but what is your salary rank statewide versus other departments? Where do you rank you on the scale of, from top to bottom?
I think we're more in the middle of the road or closer, mid to high. We're not the high end of the tier by any means in our region. So
Okay, and I say that because Waterbury PD, we got decimated. We got poached left and right. We became a training ground for the entire state. The poaching law came into effect, and I'm not sure so much the poaching law actually got our department back up to 300. We did open up for where you can move departments without going through the academy first. We did open that up, which we've never done in Waterbury. We always ran our guys through our own academy, but I think the biggest thing is we put a 20% pay increase to our police officers. We had to raise taxes in the city of Waterbury, and we as a city had to absolutely reach into our pockets too and raise our taxes and pay our police officers, because that's when a lot of the poaching ended. It still happens, don't get me wrong. We got New Haven that just came out with another tremendous contract, but sometimes, unfortunately, you got to make the unpopular decision to maybe raise your taxes, pay your guys more and women more. And, I just saying that as somebody that witnessed us going down to about 240 something officers back to 300 by making, taking the laterals, paying our guys more, changing our work schedule. So I will be supporting it, but I think on towns and cities end, you also have to make sure you're giving your guys and women a pretty fair salary statewide, or they're always going to be looking to move on, even pension wise. So and just my thought. I'm definitely supporting it. I think it's bad. We were, like I said, we were a training ground for every little small town that didn't want to pay for someone to go to an academy. So just my angle, I will be supporting it, but I think that in the end, guys and women are always going to search for that better road, that better retirement package, more money. And I think that's the other side of why police officers, why firemen leave. So thank you.
Representative Palello, followed by Representative Lenahan.
Thank you, Mr. Chair. Chief, good morning. Representative, good morning. Thank you for being here. Most of my questions were just asked, or the points just made by the good Vice Chair, but I do want to follow up. You'd mentioned on your exit interviews around compensation, specifically on the pension. Has the city side of your government, have they implemented any changes, any enhancements in terms of, as you're looking at CBA's new contracts, to address some of those concerns as folks have left your department as laterals to go to maybe a department or a city or town with a more competitive pension and or compensation, as was just laid out by the good Vice Chair?
Well, thank you. So yes, to a degree, we are currently in pension contract negotiations. Our current pension contract expired this actually last June 30th. And we have been in negotiations with the city. Now, as the chief of the department, I've implored to the city. I said, you have an opportunity here to help turn this around and make some changes. And my advice to them was, please preserve or improve the pension benefits for these firefighters, as it will only help in the long term for the city and minimize the impact of, or help minimize the impact of firefighters leaving for other municipalities.
Well, I think that's great advice, Chief. I think hopefully the CEO of your city and your selectmen or board of alders there heed your advice and take that recommendation. The second piece of my question is around laterals. Is that part of your recruiting plan? When you look at attrition, when you look at retirements, when you look at the overall deployment of your agency, and look at the next 3 to 5 to 10 years in terms of where your numbers are going to be and what the needs of your city are going to be, do you factor in lateral recruits as part of your overall recruitment and as part of your overall strength for the department?
Sure. Yes, it's something that we have eyed in the past and considered. However, as I mentioned earlier, I am bound by the collective bargaining agreement, and currently it prohibits myself as chief to hire lateral transfers. Now that contract expires June 30th of 2026, and that is one of the items that is on our radar to negotiate.
So I asked the question, and certainly I think as you're looking to protect the department, obviously it's a recruiting strategy also on the receiving end, certainly as well. Mr. Chair, I appreciate the opportunity to ask those questions. Thank you for the opportunity.
Thank you. Representative Lenahan.
Thank you very much, Mr. Chairman. I'm all set because Rep. Palillo stole my line.
Representative Quinn. Got to get the last word, right?
Will it be though? That's the question. I guess, you know, in talking about what we've just been talking about, if a town knows that it's going to recoup 50% of what they paid to train the firefighter, do you think we're running any risk that that might discourage towns to correct whatever it is that is causing folks to leave?
I can't speak for what other towns might be thinking. However, I think all the fire chiefs look at, I think I can be comfortable saying this. I think all fire chiefs look at the overall health and well-being of their firefighters, not only from a safety standpoint, but you know, their mindset and their commitment to the organization. So certainly what factors into that is wages, benefits, pension, working contract. So I think as chiefs, we look at all of those facets. We take that into consideration. We advise the city. We do our best. I can't speak to whether or not it would discourage, but once again, I think we're always looking to steer that ship in the most positive direction invest in our personnel and retain our personnel. So again, to, not to sidestep your question, I'm not quite sure what other chiefs, but I think we look at every available opportunity to prevent the case of lateral transfers or firefighters getting poached to another department through effective training, through the city's offering of pension and benefits, making them feel like maybe Milford might not have been their first choice. Again, it's funny, I could speak to this myself. I was born and raised in the city of Bridgeport. I knew it like the back of my hand. I received a job offer from Milford. Within 2-3 years later, I received a job offer from the city of Bridgeport. It was compelling to want to go because I knew those streets like the back of my hand, and I elected to stay in Milford, and obviously it was the right choice for me. But I felt valued. I felt like I found my home in Milford, and I think unfortunately some of that has eroded over the years with the reduction in the or not the wages not keeping pace and the pension and benefits not being somewhat reduced over time.
I know for a long period of time, probably in excess of 15 years, Meriden only hired people who had their full certifications. We didn't send anybody to the academy. That's changed in the last couple of years. But would you say there are still as many certified firefighters out there for the picking as there were in years past?
I haven't looked at that data, to be honest. I think there are firefighters I know that attend the Connecticut Fire Academy on their own accord or through a volunteer department. Once again, well, let's hone in on their own accord. There are people who elect to go through the academy to obtain the certification in the hopes that it makes them more attractive to a municipality to hire them. So sure, I mean, has that number increased? I can't speak to that myself. I wouldn't know, but I know they are out there and available at times. I have seen that, yes.
Okay. Thank you very much, Chief, for being here, and thank you, Representative Kennedy, for bringing him out.
Any additional questions? Chief, we benevolently welcome you back to the city of Bridgeport. I represent Bridgeport. Thank you for joining us today.
Thank you.
You all take care.
Thank you, everyone. Thank you, Senator.
You're welcome. Now we'll call Representative Haynes.
Good morning. Thank you so much for taking our seats here. I want to first reach out to the chairs and vice chairs, ranking members. Thank you for the opportunity to testify today. The first thing I'd like to do is just say I'm actually testifying on 2 different bills. And the first one is, sorry, I just lost my page here. The first one is the, well, you know what, I'm going to skip it. I did put in my testimony, but I'm here today with Waylon Page. Waylon reached out to me because he has a bleeding disorder, and he has been in Washington, D.C. this week pushing for this legislation to happen on a federal level, and he's here today to talk to us about what's going to happen here in Connecticut. We hope we can get this Stop the Bleed legislation through, and with your help, we'd like to do that. So I'm going to yield the rest of my time to Waylon.
Sounds good. Welcome, Waylon.
Yep, push the button.
Thank you. Hello, my name is Waylon Page, and I am a 13-year-old from Haddam, Connecticut. When I was 4 years old, I was diagnosed with a qualitative platelet dysfunction. The way I found out about my disorder is when I had my tonsils and adenoids removed. While I was getting them removed, I hemorrhaged. I have had many bleeds in schools and many public buildings in Connecticut where I've had no medical resources available. And having no medical resources available with my disorder is not okay, as it is very hard to get me to stop bleeding. And for my disorder, there are currently no treatments other than platelet transfusions if I have a bleed. With my disorder, I go to many out-of-state and sometimes in-state events. When I was at an event with the National Bleeding Disorder Foundation in Georgia, I saw bleeding control kits in the halls with AEDs. When I saw this, I asked my parents, why don't we have these in Connecticut? After we got back to Connecticut, I got to work on talking to our state politicians to get this bill in place. Then I went to Washington, D.C. to advocate on bleeding disorders. I had many meetings with Representative Joe Courtney's office and Senator Richard Blumenthal's office. While I was in the meetings, I explained the bill, and both offices were interested and supportive of this bill. With these kits, it would be a huge impact in the state of Connecticut. Not only will they help the bleeding disorder community of Connecticut, they will also help the general public of our state. These kits aren't like first aid kits. They are trauma kits. These kits are for any major trauma that may happen or any emergency. This bill is not just one side working on this. This is a bipartisan bill that's good for everyone's health. With this bill, there may be a cost, but you can't put a cost on saving a human life. Thank you.
Thank you. Appreciate coming out and advocating for this. It's important that we hear firsthand. So Representative Linehan.
Thank you very much. I will say that the good vice chair just said, I know Linehan's going to want to speak on this. And I said, it's my bill. So it's nice that he understands the kind of things that we're interested in. Thank you very much for being here. I will say this again, as I've said to you before, you are a very brave, great young man who is working for good. And so I'm very, very thankful for you coming forward. I'm thankful for you going to Representative Haynes so that we can work together to create really great legislation. There are some pieces of testimony about this bill that are online, and especially from the Stop the Bleed Foundation. And as you know, for the purposes, for the members of the committee here, you met with some of those Stop the Bleed doctors in my office about a month ago. And so we kind of been working together on exactly what we should do for this bill. I want to thank you for bringing forward the need for this in schools, but I think it's also really important to note that this doesn't just happen to children, right? I mean, you're going to be a full-blown adult soon, and you're going to need those kits as well. So this legislation is really important, not only for someone with a bleeding disorder like yours, but also for schools that there, God forbid, there may be a shooting or any kind of issue, medical issue that may happen in public buildings. So one of the things I want to ask you specifically, when you go to places outside of school, because I know you talked about how school is a problem, but in my office, you were talking about you were out in the wilderness and you were camping and you had a nosebleed and you had to go to a certain hospital that didn't actually have the ability to stop the bleed. Can you just tell our committee members a little bit about that incident?
Yeah, of course. So I am in the Sea Cadet program, and when I was in a training, it was a FTX training. I was in the middle of the woods and I had no treatment. I only had my medical bag. And it's a very small medical bag, so I didn't really have much in it. So I had a sinus infection that week. So with my disorder, having a sinus infection is not as normal as regular people. So I bled almost every day, multiple times, and it got to the point where on the second day, I started bleeding out of my eyes, nose, ears, and my mouth. And with my disorder, that is not, well, it's normal, but it's not as normal as what I usually get. So then my dad we're very lucky that my brother was there and that my brother called my dad when he did, because when my brother called my dad, he was getting ready to go out on a motorcycle ride. So I'm very grateful that my brother and my dad were both available for me. So then after about an hour, it would not stop bleeding. I kept bleeding for about 3 hours. And with my disorder, 3 hours is very long because usually it's about 30 minutes to 15 minutes with my bleeds. So then my parents picked me up and we had garbage bags. I filled 2 garbage bags full of bloody cloths and just it was too much for my parents to handle. So they picked me up. We made it about 2 miles, maybe not even. And my mom said to my dad, we have to pull over and call an ambulance. So we called the ambulance and we went to a gas station close by and they picked me up and they said they wanted to bring me to a hospital. And that hospital that they wanted to bring me to did not have what I needed. They did not have platelets for me to get transfused with. So my dad said that I have to go to Yale Hospital because they know me and they know what I need. And they said that they could not bring me to Yale Hospital. So my dad said, well, if you cannot bring me, then I'm putting him back in my truck and we are driving to Yale. And so the paramedic in the ambulance said, hold on a minute, let me call the hospital. And the hospital said, no, we do not have what they need. And you have to bring them to Yale. So we went to Yale and thank God that they said that they have to bring this to Yale because there was like 3 hours worth of traffic. So.
Thank you for telling that story. You know, as a parent, that just breaks my heart. And, you know, so a lot of love goes out to your parents for fighting so hard for you consistently, right? But I think that it brings up another issue that you would expect that an ambulance or a hospital would have the ability to help you or anyone who is in some sort of a bleeding emergency. And I think it illustrates just how important this legislation is, and that we as a committee might want to consider if we need to expand it into other areas as well. So I thank you for telling your story. And I think that the committee has a lot of work to do to think about exactly where these kits need to be and who needs to be trained on that. But you've done an amazing job. So have your parents and your representative. So thank you all very much for being here today. Good work.
Ranking Member Howard.
Thank you, Mr. Chairman. Wayne, I just want to say that I think that there may be a point in time where you're sitting up here. I sense that from you, and I think that the 34th district, as well as it served now, will be well served then too. I just want to point out something that you made me think of. I read this bill, and I'm embarrassed to admit this didn't immediately jump to me, but you made the point that we have AEDs in locations all over the place because everybody has a heart, and everybody's heart, in fact, will at some point stop, but everybody's heart can stop. And I think some folks may say, well, how far are we going to take this? Are we going to put EpiPens everywhere? Are we going to put glucagon and insulin all over the place? And I think that those are specific, and you have a specific disorder, but the fact of the matter is that blood loss can kill anybody, whether they have your disorder or they don't. So you made your presence here today, and the story that you told about seeing these kids on the wall actually got me thinking about that. And I wanted to say that to you because I think it's amazing that you're sitting here. I have 2 sons your age, and I can't get them to come up here for lunch, right? And you're sitting here testifying in front of all these people. It's impressive, and you made a difference in the state of Connecticut today. And I hope not just young people, but everybody in Connecticut learns from you that you can come up here and be part of your government and actually make a change. You made me think of something, even in my experience, I didn't think of. So I don't have a question for you, but I want to admire you, and I thank you very much.
Thank you.
Can I just make
Sure.
a comment on Rep. Howard's comment? The Stop the Bleed program that's being done now, and 170,000 people know how to stop the bleed now because of this program, came out of after Sandy Hook and after the Boston Marathon. So that's where this came from. It came from the American Surgeons of Trauma. And that's where this whole thing started from the very beginning. So to your point, that this is not just somebody who might have a bleeding disorder, but it's anybody.
Right.
And 40% of our deaths in this country happen because of trauma due to blood loss. So this is huge, and it's just going to make a world of difference for a lot of people. But thank you.
And thank you for bringing him here. Thank you. Thank you, Mr.
Before I call Representative Lanu, I just wanted to make a comment. Representative Howard is sitting next to a pastor. That was the most pastoral response I've heard from him since sitting next to him. So thank you for that. Representative Lanu, we're going to call you and give you a preaching license soon.
Thank you, Mr. Chairman. Representative, good to see you. Thank you for being here today. Waylon, awesome job. Thank you for your very powerful testimony. You know, hearing your account really hits home and reminds us where we really got to take a look at these kits and take a look at this legislation. I certainly want to echo my good friend Representative Howard's comments. Your democracy in action. You're making things happen. Some people watch things happen. Some people let things happen. You make things happen. So really, thank you for what you're doing. Going down to Washington, coming up here. I was just to get an idea as far as these kits go. Where do you think they should go in public places?
Yes, so when I was in Georgia, I saw them in its own box next to AEDs. So I think in schools, public buildings, and really anywhere where there are a lot of people where something could happen, I believe they should be next to AEDs and like really anywhere. Really, yeah, really anywhere like that, it would make an impact and where you can easily find it.
Right. If you could indulge me a little bit, educate me on this. Well, do you know what these kits consist of? What's in them? And
Yeah, so I know for the most part they would have markers for writing down the time on a tourniquet. They would have tourniquets, trauma blankets. They would have gauze, gloves. They would have scissors for cutting, and they would have really anything that you would need for a major trauma or that the EMS would have.
yeah, and I think certainly the Representative Howard made a good point. Bleeds happen for many different reasons. You have a disorder that you've already shared with us. You have perhaps some older people who may be on Coumadin or blood thinners or that sort of thing. Um, you have acts of violence that can result in blood loss. So there's a lot of different reasons for it, and I think these kits can really be applied to many different reasons for a bleed. Is that correct?
Yes.
Yep. Waylon, do you have any idea what one of these kits would cost?
So I really do not, but all I know is you cannot put a cost on saving a human life. So I believe the cost is not important if you can save human lives.
Yeah, understood, and I agree. And thank you again, Waylon. I got a question for Representative. Maybe Representative Haynes can help me out with this. In your testimony, I read your written testimony. You're speaking about the classes, Stop the Bleed classes. Are those currently available here in the state of Connecticut?
They are actually. One of my testifiers is supposed to be here today, and he can't because he's teaching Stop the Bleed at my high school. Sorry.
Please turn your
my
mic on.
Thank you. Yes. So the trauma surgeon that has submitted testimony, Dr. Ron Gross, was supposed to be here today, but unfortunately, he's teaching the class at our high school in town today with another doctor that's also supposed to testify today. So yes, they are available. And actually, I misspoke before. I said there was 170,000 people that were taking the course. Those were the trainers. 4.7 million people have taken this class already. So we have 170,000 trainers already available to teach this class. It's a free course. It takes 1 hour, and it's going to save tons of lives. So we appreciate your support.
And I noticed you had meticulously put in your testimony that a first responder's response time on average is 7 to 10 minutes. A bleed out time of an individual is 3 to 5 minutes. So people who are at the place on the scene need to know how to react quickly and until emergency gets there.
Absolutely.
So in the bill, I noticed there's some requirements as far as for the different types of first responders. That's to get them as trainers, if I understand that correctly.
Yeah. So again, there's this is actually the course is actually sanctioned through the DoD, and it was started again through the trauma surgeons. And actually right here in Hartford. So I mean, this thing all started right here. So it's silly that we don't have this as legislation as of yet, but I know that we're going to take care of it this year. But anyways, yes, so the trainers who are out there training it now are teaching the DoD course. And again, like I said, it takes no time. And the people, when they graduate from the class, when they finish the class, they're immediate responders, right? Because we're all here in this room, and there may not be, well, today in public safety, there's lots of paramedics and EMTs. But if we were in the Judiciary Committee, maybe there wasn't be a lot of EMTs and paramedics, but there probably would be somebody who knew how to stop the bleed.
And there's these people are certified to train and instruct in the local communities. They can reach out to community partners, to different organizations, train people in different environments how to apply the kit, how to utilize the kit in very rapid response time.
Correct.
that's-
Yep.
yeah.
And that's what we're doing in our town right now. We have, we've been through all 3 of our schools. This is our last school. We've been at town hall already. Everybody in town hall has learned how to do this. And we're going to go out to our various community organizations next.
Yep. And so, like you said, there'd be similar to like AED, CPR certified, that sort of thing. And
Correct.
and it's a 1 hour
1 hour.
1 hour. Representative, thank you so much. Waylon, it was an absolute pleasure. Your parents must be so proud. You're a great guy. That don't happen by accident. So, thank you for being up here. Thank you so
Actually, I
much.
have something to add to your first question. So I've
please.
talked to pharmacists about this, and I should be getting a pharmaceutical sponsor to cover the cost, if not cover half, to get their name on it.
Oh, that's fantastic. So, that's
Big hit.
definitely a good news. And again, thank you for all your work and being so meticulous with this, and really being such a strong proponent, and gives us a lot of hope for the future. Thanks, Waylon. Thank you, Mr. Chairman.
Thank you. Ranking Member Ciccarella.
Thank you to the good chair. I'd like to thank both of you for coming out today. Rep. Lanu asked a couple of great questions. Those were some of the ones I was going to ask. That's the problem with going last. But I did want to make a couple of comments. You know, we're here to make sure we're doing the right thing and applying common sense to situations. We talk about AEDs that are all over the place and how expensive those are, and these kits are reasonably priced, and they save lives. The training saves lives. It just makes sense. So I just want to thank you for coming up, bring this to our attention. Representative, you know, you definitely are in trouble. You know, he's passing legislation. He's finding funding for legislation. He's getting sponsors. So he has a bright future, and I agree. Your parents must be extremely proud. And look forward to all the great things that you'll do. Maybe you can help us solve some more problems up here. We could use that help. You know, there's a list of places that these will be placed similar to the 80s, and a list of individuals that will get this training. And I just have a quick question. We have first aid training. If you want to be a high school coach, you have to go through different certifications, one of which is first aid. Is this training in first aid training, basic first aid training through you?
Yes.
Not that I'm aware of. I've actually taken the EMR class, and that class does have stop the bleed tourniquet training, but I don't believe in a basic first aid class they have tourniquet and stop the bleed. This is a separate course. But there might be an EMT or a paramedic in the room that could also answer that question.
Okay, thank you for trying to answer that question. So again, I think it's important that we take a look at this. We move this across the finish line. And again, just really wanted to thank you for all of your work, and congratulations coming up here speaking so well. Some of us can't do it that well up here, so including me. So great job. Thank you for coming out.
Thank you.
And yes, Waylon, I would like to say thank you for, you know, coming today and advocating on behalf of this very important issue. And I'll just say this to you, my great friend and mentor, Congressman John Lewis, once said, when you see good trouble, you know, get in it, get in the fight, and continue to make good trouble, because the people really need the things that you're advocating for. So we appreciate you being here today. Any additional comments, questions? Seeing none, thank you, and look forward to hearing from you and seeing the great things that you'll continue to do. Representative Buckby.
must be about lunchtime and starting to thin out a little bit within the committee. But hello to my friends and colleagues. This is a lot more fun than sitting in energy. You guys have great conversations, and not that we don't spark our own there, but you seem to fuel more here when it comes to fire service, especially. So I wanted to talk to you about and just as I sit down,
Will you please
Representative
summarize,
Linehan, that
Representative?
hurts. What's that?
Will you please summarize, Representative?
Fair enough. I bring with me, and this is not typical. I've never had this opportunity before, but as Representative Howard mentioned before, with his kids not wanting to come up here, I don't have any kids, but I've got some nephews. This is my nephew right here. This is Dylan Lewis, who's also my constituent and also happens to be an Eagle Scout. So you can't have anything bad come from bringing him up to testify with me. But talking about 7199, I'm 19 years as a volunteer firefighter. I'm not as active of late as I have been. I'm also the son of a man who was 57 years before Dad passed away, 57 years as a volunteer. I love 7199 presents a lot of good things that can happen. Guys I came in with, it wasn't so much poaching, I don't think. It was more they found a love for firefighting and wanted to pursue a career in firefighting, which is great. But I can tell you in 57 years, my father never worried about taking a dime to go do it for anybody else. He did it just for the love of what it was and what it was. And that's not in any way knocking career firefighters. I think it's fantastic. But I do love the concept of the departments receiving the funding back after those guys are trained up to be able to go back and pay for some of that if they do choose a career in firefighting. I think that's a huge effort and a step. I also submitted 6624, which is my bill that talked more about retention as well and recruiting firefighters. I have an amazing kid in my hometown. Her name is Callie Thierfelder. She's a senior in high school. She's going to be going into fire service. I think she's going to be in New Haven as far as her college career. This kid busts her tail, and she came to me and said, how do we get more people to know about it? More kids my age don't know what they can do to get involved in firefighting. And I absolutely love doing this. So that's kind of the reason I put that forward, that we need to look for, again, more women in firefighting as well that are competent and capable of doing the job the same as any man who's competent and capable of doing the job. I think we need to find more women for the industry. And I think that like I said, the poaching part, I never really saw a huge part of. The other thing that was on here was 1490 is the smoke detector bill. I think it's really important. And all those houses that have smoke detectors and CO detectors, I don't know how many firefighters in this room have gone to CO calls, and that's a little bit rough on a regular basis. But I'd submitted a bill as well about gas leak detectors. And any home that has gas, any business that has gas should really be having a gas leak detector. Back in 2012, New Milford, we had a house right around the corner from my folks. They had a leak in the basement while they were away, and someone was killed in the explosion who couldn't smell it from the basement upstairs. Back 2 years ago, Darien had an explosion in the bowling alley there at the country club. And the guy who was working had COVID and couldn't smell the gas. So he had no way of knowing what was going on. Just last year, there was an issue here in Hartford with, I believe it was an empty building with daycare right there. And luckily, there was no one in the daycare next door because no one would have heard the alarms going off in an empty building. So I think it's critical that we look into having gas detectors put in. It'll be a really nice fit, like a glove, right in there with the smoke detector bill. And I think that's all I really wanted to touch base on. I wanted to thank you all too. This is, again, a fun committee, great discussion on all parts of the circle here, and you have a good attitude to this committee. I appreciate that. So thank you. I'd be happy to take any questions.
Thank you. Representatives, considering your familiarity with the great representative, do you have any questions? Any concerns, comments? Okay, DGO Von Carlo, representative.
Just one, Representative, thank you for showing up.
Thank you.
What is the price on something like gas, that kind of detector?
Gas detectors can be like $7, $8 on Amazon. They're really simple.
Okay, all right, thank you.
Yeah, absolutely.
Any additional questions? All right, seeing none, thank you so much for joining us today. Now get back and govern. Appreciate your time. Representative Yacarino, sorry. I didn't mean to say that. Yacarino. There's nothing yucky about you, Yacarino.
Good afternoon, Senator Gaston, Chairman Gaston, Chairman Boyd, Senator Chicarella, Ranking Member Chicarella, and Ranking Member Howard. My name is Representative Dave Yacarino. I served on this committee for 6 years. It's one of the best committees in the building. I think I've looked at the makeup this morning, and I think it's a really good makeup. So I'm here to support House Bill 7204, and that concerning lights on vehicles and penalties for other certain vehicles. But I'm going to turn it over to Selena Khan. But I will say, I spoke to Chairman Boyd on the hallway, and I'm ironing my shirt this morning. And to make this bill go even forward to get over the finish line, if there's any sticking point with law enforcement, we could have those blue lights on, and Selena will explain it, only when the vehicle is being at the scene with the officer there. If the officer's not there, then the lights could be taken off. I think that would make more sense. And that's sometimes, I think we all think of what we're gonna, to make a bill, you could be walking, ironing a shirt or whatever. But I think that's a fair compromise. And I did it for a living. I towed for 13 years, and it's very dangerous. Many times you're on the highway alone, bad weather, dark. So she could explain it much better than I can. But I appreciate your time, and we'll take any questions. But let Selena give her testimony. Thank you.
Can you please turn your mic on? Thank you.
Good morning, members of the committee. My name is Selena Khan, and I'm 22 years old from North Haven, Connecticut. I'm a proud graduate of Sacred Heart University. I stand before you today to advocate for a critical piece of legislation regarding the use of blue emergency lights on tow trucks in Connecticut, specifically lights that would be activated when a vehicle is being loaded in a hazardous location. The towing industry faces immense risk on a daily basis, with one tow operator killed every 6 days in the United States. This statistic does not account for the countless near-miss incidents, secondary accidents, injuries, or the many close calls that operators experience every day. Unlike other first responders or DOT personnel, tow operators are often working alone with only amber lights for warning. This lack of secondary vehicles and lack of appropriate lights providing additional protection greatly increases the risk of injury or death. I am personally invested in this issue as my father owns Nelcon Towing and Recovery, which services 9 towns across Connecticut. I am the owner of Life on the Line, a business dedicated to bringing awareness to the towing industry and the dangers that come with it. Nearly 1 year ago, I appeared before you urging support for this important bill to protect the lives of tow operators. Today, I return with a renewed sense of urgency. In August 2024, I responded to a call from a young woman who was stranded on Route 15 southbound near exit 63 in North Haven, Connecticut, where there is barely any breakdown lane. My flatbed was unable to fit entirely in the shoulder, so I quickly helped the young lady into my truck to get her out of harm's way. When I began hooking up her vehicle, I had to lay on the ground in the active lane to complete the task. During that process, my ponytail was run over by passing traffic. While I was fortunate that this incident did not result in serious harm, it illustrates how dangerously close these situations can become. Thankfully, Connecticut has not experienced any tow fatalities this past year, but many in the industry can share stories of close calls or their trucks being struck by passing vehicles. The reality is that on average, a tow operator is killed every 6 days in the United States. Additionally, this year alone, over 300 individuals have lost their lives on Connecticut roadways, a statistic displayed on all major highways throughout the state. The rising number of fatalities and close calls reflects the growing danger posed by distracted and impaired driving. All we are asking for is a simple yet vital measure, the ability to use blue emergency lights on tow trucks when loading vehicles in hazardous locations. This small change could significantly enhance the visibility of tow trucks and improve the safety of those working in this dangerous field. We know from experience that yellow lights have become normalized and are often ignored. However, when drivers see red or blue lights, they instinctively reduce their speed and exercise greater caution. By implementing blue lights on tow trucks, as several other states have done, we hope to reduce injuries and fatalities among tow operators. In our state alone, we have lost 2 operators in the last 5 years. Both individuals risked their lives to assist others. Corey Iodice out of Fairfield, Connecticut, who was a veteran tow operator and grew up in this industry, tragically lost his life on April 22, 2020. Christopher Russell, out of East Hartford, Connecticut, was selflessly assisting a motorist when he tragically lost his life on May 21st, 2022 in North Haven, Connecticut. Both of these individuals lost their lives by putting others first. Tow operators perform one of the most essential yet hazardous jobs in the country, often without the respect or recognition they deserve. It is critical that we take every possible step to protect those who risk their lives to assist others. I urge you to consider the lives of those working on the roadside and the daily dangers we face. Please support this bill, not just for the safety of tow operators, but for the safety of everyone on the road. Please help us in protecting these tow operators because our lives are on the line. Thank you for your time and consideration.
Distinguished Vice Chair DGO Van Carlo.
So thank you for being here. You know, I do support the bill, especially in those hazardous situations, but I do like what the representative added as far as with the police on scene, definitely always having law enforcement on scene. Hopefully that law enforcement obviously usually will always stay until that you know, you leave the scene and you're safe. But we did get some pushback. I know I did on the bill. I know Senator is a big fan of the bill, and I also am too. Obviously, nothing more important than your safety out there. Obviously, we all know the drivers on the roads today are not. They're just coming at you. They're not moving over. They're flying by you. No one's slowing down. So the reckless driving on the roads has increased over the last 10 years. So something I'm willing to push forward and work with you guys with. I think it's very important. Your dad's safety, everybody's safety that's on the road, our workers, our DOT workers. So I think it's something very, very important that we get something accomplished towards this goal. So thank you.
Thank you.
Could I respond, sir?
Absolutely.
So to your point, I thought about the same thing because I did it and I understand I read there is some pushback, but to alleviate that pushback, only when the operator will have the blue lights on, only when they're alone. If the law enforcement's there, you don't want to have both lights, competing lights anyway. You only want, so I would think this passes out, we could JFS, change the, S language to cut that out. But the main thing, like Ms. Khan said, is the safety of the driver, the operator, and actually everybody. So we could work that out, be great.
You want to? And I apologize, Representative, I misunderstood you. I thought as an added safety while the officer's there, your blue lights would come on. I
Right.
misunderstood you. So
No. So
you just want it in that hazardous condition where the operator's alone and a very, very dangerous situation.
then the lights would be on, but
Not
the
a-
officer's there, no lights.
Okay.
Just the officer's lights.
I
Because it would be
apologize.
competing. It would make no sense.
Yeah, I misunderstood.
You know what I'm saying? So I feel that's the best for everybody, best for law enforcement. But if the operator's there alone, you want those lights on.
So any road operators alone or any road that the operator feels they're in a really dangerous.
Yeah, if they're in
situation.
danger, but if the officer's there, you don't need the lights on.
Right. But again.
And that could be,
I do want to clarify, are you
Right.
asking for any time the tow operator is alone to have the blue lights on, or they're going to turn those blue lights on when they feel they're in a very, very dangerous
I'm
situation?
gonna let Ms. Connie answer
Yeah,
that. but
okay.
Please.
9 times out of 10, we're by ourselves hooking up these vehicles, mainly on the highway, and depending on the situation, back roads can be very busy. So only when we're in a hazardous location by ourselves without local law enforcement with their lights. If they're on the scene, there's no issue. We don't need our lights on because they're there. But they unfortunately get busy and don't have the time to always come up on the highway to provide lights for us. And so all we're asking for is when we're by ourselves in a hazardous location, to be able to put those blue lights on to protect ourselves.
Okay. All right. Thank you.
Ranking Member Chicarella.
Thank you. And thank you, Representative and Selena, for coming up. I know we were here last year, just about a year ago in transportation, trying to get this over the finish line. And I hope that we do it this year. Again, it makes sense. This is about saving lives. But I have a couple of questions so we could try to clarify some concerns. First, we talked about the blue lights that individuals tend to slow down because they see a blue light. My understanding is there was studies done. Can you speak to any information or data that you have that would indicate that people do tend to slow down when they see blue lights or red lights?
Correct. AAA provided, and I believe he's here today to give that testimony with the exact statistics, but there was studies done specifically, I believe, in Australia that stated that with these lights, people instinctively take their foot off the gas and go for the brake. And so it's been proven that these lights can protect individuals.
Excellent. Thank you for clarifying that. And when we're talking about using these lights, it's going to be in a situation where the tow truck is responding or is on scene in the process of hooking up a vehicle, and they will only be in the rear of the vehicle and only when parked. Is that correct?
Correct. Only when we're on scene by ourselves in a hazardous location, the lights are only going to be at the rear. That's the only thing that we need necessary because oncoming traffic can be able to see us from the rear. That's all we're asking for.
Excellent. And right now, would anything stop you from maybe getting a cone and putting a cone a few feet away from your vehicle and putting any light you want on there?
Specifically in Connecticut, I believe that there is something regarding you can't have red or blue lights on a cone. At least that's what I was told. So we can't use those because there's restrictions when it comes to blue and red lights in the state of Connecticut. Nobody can just put them on a cone. Nobody can just regulate them. We have to go through this process in order to protect ourselves.
Okay. I'll have to look at that a little bit further. My understanding was if it wasn't fixed to the vehicle, you could put a light on a cone. But the problem with that is, and I think we talked about this, and maybe I had other conversations with other operators as well, you're running another risk to go and get that cone after you already hooked up the vehicle. And if you can do that, it just simply doesn't make any sense to not be able to put them on the vehicle, making your job a little safer. I do know that you actually tow, right? You go out, you tow vehicles. You showed me videos,
Yep.
how dangerous it was. The cars are zipping by literally inches away from the camera and where you were. And that has to be absolutely terrifying to every day go out there and be worried. And this is just one, in my opinion, common sense measure. And I think we have to find a way that the individuals that may have issue with this to address them with common sense, find a middle ground and be able to get this passed this year because we don't want another tragic event. And if it could save one life, we did our job here today. I know that this conversation happened a couple of times. You've talked about the data every 6 days, someone dies, but you also mentioned people are getting hurt every
Yeah.
day.
That doesn't take into account the close calls, the injuries to the drivers or the trucks being hit. This year alone, I believe with my father's company, 3 or 4 of our trucks were hit. Luckily, none of our operators were injured, but that's not also counting across the state. There's numerous amounts of tow companies. And if you ask any driver, they can tell a story of somebody that's been hit and not killed, but has an injury. Someone's truck getting hit, it's not taking into account that data.
Excellent. Well, again, I want to thank both of you for coming up and testifying. And as Representative Buckby said, we have a great committee. We work very well together, and I'm hoping that we could get this across the finish line and do some good for your profession. Thank you so much for coming up and testifying.
Any additional questions? Representative DiCaprio.
Thank you, Mr. Chair. And I just, as one that spent probably about 18 years working on the highways in Connecticut and responding to an incident myself for the DEP Emergency Response Unit, getting passed on the road by a citizen, getting passed with your lights and sirens on. It is very dangerous on our highways. And the tow operators we encountered were professionals, and I just wanted to thank you for coming in and sharing this. And the statistics are very alarming, every 6 days, and that doesn't take into account the people getting injured. So I would just encourage all of us to really look at this issue and see what we can do for this. And you've already made very clear, we're not putting on lights responding. We're talking about being stationary in a very hazardous condition. And for the fire and police folks in the room that have been out on the roadways, the hazards. But for others, I'll just tell you, it is very, very hazardous. When I had new staff come into our group, the first thing I said, don't be afraid of the hazardous material or the reacting chemical or this kind of thing. When you're out on the highway, that's the most dangerous part of our job, because you can't pick where the accident happens, and so those kind of things. So thank you again for coming. Thank you, Mr. Chair.
Thank you. Good representative.
Thank you, Mr. Chair. And I submitted testimony, and I'm willing to work with the committee to change some S language. And I want to thank the cons. I did it for a living years ago. Traffic was bad then. It's much worse today. It's much more dangerous today. So please consider this. Thank you.
No, thank you so much, and we appreciate your advocacy and look forward to working with you on this. Any additional questions, comments from members of the committee? Okay, seeing none, thank you for your testimony today, and you all have a wonderful day. Representative Wood, welcome to the Public Safety Committee.
Hi, good afternoon. Thank you for having me. My name is Carrie Wood. I represent Rocky Hill and Weathersfield, and I'm here to testify in support of HB 7204. I just want to share with everyone kind of what's going on in Rocky Hill and Weathersfield. I talked to the fire chief this morning just to get an update. In February 2025 was the most violent month on the roads between exits 23 and 24. Out of 28 days, they were there 17 times. At the end of January, there were 7 rollovers in 3 days. And I can't really quantify the cost of what this is to our town's municipal services, as in fire, police, and EMS. The state is both paying for this through the Highway Reimbursement Fund. Every time Rocky Hill and Weathersfield's volunteer departments do get deployed, there is a reimbursement that they can apply for. And additionally, our town's property taxes are having to cover the cost. But the numbers from our local PD and fire are higher than they've ever been, including February of 2025. The fire chief often expresses he's never seen more high speed and violent accidents that he has in modern day. Just yesterday, a gentleman was clocked at 120 miles an hour. The state police could not chase him, so they had his license plate and were able to show up at his house and arrest him when he did come home. The clear cutting that happened from Connecticut's DOT, that I like to refer to as the Great Tree Massacre, has literally opened up the highway between exits 23 and 24 so that it's a raceway. There's no buffers. There's, just again, increasing high speeds. And I did put in a bill through Transportation Committee to increase the habitat along the highway just to kind of slow traffic there. So I love the idea of the safety corridor. I love the idea of putting more more tools in the hands of our law enforcement. And I just want to also come from the perspective of the Insurance and Real Estate Committee. Connecticut's high rate of reckless driving, high rates of DUI and wrong way driving is impacting the cost of our auto insurance. Our rates are skyrocketing because of the dangers of our roads, and we really need to prioritize roadway safety. I think this bill is a great start. It's not the be all end all. I know there's other tools provided through cameras and other means, but I do think this is a start as a way to address roadway safety, and I can't thank the committee enough for taking this up. Thank you so much for your time.
Thank you. Any questions, comments from members of the committee? All righty. Seeing none, thank you so much for joining us on today. We really appreciate your time. We're now, speaking of public safety, we're going to put this Rolls Royce a little bit into gear so we can move a little faster. So could we please put the timer on for 3 minutes for the public? Connecticut Police Chiefs Association, LJ Fusaro, thanks for joining us.
Thank you, Chair Gaston and Co-Chair Boyd, and Ranking Member Ciccarella, honorable members of the Public Safety Committee, and of course, Representative Howard. I've got your application. We're ready for you to make the jump across the Mystic River over to Groton. So I'm here on behalf of the Connecticut Police Chiefs Association to speak about House Bill 7204. Overall, CPCA supports the intentions of this bill, which seeks to enhance the safety on Connecticut's roadways. However, we do have some questions and concerns about certain areas of the bill and remain open to collaborating on suggested revisions that could strengthen the bill. When it comes to traffic safety, in recent years, Connecticut has experienced a significant rise in the hazardous driving behaviors of operators, accompanied by an alarming increase in traffic fatalities on both rural roads and limited access highways. We commend the Public Safety Committee for taking action to address these troubling trends. We also see that there's a rise in instances where offenders attempt to evade police officers during traffic stops. Increased enforcement and heightened penalties for violators can improve highway safety and ultimately reduce traffic-related fatalities. In my written testimony, I laid out some points, but I can highlight them quickly. First, the emergency lights on vehicles, what you just heard about. We certainly believe that it's essential for public safety agencies and associated response services to sufficiently illuminate their vehicles, especially near accident scenes, crime scenes, disabled vehicles, hazards, and construction sites, especially during inclement weather and low visibility situations. This enhances their safety as well as those they're protecting. However, expanding the use of blue lights may create some confusion among the motoring public, as blue lights and red lights typically signify law enforcement. We usually activate those for omnipresence. We're on patrol, and it might desensitize motorists and unnecessarily alarm them in specific scenarios. Again, we remain open to suggestion and would like to discuss it further. As far as increased penalties, we support the proposed enhancement for increased penalties. Particularly critical are those provisions that increase penalties for operators who disregard an officer's signal or initiate a vehicle pursuit. We strongly advocate for categorizing attempts to evade officers to be a felony. We believe such charge is justifiable given the risk posed to the public by those who willfully refuse to comply with the law enforcement when they are stopped. Section 7 also highlights the odor of cannabis. We believe this is important to help build reasonable suspicion or probable cause when trying to determine if someone's operating under the influence. In regards to the police phlebotomy program, our membership reflects varied opinions on this. However, we endorse a continued study into the efficacy and practicality of allowing certain law enforcement officers to conduct this. Safety inspections as it relates to law enforcement vehicles, where I understand DESP and DMV will conduct inspections of law enforcement vehicles. There's several questions we have that arise out of the necessity for this, but also what would constitute the selection criteria for departments to be identified and the potential cost to municipalities. We also support the establishment of traffic safety corridors outlined in this bill, although I understand most of that is on limited access highways. We endorse the pilot program for GPS sensors to be utilized by certain police vehicles, and certainly there's some questions about the review of certain recordings where we feel it should remain focused on specific use of force situations. Happy to answer any questions.
Thank you so much. You do a wonderful job summarizing. I think we can learn something from you. You wrapped up relatively quickly.
There's a lot in that bill.
Absolutely. Representative Quinn.
Thank you, Mr. Chairman. And Chief, thank you very much for being here. Has your department kept any statistics on how many times you've pulled somebody over with the odor of marijuana and not have been able to do anything about it because your probable cause wasn't any more than the odor?
No, we don't have statistics on that. I can kind of speak to it anecdotally, though. We've seen this as a problem. And in fact, I sat here and some of my colleagues sat here for many years testifying against the marijuana bill for just that reason, because, we don't have the ability on the roadside to test for marijuana. That's one of the problems. The odor of marijuana is just a building block to lead to that reasonable suspicion, that probable cause that would allow an officer to make an arrest. It's one of many factors that we should be considering, and not having that ability right now is problematic. I don't think I'm telling anyone in this room anything that they haven't seen already, but we detect the odor of marijuana pretty regularly in a variety of different atmospheres. We want to make sure that the motoring public gets out there operating vehicles safely, and our job is to take those people that aren't off the road.
Okay, thank you.
Representative Howard.
Thank you, Chief. If I did come, you would rue the day you asked me to. I think Chief Del Grosso will tell you that. Plus, my time is limited. It's down to the last couple of years, 2 years, 6 months, and 20 days.
Who's counting?
Yeah, but thank you for your testimony. This is a comprehensive bill. I want to start in Section 9. That's the inspections of vehicles. Do you have inspections of your vehicles regularly? Your patrol officers do inspections, your maintenance people, et cetera?
We do it daily. We're required as part of accreditation to do daily inspections. Each officer, when they gets into a patrol vehicle, has to do a serviceability inspection around the vehicle to make sure the contents are there, do a cursory inspection, and they're brought for routine maintenance to our town garage.
So would Section 9 benefit you in any way?
I don't see how it would. I would think that it might incur additional costs for the department to
Right.
enact that.
Okay, and you've, to my knowledge, never had complaints of your officers come and saying that the vehicles are unsafe. You haven't had any accidents. Are you aware of any chiefs in the state? I know that, you speak to the other chiefs where they're having accidents or problems because their vehicles aren't regularly inspected.
Not that I'm aware of. I'm sure every officer in the state of Connecticut would love to have a brand new cruiser that they're driving every day, but that's just not a practical way of doing business.
Yeah, I usually take the old ones and give them to detectives, but,
Only the good ones.
yeah. The other thing is, on a serious note, is this phlebotomy thing. You guys aren't doing it yet, right?
We are not.
Down in our area, I know Montville is. There anybody else?
I believe Waterford.
Okay, and when your conversations with Chief Blanchett and Chief Balstrozzi, if you had them, has their program been successful?
I don't know. You know, I can tell you in among the board of directors for the Connecticut Police Chiefs Association, we've had some discussions about this. And as I put in my testimony, there's varied opinions about
I
the
know.
practicality for departments. Some wholeheartedly endorse it, others do not. And there's a lot of challenges that we need to be aware of when it comes to police officers drawing blood. So that's why we've kind of taken a neutral position on this, because there's even some disagreement among our own membership.
Well, I can appreciate that. I think some of the things that I've heard is concern for liability, for starters.
Absolutely.
Well, let's just dispel some things between us here.
Sure.
Yeah, oftentimes it's like, we don't want cops drawing blood on the side of the road. We're in agreement that that's not a reality, right? We're not talking about the side of the road.
Correct. Too
Okay.
many problems with that.
Right. So we're discussing a phlebotomy program where when somebody's under arrest for operating under the influence, the test would be conducted either in a hospital setting or even perhaps in a booking room that's appropriately clean. Doesn't have to be sterile. You know, when you go to labs, they're not sterile, but that's what we're talking about. So if we had legislation that basically enabled law enforcement officers and we, the state, provided the training for that, because my understanding is that Commissioner Eucalito is willing and has the federal funds to provide the training. If we pass legislation that provided training and sort of made it a may and not a shall, where the chiefs who were interested in it, especially the ones that, like, your police department, your town is next door to a city with a hospital.
Mhm.
So for your officers to get somebody within that 2-hour time frame to a hospital is fairly reasonable. But perhaps up in Talon County, Litchfield County, it's not as reasonable. So if some of those chiefs wanted to do it and we had enabling language with funding, do you think CPCA would support it then if it was sort of an opt-in?
Sure, I think the may is much better than the shall. There are, as you indicated, there's concerns. There's also, some departments can support that. And what I mean by that is if you have a limited amount of officers on each shift, if one of them's tied up, much like DRE in a post-arrest examination, whether it's drawing blood or doing DRE testing, that's all done post-arrest. So that officer's going to be tied up for a little bit. If it's a Friday or Saturday night and you're in a municipality that's very busy, there's other challenges that you have to worry about. So I would agree with your comments there. Rather than a mandatory program, having a voluntary program, I think might be a good place to start.
And the, Rep. Quinn talked about the marijuana stuff. That's been a big bone of contention of mine. Going back to Commissioner Eucalito, who has expressed his great concern over the fatality rates on our highways, and I join him in that and working towards it every day here. In 2021, the fatality rate started to spike, and it's, on a wavelength, but a high one since. But a lot of things happened, right? Traffic stops went very low. We legalized marijuana. We just coming out of the pandemic. You've been a police officer for a long time. Why do you think that the fatality rate is up so high? I mean, the vehicles are safer.
Sure.
The previous speaker, Representative Wood, talked about, the dangers of the high speeds in her district. What is your opinion as to that, and how does that fit into the phlebotomy and the drug testing?
I think you hit on a couple of those factors, right? Enforcement index is down. Traffic accidents, speeds are higher, right? People are out there operating more unsafe. I can tell you, I drive a police car every day. I can't affect a traffic stop outside of my jurisdiction anymore. When I was a state trooper, which I did before I got this job, we would affect traffic stops all over the state. There's less cops on the road. There is more ways for people to operate hazardly. We've allowed marijuana. We've legalized it. That ship has sailed. But yet, some of the effects of not just alcohol, prescription drug, marijuana, polydrug, all those things are challenges that we're dealing with out on the road with unsafe operators. We arrest hazardous operators every day for being under the influence of a variety of different things. You pointed to it, officers for a time there were afraid, we meaning law enforcement leaders, kept officers from doing a lot of proactive stops because we didn't know how we were going to be impacted by COVID. Police accountability hit, and it's a reality that officers were reluctant to do things, facing additional complaints, challenges, the potential for lawsuits. Officers were concerned about that stuff. They remain concerned about that. So all of the things that you highlighted there are reasons why that's changed. And we've also seen a recruitment and retention problem among law enforcement throughout the state and across the United States. We're hoping that that trend is changing, but all those factors play into why our roads aren't as safe as they once were.
And you know, in your police department, would you say that you would trust 100% of your officers know how to conduct standardized field sobriety tests for alcohol?
Yeah, our patrol officers are very adept at it and very proactive.
And anecdotally, what percentage of your officers you think are properly trained to recognize somebody driving under the influence of marijuana or any other drug?
Other than the operation itself, and those other things that I mentioned previously about those building blocks to stop a vehicle, to determine if someone is under the influence, you know, it's a little bit different game when it comes to marijuana. And again, that's one of those reasons why we testified for many years up here, why we had some concerns about the legalization of marijuana.
And then, but it's your opinion, right, that marijuana does impair someone's ability to drive?
It certainly does, and so does an alcohol, prescription drugs, a variety of other illegal substances as well.
But if you see somebody's, because we have our statutes, difficult as they are to enforce, does create a zero tolerance for marijuana. So would you say that if you see somebody smoking marijuana while driving, that's clear evidence that they're driving while impaired, since it's zero tolerance?
Certainly, it kind of runs, it's counterintuitive to us in law enforcement that if someone's drinking a beer and operating a vehicle, or you can stop them, and that's a problem. That's something that we would use, and we would enforce that. We can't do the same right now with marijuana. It just doesn't seem to make sense. And I heard comments before about common sense. That, to me, that's common sense. If an officer sees someone that's smoking marijuana, detects the odor of marijuana emanating from the vehicle as it's in operation, I think they have a duty to stop that vehicle to make sure that that operator is operating in a safe manner, that they're not under the influence. Right now, we just aren't able to do that.
Yeah, and that's a problem. All
I
right,
think it's a
well,
big
thank
problem.
you, Chief. Thanks for your support. Thank you for your support on the other bill this morning. It's always a pleasure to have you here. Thanks for making the drive up.
Thank you. And I'll get that application to you either way.
Thank you.
Ranking Member Ciccarella.
Thank you. And thank you, Chief, for coming here and testifying. Representative Howard made a very valid point regarding the challenges when it comes to marijuana. You know, we legalized marijuana, but it is not legal to smoke marijuana or consume marijuana and drive. We talked about common sense. And if an officer is seeing someone, you know, literally smoking marijuana, they cannot pull them over. And would it be safe to say that marijuana could impair someone's driving?
Undoubtedly.
So you would say it's common sense that we make the law change that would allow officers to pull someone over if they see them doing drugs and driving?
We would certainly like to see that. We think that would make the roadways safer.
And that was going to be the next question. Would this help when it comes to the roadway safety? In section 2, it talks about tinted windows. What are some of the challenges or concerns of officers if there's an extreme tint on the vehicles?
From a practical safety standpoint, when an officer, if they were conducting a motor vehicle stop or approaching a vehicle for some reason that has tint and unable to see into it, that certainly heightens their concern that there may be some illegal activity afoot, or it could be something that certainly brings their senses of officer safety to a higher alert level. You know, not knowing what's happening in that vehicle. Officers, when we approach a car, we always want to see what the operator and the occupants are doing. We want to see their hands. We want to make sure that they're not doing anything that might hurt us, or that they're not preparing to flee the scene. So being unable to see in a car is a problem for police officers. I think every one of us will tell you that, yeah, we want to be able to see inside that vehicle. We want to make sure that those tints are legal so that we can approach. When they're operating on a roadway, hard to see what they're doing. You know, if they were consuming a bottle of beer or some other alcohol or some illegal substance, we would want to be able to see that. So again, we could conduct a traffic stop, determine if there was any illegal activity, or if the person that was operating the vehicle was under the influence of something. Those are things that we would, you know, that are prohibited by having a higher degree of tint.
Understood. And, you know, in the situation where an officer pulls over a vehicle, does the person being pulled over have to roll their windows down all the way?
Not necessarily.
Okay. So it makes sense that you guys could see what's in
Certainly.
there for the safety of the officer. Okay. And then I stepped out for a minute. One of my colleagues mentioned that you talked about Section 1 for a minute, and you were in opposition of the wreckers having blue lights on the vehicle.
We certainly have concerns for a few reasons. We understand and appreciate the dangers that are associated with, trust me, I've been on the Gold Star Bridge when it's moving. I've been in my career on the sides of the highway with wrecker operators who do a phenomenal job. And we have some concerns about maybe confusing the public as to what lights signify a police car, what may represent a fire truck, and what may represent some other vehicle like a tow truck or a DOT truck or things of that nature.
Understood. I could see where individuals may, see a light and say, oh, what is it? There's a lot of different lights on the road. But besides someone not knowing what vehicle's up ahead, whether it's a police car, or a fire truck, or a tow truck, they're seeing it, they're being alerted. What would be some of the cons, if you will, to them having that on the vehicle besides confusion?
Yeah, again, I think people are used to seeing police cars with red and blue lights. They're, fire trucks for the most part have red lights. Obscuring that for maybe the public, confusing them. That's, we have some concerns. It's not stuff that I don't think we're unable to work through, but I do think it does present a little bit of confusion for folks out there. But you're not getting an argument about the hazards out there, that the fact that more lights, we've seen that here in Connecticut with a DOT worker and a state trooper killed in the last year and a half on the side of the road. And I don't know that it made a difference what color the lights were. They're not with us anymore. But, anything that, we're certainly supportive of any enhancements for safety, not just for us, but for wrecker operators, for people who are out there on the roadways. We know how dangerous it is. Trust me, we understand their plight and the concern that they have.
Sure. No, absolutely. And we hear about it all the time, even with our fire apparatuses using the truck as a blocking vehicle, has its lights on, and those cars are still getting hit.
Absolutely.
And that is a concern. And I do understand some people are just going to disregard the law regardless. And a sight of a police officer isn't going to deter them from speeding or do anything else. And we can't address that with this bill with the blue lights on the wreckers. But, I do believe that if we could find a common ground where it's in the rear of the vehicle, they're not allowed to drive with the vehicle, and it could save a life. I'm not saying I want to deceive anyone, but we want them to realize that there's somebody up there. And maybe if they do think it's a first responder, maybe they will slow down. At least a law-abiding citizen that may just be distracted and does normally follow the law, it could save a life. So I'd love to find a middle ground there to address everybody's concerns while still giving the tools to our operators that are towing these vehicles, clearing the roadways safely, which is a big help to you guys. I know we had some towing issues, and Commissioner of DESP, Renell Higgins, talked about the good work that they do and how quick we need to get these things cleared. We understand that there is dangers. I guess just one last question, and we have a bill about recruitment and retention. I know our numbers are down and our officers are busy, overworked, and we do want to address that. When I was talking to the individual that was speaking on behalf of the wrecker bill, I asked her, how often is an officer actually on scene with you when towing? And she said, not often. Matter of fact, it would be more times than not. Do you have any indication if an officer sees a wrecker that they're going to pull over to put their lights on?
My experience has been usually the opposite of that. That it's the officer that's stopping for a disabled vehicle or a vehicle involved in a traffic accident, and the officer's usually there. I've been that officer many times, both in my prior career and as well as, if I'm driving my assigned vehicle and there's a hazardous vehicle stopped either on the highway or one of the roadways in my town, I'll stop for it and I'll assist and call for a wrecker, wait for one to arrive and to try and facilitate a safe, recovery of that vehicle or getting that car operating again and off the road. I haven't witnessed that. I've seen mostly the opposite. I think if there is if you're on patrol and there's something that happens in your patrol area, unless you're tied up for some other reason, you're going to stop and maybe assist. If you're called to another type of incident, a more pressing need for your services, you're going to leave. We have to triage calls from time to time, so that could be the case, and it may depend on, where that happens. In a rural area, it may be more common than in an urban or a suburban area where there's more police officers. As I said, many times in my current career, and certainly in my state police career, we would stop for a disabled vehicle. We would wait till the wrecker arrived. We'd help facilitate them because we do know how dangerous it is. I used to carry a box of flares in the back seat of my car. You'd go out and put out flares just to make sure that you created additional illumination to try and keep it that much more safe and alert people to the hazard.
Absolutely. And you know, if this didn't make it through, and there was another solution, like every time a wrecker was going out and it was dark, that they would request an officer, would that be something that you guys would be interested in entertaining?
Yeah, again, within reason, right? I mean, one of the, you mentioned recruiting and retention of police officers. There's a bit of a shortage right there now. So to the extent that we can provide that and we don't have other calls to answer, I think most departments would have to determine whether they had the ability to do that at a particular time or not.
Sure. Yeah, I can see how that would be a challenge with recruitment attention. And most officers are working really hard, not this one. And we want to make sure that that they're able to do their job. We don't give them more tasks. But we just want to find that balance.
Sure.
We want to strike that balance to make sure these professionals are safe, and any deterrent that could keep them safe is something I'm open to. And I hope that we will be able to find a balance on that. And I know everybody's very territorial with the lights. Last year we brought it up and I almost got beat up in the hallways. So I understand, but we do have to find a middle ground here. I thank you very much, Chief, for testifying and all that you do. Thank you for your
Senator.
service.
Thank you, Senator. Representative DG Von Carlo.
Hi, Chief. Good afternoon.
Good afternoon.
I want to just touch base with you on the viewing of the body camera change that was made. I'm going to read the old statute, the old language from 2015. If a police officer is giving a formal statement about the use of force, or if a police officer is subject of a disciplinary investigation in which a recording from body-worn recording equipment is being considered as part of a review of an incident, the officer shall, number one, have the right to review such recording in the presence of the officer's attorney or labor representative, and two, have the right to review recordings from other body-worn recording equipment capturing the officer's image or voice during the incident. Post new language now reads, if a police officer is giving a formal statement about the use of force, or if a police officer is the subject of a disciplinary investigation arising from a use of force, in which a recording from body-worn recording equipment or a dashboard camera, which a remote recorder is being considered as part of the review of an incident, the officer shall, number one, have the right to review such recording in the presence of the officer's attorney and labor representative, and has the right to review recordings from other body-worn recording equipment capturing the officer's image or voice during the incident. Now, the wording of the arising of a use of force now limits that officer's ability to go back and review that body camera footage. And no time since 2015 has that officer not had that right. And I'll ask you, the person making the complaint, would they have the right to FOI that camera footage and review it?
Under most circumstances, yes.
Yet the officer would not have that right no longer.
Yeah, well, I don't think this prohibits the officer from seeing it, and I would suggest that, I had a discussion with several of my colleagues about this very issue yesterday in preparation for this testimony. I think our concern is that most of the time, officers are going to have access to that. By and large, it would be a rare instances where they didn't, but there may be some unique sets of circumstances where a department is conducting a misconduct or malfeasance investigation, where some of that may be instrumental and part and parcel to the investigation itself. So there are very rare instances, but conceivably, some of my colleagues discussing it did come up with some scenarios or some ideas where that could be a problem. By and large, though, I would submit to you that most of the time we do want our officers reviewing that and seeing that.
Then, no disrespect, Chief, then why change the language? You've changed language that limits, it does, you've cut out a disciplinary investigation. That's, you basically have zeroed it into a use of force incident. That's about the only time an officer can view that body camera. So a month goes by, I can't recall the complaint that's being made. They may have looked at the recording, they may have seen it. I haven't seen it. Now I'm not allowed to see it. I think it's language that absolutely has to be looked at. I think you are absolutely, jackpotting that officer to a lot of answers in an investigation where I don't recall. I don't recall, because that's going to be my answer. If I can't, how a complainant can have a right to look at a video or view it, and the officer cannot, is actually troubling to me, and troubling that it came from Post. So I'm not sure what your opinion is. I'd like to hear your opinion on it, or what was the thinking behind absolutely in a day and age where, the officers has been last 10 years or how many years it's been, I don't know, has been under serious scrutiny, you would make the job even more difficult for that officer. And I'd like to hear, you know, the rationale of changing that language.
Sure, yeah, I think we were responding to what was written in the bill. It wasn't our assertion to change anything, but, you know, trying to respond to what was written in there. Again, you know, I think under most circumstances, despite what some, we're not the enemy when it comes to having those discussions when an officer is under scrutiny. Our hope is that we're going to clear that officer. That officer didn't do anything that wasn't problematic behavior. You know, we want that to be the outcome. Sometimes it isn't, though, and the reality of it is sometimes officers make mistakes or do things wrong. But in this particular case, it was my understanding that this was geared towards the use of force investigations.
So if you're not the enemy and you want to see the officer, you know, go on with his career, why do you have a problem with the language as it's worded?
I would like to take another look at it and see and have some clarification, because the way I understood it, again, some of these, there was a lot in this bill that we went through in a short amount of time to prepare for today. So I'd certainly welcome further discussions. And I'm happy to do that.
I'd like you to look at the language, and it's absolutely disturbing language as far as from an officer's point of view, and in a day and age where, you know what, the camera is placed there for that reason. That body camera is placed there now because everything, the scrutiny, the transparency, you put the camera on the officer and someone makes a complaint against him, and now we can't use the camera. I mean, the common sense and the logic is it's kind of
Sure.
it's just, as a police officer, it's disturbing to me. But
Again, I don't think this prohibits the officer from being able to see that, or doesn't say that we can't share it. And I would agree with you that since we went to body cameras in my department in 2017, our officers have been accused of many things, and those body cameras have cleared them of any wrongdoing.
Correct,
So I'm happy about that.
I'm not an attorney, but it says investigating arising from a use of force. That's it. It doesn't say anymore disciplinary investigations. It says arising from a use of force only. That's what I read it as the language. So I would hope that Post, you know, does respond to this or does make a change to the language, because it's again, I think you've now narrowed the scope of the officer's protection. Everybody else has the protection as usual, but not the officer. So I hope that it's something that you guys would look into and Post would look into. So
Absolutely, and I would certainly concur that Post, you know, I'll speak with the chairman of Post about that as well, and I have, so we can maybe offer some clarity as to what our position is.
Thank you, Chief.
Yeah, and I think to be the teacher here and give out some homework, if you guys could follow up, if you could have those conversations, and then the vice chair follow up directly.
Sure.
You know, so we can make sure as we're approaching our JF deadline that we have it right and we have consensus on what we should be doing there. So I'd appreciate it if you guys could do that. So any other questions from Representative Hall?
Good afternoon, Chief. Thank you for being here. Just really probably more comments than questions, but on the phlebotomy piece, I can just say years ago in one of my towns in Enfield, for example, the police department ran the whole EMS program for the town for many, many years. And it was always a major, major issue for our chiefs and our police officers, because they were always spread so thin. They would respond to ambulance calls. They would be off the road for their regular, you know, public safety jobs. So it was always a real huge issue for our department. So by adding another layer of something that we expect in the way of the phlebotomy is, from what I'm hearing from you, and Commissioner Higgins isn't too thrilled with it either. Can you kind of expand a little bit on that? And I mean, just having a conversation with a couple of police officers in our town, they're concerned about the liability piece of it alone. So we ask a lot of our law enforcement, and this just feels like one more layer. So maybe you can talk a little bit more about that.
Sure. You know, we do ask a lot of our law enforcement officers today, and there's things that we do today that we didn't do at the start of my career. And we keep adding things to that. And some of the services that used to be available to officers back when I started are no longer there. But to your point, as far as phlebotomy, that's just an additional thing that we're asking our officers to do. So, frankly, as I testified previously, some of the departments embrace it. Some of it are open-minded and want to consider doing that. So to the extent that this is an exploratory type of program, but there is a lot we're asking our officers to do today. And this is one more thing We've embraced many things. We're dealing, I know that there's another bill that is going to come before you that talks about police social workers, and we've embraced that as well, because there are things that our officers are asked to do out on the street, which really doesn't have a criminal nexus. Homelessness isn't a criminal, it isn't a crime, mental illness is not a crime. There are things that our officers are dealing with daily. This is, getting the evidence of someone being under the influence of something is certainly, it is something that we want. The other things that were previously used, like urine, is starting to go away, so our officers can no longer use that. A breathalyzer does not detect anything other than alcohol. To my, the point I made earlier, we can't put someone on a breathalyzer to find out if they've been smoking marijuana or using prescription medication or other things. It tells us, what the alcohol limit is in their breath. So that's one of those reasons, one of those arguments for it, that, hey, we're limited in certain areas to detect what the substances that person was utilizing to be under the influence. So, the police phlebotomy program, which has been successful in other parts of the country, is something that we think we should consider. And in whether a department adopts that or not, there may be a variety of factors they need to consider.
Good, thank you. Thank you for that. I know that our EMS program is now run separately from the police department, and I can tell you they couldn't wait to get rid of it. I mean, the officers and the police department, it was just the training mechanism and trying to manage and juggle all that on top of everything else was just mind-boggling and overwhelming. So I agree with you. I think it would be a workable situation if it was a may, and leave it up to the departments to decide for themselves if it's something that they want to pursue. But I absolutely agree with the fact that a shall is the wrong way to approach this. So thank you for coming, and thank you for your testimony.
Thank you, Representative Hall.
Thank you. Any additional questions, comments from members of the committee? Alrighty, seeing none, thank you so much for joining us today, Chief. We appreciate your time.
Have a good afternoon.
At this time, we have Dan Starvish to come from 1AFF Local. Welcome to the Public Safety Committee.
Good afternoon. I'm Dan Starvish, president of the International Association of Firefighters of Local S15. That's part of the Connecticut Police and Fire Union. We represent hundreds of members across various public safety roles. I specifically represent over 100 firefighters, fire inspectors, and fire instructors that are state employees who work at the Connecticut Air National Guard, CT Airport Authority, Department of Developmental Services, UConn, the Fire Academy, and other various college locations. I'm here today to voice my support for the important initiative regarding the ability of the UConn Fire Department to provide paramedic coverage to the Storrs campus. Currently, these firefighters who are licensed and ready to provide this critical service may only do so when on duty at the Farmington campus. The same personnel work between both locations, and their ability to perform as paramedics needs to be expanded to ensure these capabilities are serviceable at both locations. Currently, Wyndham Hospital paramedics provide this paramedic coverage, and they do a great job. That's not in dispute. They are tasked with an extremely large coverage area, and this can result in response times that are often long, and that's not their fault. They are also a finite resource that is stretched thin across this area, and this does create instances where they are simply unavailable due to being tasked with other emergencies. With the UConn Fire Department having the staff on duty already in Storrs, if they are allowed to operate at their paramedic capacity, it will immediately decrease those response times for critical life-saving care on the campus. We appreciate this committee's work to bring this critical public safety measure to the forefront and reach a solution to better protect and serve those who live or visit the Storrs campus. The trickle-down impact of having more paramedics available faster will be instrumental to the entire surrounding region. As this committee is well aware, recruiting and retaining first responders is difficult, leading to short staffing of resources. These resources are becoming more scarce and simultaneously in more demand. At UConn, the personnel are ready to work, they are trained, the equipment's available, and now we must get this over the final hurdle to make the paramedics of UConn Fire Department able to do their job at the exceptional level they are capable of. Lastly, I can't help but mention how impressive this young man was behind me. Our firefighters at Bradley Airport train other airport employees on Stop the Bleed programs, and this critical training can't be supported enough. With that, I thank you, and if you have any questions, I'm happy to take them.
Thank you. Appreciate it. You know, for a second there, Chief Renshaw had a smile on his face, like you were calling him a young man, and then, but absolutely. Dan, do you know of, we talked about it being a little bit unprecedented before. Do you know of any other situation in the state where there's a supplemental paramedic for something other than a full municipality, right? I'm aware of
No, I'm not.
municipalities that have, you know, KB ambulance at one point was a supplemental for the town of Killingly. Do you know of any other situation where something other than the entire municipality has a supplemental ALS?
I do not know of any, no.
Okay, so the earlier testimony, how this is fairly unique and not normal to the OEMS process, you would concur with that?
I would concur with that. And based on the situation at hand, and I refer back to the finite of resources, you know, as Governor Lamont mentioned with paramedic licensing, potentially that cost being eliminated in some of his proposals.
Yeah.
He mentioned there's only 2,780 paramedics licensed in the state, and a significantly less amount of them are actually working. So the supplemental thing may become more common, and this could be the first opportunity to make quick, impactful differences, and we can start right at UConn.
Very good. Thank you for your testimony. Questions from members of the committee? Representative.
Thank you, Mr. Chairman. Good afternoon. It's good to see you. Thank you for your testimony. I was not aware that if fire department was in need to try and adjust for additional staff personnel certifications, et cetera, that we would have to go through of trying to pass a state bill for what it is that you and the rest of your team of firefighters would need in order to do your job. So I hope that I appreciate the testimony. I appreciate you going into grave detail and to expand so that DPH is able to get what it is that you guys need in order to do your jobs. So thank you for your service.
Thank you.
All right. Any additional questions, comments from members of the committee? Representative Jenga.
Yes. Thank you for your testimony. Regarding this matter, and there's a given process, the Office of OEMS, do you think that should be the normal process for this proposal?
So when it comes to the process with OEMS, from my perspective and the firefighters and paramedics and EMTs that I represent, I can't control that process really at any stage. We can certainly advocate and put in, you know, our support, but that's a departmental issue. And I know through looking at other situations around the state regarding a request for EMS services, that process is often long. It can be stalled, it can be disputed, and oftentimes it's just a needless barrier in some situations. And certainly in some situations, I'm sure it's not a needless barrier. In this unique instance, this is a first of its kind type of approach. And in my experience as a state employee, sometimes new things, as great as they are, sometimes can take longer than they should. And when it comes to providing life-saving care, I don't think waiting another year or two for a paperwork process to go through is necessarily the best route. If that's the route that this committee thinks is appropriate, you know, I do respect that opinion, but our opinion is we need to find a way to get this over the hump and make a better outcome for people sooner.
So basically, you're saying the Office of OEMS is an administrative burden because of the length of time it takes to get something through? I have no idea. That's why I'm asking you.
I don't know of the exact way to phrase if it is a burden or not, but I know the process is long. And sometimes that process being long might be appropriate.
Okay, so define long to me, because I sit in the North Central EMS Council with these people, and it doesn't seem to be, but that doesn't mean in the real world it isn't. So that's why I'm asking you.
Well, I know that there's the town of Weathersfield, for instance, has been going through a process, a different one, not really apples to oranges, but that has been going on for well over a year. And those are just the things that we can see on the outside. We can attend the DPH hearings that we see online and whatnot. They offer those electronically, similar to these events you can watch from home. And this is an opportunity to deliver an impactful difference rapidly. And my opinion and the opinion of the firefighters I represent is the faster that we can allow them to fully operate, which they're already trained in doing. If they work in Farmington today, they can do it. But if they're working at stores tomorrow, they can't. We want to see that gap eliminated as fast as possible.
Yeah, and in dealing with emergency medical services, rapidly is a key word, key process.
Absolutely.
Thank you.
Thank you. Any additional questions, comments from members of the committee? All right, seeing none, thank you so much for your testimony today. I believe we have Betsy Gara. Is she online? So we don't see Betsy. Okay, Frank Duncan from IAFF Local S15. Thanks for joining us today. Welcome to the Public Safety Committee.
Thank you. Good afternoon, chairpersons, ranking members, and members of the committee. My name is Frank Duncan, and I'm a member of the IAFF Local S15, and currently proudly work as a firefighter paramedic with UConn. I am testifying to express my strong support for Race Bill 7201, an act concerning supplemental paramedic. This bill is a crucial step toward enhancing emergency medical services on the University of Connecticut Storrs campus. As we know, seconds matter in emergencies. The sooner a paramedic reaches a patient experiencing a medical event, such as cardiac arrest, severe trauma, respiratory distress, the greater their chance of survival. This bill ensures that the UConn Fire Department, which already has an established presence on the Storrs campus, can start to provide advanced life support to patients within minutes of arriving on scene. Similar to an already successful program in Farmington. Currently, when members of the UConn Fire Department are dispatched to a medical emergency, they can only provide basic life support to patients. In critical emergencies, when paramedics from Wyndham Hospital are also dispatched, there's often a delay in advanced patient care due to availability, distance, and timing. As first responders, we have a duty to act when on the scene of an emergency. This duty arises from the recognition that paramedics possess specialized skills, knowledge, and training that can make a significant difference in saving lives, where every second counts. Supporting the passage of this bill would allow the UConn Fire Department and Storrs to operate a supplemental paramedic unit, ensuring that students, faculty, staff, and visitors receive the fastest and best possible emergency care when they're needed the most. Furthermore, as responders, we are trained to work to the best of our ability to help those in need. Limiting this ability goes against what we have been taught and what we have sworn to do. I urge you to support the House bill and its continued improvement of health and safety to the University of Connecticut. Thank you for your time and consideration.
Thank you. Any questions from members of the committee? Comments? All right, seeing none, thank you so much for your testimony. Have a wonderful day.
Thank you, too.
At this time, we will have DeAndre Brown for Evolve Love BLM 860 Kenna Warriors. Well, please turn your microphone on, please. Thanks.
Hi, how you guys doing?
We're doing well, thanks, and welcome to the Public Safety Committee.
Nice to meet you guys. My name's DeAndre Grim D. Brown. I'm here with the CT Canna Warriors, affiliate of BLM 860, and also I'm a director of Evolve Love and Friends of Heaven Skate Park. I'm here to oppose the search of vehicles with cannabis. I feel like honestly it just gives a target. I don't think cannabis could impair someone's ability of driving, because honestly, I could speak from experience. I skateboard while on cannabis. I don't have my driver's license. I don't drive while on cannabis, but I skateboard on cannabis. And I have never experienced a problem with it. I've also witnessed fighters like I don't know if you guys know Nick Diaz. He also performed with cannabis in his system. Um, and also, there's been a lot of studies that show that cannabis can enhance your focus. Um, there's different strands as well as different types of weed like indica, sativa, and hybrids. Sativa is definitely one that is going to be energizing. The key point of knowing the difference is indica in the couch, you know what I mean? It rhymes. But yeah, I'm also here to oppose 7204. Um, but yeah, if there's any questions you guys have, definitely here.
Thank you for your testimony on today. Any questions from members of the committee? Seeing none, thank you so much for your testimony today.
Thank
We
you.
appreciate it. Be careful skateboarding. At this time, we'll call up Greg Priest, Joint Council of Fire Service Organization. Chief invites Chair. Wow. I was going to say
as
he
you can
looked
see, you're not
much
Chief
younger today. It's good to see you. Welcome.
He had to step out, so.
I was going to say, where did you go? I gotta figure that one out.
Morning, members of the Public Safety and Security Committee. My name is Steve Hoffman. I'm presenting testimony as Chair of the Joint Council of Connecticut Fire Service Organizations and Fire Chief of Colchester Fire and EMS. I'm writing to express my strong support for Connecticut House Bill 7199, which addresses the pressing issues of recruitment and retention of volunteer and career firefighters in our state. Firefighters, both volunteer and career, play a crucial role in ensuring the safety and well-being of our communities. As we face increasing demands and challenges, it's imperative that we take decisive action to support these dedicated individuals. Connecticut's firefighters embody the spirit of service, commitment, and sacrifice. However, many fire departments across the state are struggling with recruitment. Aging populations, busy work schedules, and societal changes have contributed to the decline in volunteer firefighters, while career firefighters face similar challenges in attracting new recruits. The bill provides essential resources and support to reverse these trends. By investing in recruitment initiatives such as targeted outreach programs, training support, and incentives, we can raise awareness about the vital role of our firefighters and attract a diverse range of candidates. Moreover, the retention strategies proposed in this bill, including professional development opportunities and financial incentives and sustainability opportunities, will help ensure that our firefighters remain engaged and committed to their roles. Recently, fire service leaders in Connecticut worked collaboratively with the state comptroller to conduct a survey on collecting demographics on fire departments throughout the state. This survey resulted in a 93% response rate with some eye-opening results. Based on the information collected in this survey, we have approximately 13,401 firefighters in total, which is a decline from the 26,800 reported in 2016-2017. We're seeing a significant decline in firefighters across Connecticut. This substantial change needs to be addressed in order to ensure the fire service is able to provide essential services to their communities. Fire departments are the backbone of our emergency services, and their effectiveness directly impacts our community's safety. As we confront an array of emergencies, from natural disasters to public health crises, we need a robust and well-supported firefighting force. Supporting House Bill 7199 is critical to building this strength. In conclusion, I urge the committee to support Bill 7199. Investing in our firefighters not only honors their sacrifices, but also enhances public safety for all Connecticut residents. Thank you for considering this important legislation.
Thank you so much. Any questions, comments from members of the committee? All righty. Seeing none, thank you so much for sharing with us on today. We appreciate your testimony.
Thank you.
Isabel Logan. Isabel Logan. Welcome to the Public Safety Committee.
Thank you and good afternoon. My name is Dr. Isabel Logan. I'm the Executive Director and co-founder of the Social Work and Law Enforcement Project. Today, I'm here to testify in favor of Section 2 of House Bill 7202. The Social Work and Law Enforcement Project is dedicated to advancing the ethical and effective integration of social work services into law enforcement agencies by preparing social workers, law enforcement professionals, and law enforcement professionals to collaborate in developing the field of police social work. Through our voluntary multidisciplinary work over the past 4.5 years, we have learned that best practices require training social workers and law enforcement professionals together. Building on the work of the Social Work and Law Enforcement Project, the Social Work and Law Enforcement, we would like to support the Social Work and Law Enforcement Institute out of Southern Connecticut State University that will offer fellowship opportunities for police social work training, education, and technical assistance aimed at Connecticut social workers, police social workers, social work students, mental health providers, law enforcement professionals, and law enforcement agencies who work and are preparing to work in law enforcement settings. The Social Work and Law Enforcement Institute will provide cutting-edge training on standards and best practices for police social workers, social work professionals, social work students, mental health providers, law enforcement professionals, and law enforcement agencies to meet continued workforce developmental needs. Providing technical assistance and support to police departments will, with social work partnerships, advancing on the implementation of integrative and collaborative police social work models. The Institute will also conduct research to assess the effectiveness of police social work models and the impact of police social work on communities, as well as to develop strategies to increase effective and efficient police services. Lastly, the Institute will also provide police departments and schools of social work with technical assistance and support to prepare police social workers in Connecticut through the Police Social Work Workforce Development Practicum Program. The development of the Social Work and Law Enforcement Institute out of Southern is crucial to address Section 18 of the Police Accountability Act, requiring law enforcement agencies to increase their collaboration with social workers. At that time, the Connecticut legislature recognized the need for collaboration between police and social workers and mandated police departments to conduct a feasibility study on the role of social workers in police departments. However, the legislation did not offer training, resources, or guidance for social workers and law enforcement professionals looking to adhere to the new policy. Those communities working with the Social Work and Law Enforcement Project have successfully experienced integrating social workers into policing. However, many challenges have emerged statewide as law enforcement agencies work to integrate social workers successfully. Ultimately, police social work is critical for effective policing to address mental health needs in the community, prevent unnecessary arrests, reduce recidivism rates, and increase trust between community and police, leading to safer communities for all. The Social Work and Law Enforcement Institute will address a significant need for the state of Connecticut to improve policing and enhance services to those in need. Thank you for your time.
Thank you, Dr. Logan. Ranking Member Howard.
Thank you, Mr. Chairman. Dr. Logan, welcome, and thank you for your support of this bill. I appreciate it. I know you and one of my colleagues and one of my colleagues from here and my colleagues from law enforcement both have worked really hard on this. I just want to get this out in the open. The SWLE does not increase the amount of incidents where law enforcement will encounter somebody who's with mental health. Is that fair to say?
Correct, it will not increase.
It'll not increase. So it'll take the amount of times that police officers are called to scenes with people with mental health now and just better equip the officers to deal with those. Is that an accurate depiction of how this works?
Correct.
Because I don't see any public hearing testimony against it, but I have heard in the confines of this building that the mental health community in some regards are a little bit opposed. And I think sometimes that happens because they see a risk, an inherent risk and a fear for them when we talk about law enforcement addressing folks with mental health. So I just wanted to clarify for the record that the program that you've worked on for the last 4+ years, it isn't to send more police officers to mental health things. It's to say we're already doing that because of the nature of their 24/7 operation, and we want to better equip them. Is that right?
Correct. The social workers will provide the tools for law enforcement. The training will equip the social workers with best practices.
And there's a collaborative effort, isn't there, between law enforcement and social workers in this, in the way that we handle this, so that the social worker, when the individual is not in crisis, can continue with some follow-up to get to the underlying issues and actually potentially, and I think you've shown this in your work, reduce the number of incidents where police officers encounter folks with mental health. Is that fair to say?
Correct.
Okay, thank you so much. I appreciate you being here. Thank you, Mr. Chairman.
Thank you.
Thank you. Any additional questions, comments from members of the committee? Look like everybody's going to lunch, but Representative Shake.
Thank you, Mr. Chairman. I already had lunch, so. Dr. Logan, thank you for your testimony and thank you for the background of information, and Representative Howard for your comments of additional perspectives that I think are necessary. I know in the town of Stratford, which is where I represent, our police department brought on a social worker, and it has been a positive and welcomed addition to our force. But with the primary location, or is this the only location at Southern Connecticut State University of where training would be offered in the state? Is that for the certification that you were referring to?
So it's an institute. It would not, we would partner with different, at the present time, when we do trainings, sometimes we'll do trainings at police departments, depending on which police department would like us to train. We have also done training out of post. So it would depend on the partners that we're working with, but our home base would be out of Southern Connecticut State University, yes.
Thank you. And then I've heard all kinds of feedback, whether it's police officers, firefighters, EMS, the amount of training and recertification requirements that said departments go through every year, or if it's biannually, whichever. Are these trainings in person or are they hybrid?
So the trainings can be in person, and we're also looking to develop through the Institute online training as well.
Okay, the reason I ask is because some of the feedback that I have received is, when said departments have their recertification processes, deadlines, those that are online, it's not the same as when you're sitting in a classroom and then you're working through the exercises, and whether it's for the student in this situation or if it's for the instructor, where you're really able to have a more, I think, in depth, and you can maximize the amount of time, the limited time that you have to go through the process, to really address or raise additional questions that whomever it is that's in the classroom may have. So I would just ask that if this is going to be available, if this is going to be something that passes, just to consider and stress the emphasis of in-person. I know it's hard for many of us to get to different places across the state if it's once a month, but in the request of flexibility, that there would be multiple dates and opportunities for officers and social workers as well to be able to participate and have it in person so that they can go through the process and get the maximum benefit from the program.
Absolutely. We actually have all of our trainings in person. We are thinking of including online because there are certain places that will make it difficult for some really busy individuals, but those same online trainings will be offered in person as well.
Thank you. And through you, Mr. Chairman, I guess one follow-up question. Has there been any conversation, and I know it would be a challenge, but of going or having multiple personnel going from municipal to municipal to offer said trainings, which would then maybe perhaps, decrease some pushback that might be due to scheduling conflicts or things like that, bringing the services directly to the site.
We actually do that at the moment, and that is still part of the plan.
Thank you so much. Wonderful.
Thank you. Dr. Logan, I just wanted to make a comment. I know that, the law enforcement profession is consistently evolving as the demands of the public also is evolving around these issues of social workers and police officers sort of working in tandem with each other to respond to some of the growing concerns of the public, whether we're dealing with a mental health issue or we're dealing with a behavioral health issue, and more readily able to identify usually are people who have that level of expertise and specificity because they've studied social work and human behavior, and they could help augment the work that police officers are already doing. I know that in the city of Bridgeport, they're already utilizing social workers to help to respond to a myriad of different calls that they receive. My concern is, while I believe that this is such a great program, is that, I wouldn't want to see a social worker get dispatched to a scene where a person might be having a significant mental health crisis or episode, and that social worker get there first before a law enforcement officer get there, and that person may be wielding, let's say, a knife or a gun. I wouldn't want to jeopardize the social worker, even though they may be able to de-escalate. They still need, significant assistance from law enforcement because they're just not trained in that same way. So I know as you all are standing up this program, my concern is just to ensure that people are getting the same kind of training across the board, opposed to people doing it in silos, and law enforcement agencies are hiring people and they're kind of doing their own training, and some training may not be created equal. So if, we want to just make sure that people are getting the rigorous and appropriate training necessary to be able to maximize as much as possible and to mitigate situations like I just mentioned from happening. But sometimes, I think that, some people are working in social work and they're admirable, but they may not have the kind of training that you might be providing at Southern. So how do we sort of standardize that practice across the state? What's your thoughts on that?
So that is one of the main reasons why we're here today, asking for your support in order to do a social work and to establish a social work and law enforcement institute at Southern. We actually did receive a call from Bridgeport to assist in their training of their social workers, and we actually did a training for them at the end of January because of some of the concerns that you have raised. So one of the main reasons that our program has been in existence for so long with the voluntary support of my team has been because we have carefully strategized safety components to our work. That is the number one thing that we focus on. Through that work, we were able to develop a police social work academy specifically to standardize trainings for all so that people know when they're able to go in a case or not, following the lead of law enforcement.
That's exceptional. I really appreciate you answering that critical question, and I'm sure others around the circle probably had similar concerns. Any additional comments, questions from members of the committee? Seeing none, thank you so much, Dr. Logan, for joining us today. We appreciate your work. Vincent Roger Nelson from the Connecticut Fire Marshals Association.
Good afternoon, Representative Boyd, Senator Gaston, Ranking Members Howard and Ciccarella, and distinguished members of the Public Safety Committee. Connecticut Fire Marshals Association supports in concept House Bill 1490, an act concerning the sale of battery-powered smoke detectors in the state. The importance of working smoke detectors can't be overstated. They are the first line of defense in detecting fire and providing early warning to the occupants of the residence, allowing them a chance to safely escape. The 10-year sealed battery helps keep these units functioning reliably to prevent injury and save lives. The lack of a working smoke detector is the most common cause of non-functioning smoke detectors, excuse me, lack of a working battery. In most cases, the battery has been turned around or completely removed due to nuisance alarms or low battery life. Since these 10-year alarms, the battery cannot be removed, they maintain continual power. The units have a Huss feature for nuisance alarms and an indicator showing the end of life. Between 2018 and 2022, the main reason for battery alarms not working were disconnected batteries of about 35% or dead or discharged batteries at 24%. 14 other states now require this 10-year sealed battery to include Massachusetts, New York, Pennsylvania, and New Jersey. 10-year sealed batteries could actually save money in the long run. The cost of replacing a 9-volt battery every year would actually exceed the cost of the 10-year detector. We've attached substitute language in our testimony, which should be posted soon. I'll ask for the same 3-year phase-in, which I did in 2022 when the bill was brought out, so that this would not take effect until October 1 of 2028. This would give time for both education and getting the the quantities to the rightful places. I'll be happy to take any questions.
Roger, thank you. As usual, I would just like to point out that this is our last public hearing, and I believe you are the only person who has perfect attendance and has testified at every single public hearing we've had as well. So congratulations, Roger, for that and your dedication. So I was just going to ask you for the substitute language, and you said it's in your testimony.
Yeah, it'll be in testimony. It's basically just taking the date of 2025, changing it to 2028, and I think we replaced the word hardwired with electric, warning equipment that is powered by the electrical system of the building. We just put hardwired to keep it at the
And you had mentioned it.
residential from the commercial.
Okay. And you had mentioned it before. How many other states have gone in this direction?
14 states right now have gone to this, and 8 major cities across the country.
Okay, very good. Thank you. Any questions from members of the committee? Okay, Roger, thank you very much. Appreciate it. Next is Vincent DeMeo from the Police Association of Connecticut. Chief, welcome.
Okay.
Oh, my goodness. Okay.
Got fire-
Awesome.
We got firemen here.
We got to
Dragging
change
me
those
out, so I'm
chairs.
Feeling good about that. Senator Gaston, Representative Boyd, Representative Howard, and remaining members of the committee. Perhaps next time I'll bring a pizza from New Haven when I come up. We'll get a little better attendance. Not really sure. I am here today representing the Police Association of Connecticut and our 6,600 members, sworn members and retired members throughout the state of Connecticut, to speak in support of portions of Raised Bill 1492. As many of you know, the bill concerning recruitment and retention is imperative to law enforcement here in the state of Connecticut, and it is a problem across this nation, recruiting qualified officers to this profession and then retaining them in such jobs. And on the way up here, I was listening in the car to our fire colleagues and understanding now that they are also experiencing some recruitment and retention problems. And to that fact, I would just speak to mirror the police bill. I don't really see that the anti-poaching law, as it was nicknamed, or people understand it here, has really been effective for law enforcement at all. So as I would speak to, before I would speak to parts of the bill that we were in support of as PAC, I would implore all members of the committee to kind of look at this holistically. And I know you're talking about a myriad of different public safety issues here amongst the committee. It's kind of a lot to digest, but I would suggest to you all that there's a common nexus here that we need to address, and that is we need to reinvigorate this profession. We need to draw people of quality and character to these professions. Obviously, you could tell I'm a 36-year veteran of Connecticut law enforcement. I'm definitely not the youngest guy in the room by far. but I love this profession. And growing up in, the 70s and the 80s, and a little further back, probably in the 60s, which I've caught a little bit of that generation too. If you would have asked any school child what do they want to be when they grow up, 99% of them probably would have told you at one point or another, fireman or policeman. That is not the case anymore. So I think what we need to do is re-incentivize this profession to draw the quality of people we need. It's clear that the demands on this profession become ever increasing. We expect our police officers and our firefighters to do much, much more. And I would say that punitive measures, such as penalizing an officer from going from one department to another, really doesn't help. I think if you look at the body of work here, I did provide, last time we met, I provided you with a study that was done by the South Central Chiefs of Police. We've only, in 2024, the South Central region of Connecticut, where I'm the immediate past president of the South Central Chiefs Police Association, encompasses 21 police agencies in the greater New Haven area. Last year, our total number of applicants for those 21 agencies, including New Haven, was 200. 2025, we ran another hiring process for those 21 agencies and received 21 applications. Only 10 completed the entire process. As you can see, it's an unsustainable measure. And I will be perfectly honest to tell you that in all the transfers and changes that are going on throughout the state, as far as officers moving departments, of all the hires in South Central, in our South Central region, nearly 45% of those were lateral entry hires. So I don't think that, the fire department is going to get the results that they expect from that piece. However, moving on, for the reason why I'm here. Obviously, we've been working for a very long time with you, and I appreciate the opportunity to be here and speak to you. I'm happy to answer any questions that you might have. But particularly, the Police Association of Connecticut stands in support of certainly Bill 1492. I would say not in its entirety, but of the many aspects that would incentivize people to come to the profession, particularly the education pieces that we've been talking about for a very long time. To put it very simply, I think the apparatus already existed, and when the Police Association approached the Public Safety Committee, we tried to give you items that were clearly and easily could be passed along to finance for budgeting, clear and concise, fixed costs. The educational incentives in this bill very much mirror and mirror right along with the GI Bill. So those that serve in the military and the incentives that are brought to them. I think that will help draw the kind of people we want, and it will also incentivize people, again, to stay in place and to become better officers and serve our people in the state of Connecticut better. Section number 3 of the bill talks about establishing a grant program to reimburse police departments for the cost of basic training. We would argue that that was always covered by the state of Connecticut for decades, and that changed. So I don't understand why we can't fund that police academy to have our officers trained to a standard. The state of Connecticut currently requires more mandatory training hours than any other state in the United States to have a certified police officer. Much smaller agencies, that is a severe burden, and basically it will take you 1 year from the time you run a test and hire somebody, put them through the police academy, put them through their mandatory field training, before you get them on your first shift. So you have a large amount of time and effort invested in an officer to get them to just their first shift, about $100,000 in most cases. So again, those are the main pieces. The other piece that we have is the psychological, the task force to look at the psychological issues affecting the mental health issues affecting our law enforcement personnel. And I would also add, and I see, unfortunately, Rep. Ciccarella has left, but there is also a physical piece that should be addressed. There's been a number of studies, particularly one by Sigma Health, concerning the cardiac risks faced by all first responders. And there's a given test that it's a blood test which can identify a certain enzyme, which we're prone to due to the high stress levels that we operate under constantly up and down. You go to a call, you're very stressed, you're back down, you're in a report room now doing a thing, and then back to stress and back to stress. So that repeated exposure to stress has a physiological effect on the body. So it asked that some language be added into that section. And I'll tell you the section here in a second, please. Section 20, that would address some of the physiological demands of our profession as well. In closing, I would certainly say that rather than sit and talk about just the one bill on recruitment and retention, I believe that we need to look at this holistically. If we're going to recruit and retain quality people to our profession as well as the fire profession, I can see that they are now suffering the same issues that we are. We're a little bit more advanced. I've been testifying now for 3 or 4 years and always raising the alarm about where we stood, about not being able to get enough people in. And unfortunately, it's being proven true. We're not getting the people that we need to apply to this. So we have to look at it, I think, in a holistic manner to say, what can we do to incentivize good people to come to this profession, to stay to this profession? What can our legislature do for us that is going to provide the framework that is going to allow us to perform the mission that we're sworn to perform, which is public safety? We all want the same thing. And we need your help and we need your support, and we're here to ask for that. So if you have any questions,
Chief, as always, thank you for your advocacy and availability. I know the answer to this, but I want to ask it to kind of get it in the record. You know, when it comes to recruitment and retention, how much does retirement pension, healthcare benefits play into the recruitment side, or is that a powerful tool to retain people in a department?
I would say it's powerful on both sides. Okay, so if you're a new officer and you're looking to begin a career, you're going to look at the best possible package and the best possible avenue that's going to get you, the lifestyle that you want. This is a demanding job. It takes you away from family. It takes you away from a lot of certain things, and you have to live a certain lifestyle. So there's a trade-off. What do you want for that? Back when I got on in the late 1980s, no one left their profession. Nobody left their department. You stayed on, and you saw that because everybody had a pension. I think we got into the mid 90s to the early 2000s, and there was a large push to move to 401ks. And I think what happened there is we found out that without that pension, you create journeymen, right? And what you ended up doing was paying more for a junior officer. You're going to pay him because you're paying into their 401k. After 3 years, that money stays with them. They leave and go to a place that has a pension. You've just paid a junior officer a top grade officer rate, and it's not working out. We're starting to see a lot of agencies move back to a pension system because this is a difficult career, and you need to incentivize people to stay. I think particularly the studies that are done between that 7 and 10 year mark is very stressful, and it really, that's where we see a lot of diversion. In the study that I provided you earlier, was we had 50% of our people leaving before 20 years. That was unheard of before. 28%, I believe, leaving before the first 5 years. Those are difficult numbers for us to combat, especially when you really, I feel, and I'm sure many of my colleagues at CPCA would also agree, that you're not going to get a really seasoned, good officer until you've got at least 5-6 years under your belt. There's just too much to do. There's too much to understand, and you need experience. And experience can't be taught. It can only be learned through doing, and without being in those situations where you're forced to deal with people that may not be compliant, or you're forced to deal with people that have different visions or are confrontational, whatever the case may be. Understanding what the legislature wants from you, understanding what management wants from you, understanding what your community wants from you. It takes a lot to understand all that and to get used to that and to manage that and still be functional and operational.
Thank you. There's certainly support, as there has been in the past in this committee, and our challenge is, right, to take the momentum here with other coalitions and then, advocate to the General Assembly as a whole in both chambers and to the governor's office that money put towards these efforts on both firefighter and law enforcement is money that's well spent and will push the professions forward. And so that frankly, that's the challenge we collectively have. once this stuff passes out of this committee. So we should all strategize on what the next
I,
move
I
is
certainly would agree with that.
after next
And
week.
I
so.
think, at the end of the day, we're all talking about public safety, and we can't, without the bodies, we can't get that. And that's what speaks to the other piece.
And the public is going to demand it. So,
Correct.
Thank you. Representative Howard.
Thank you, Chief, for being here. I just wanted to call your attention to section 4 of the bill. And as the chairman said, there's a lot of great stuff in here. It's trying to get through appropriations. It is going to be challenging as usual, probably more so this year. But section 4 down on subsection C, it talks about a pilot program at UNH to permit an individual who attends a basic academy to basically, as I read it, supplant the basic academy with the courses at UNH. Do you have, to me, that's concerning because it gets away from standardized training. Do you have concerns over that, or what's your opinion on that one section?
So basically, my opinion has always been the same on this, that I don't have an issue with some of the aspects of training being led out to institutions of higher learning, such as, laws of search and seize or laws of arrest, and more classroom-oriented teaching, because to my mind, I feel that the Post Academy is understaffed and underfunded. They don't have the resources to provide that level of training that people need. However, that being said, we still need to test our officer candidates under stress, and you can't learn this job in a classroom setting. You could be the smartest person in the class, but then you're stuck at 3 o'clock in the morning by yourself down a dark alleyway facing some violent individual who is intoxicated on drugs and willing to attack you. We don't know how these people are going to react, and we don't want them to overreact. So we need to have a regular police training and standardized police training that gives us, say, 10 weeks to understand under stress and put you under stressor conditions and working around the clock, working with people of different viewpoints and different values to achieve the same mission. So I'm not adverse to seeing some of that being taught on the outside and some credits given. However, there needs to be a standardization that we still need to have our police academy and stress-induced training, excuse me.
Thank you. And, Chief, you sat before us many times and said we're getting to a crisis mode in recruitment and retention. It sounds from the numbers that you provided us that we're still there. I'll just say candidly, anybody who's turned on a TV knows that the budget up here is going to be a very, very difficult process. So if the chiefs and the unions or anybody can come up with ways that this legislature can do anything to promote folks, young people especially, being interested in this career and firefighting. These are places that can't close. Has your police department ever closed on a holiday?
Never.
You ever
We don't
closed
close.
for-
We don't have locks on the door, sir.
Yeah.
It's
You ever
24/7.
closed because it's understaffed?
No.
So what happens when you're understaffed? What happens if a
So-
guy calls out sick? Then what happens?
So here's the issue, and this is what we get to. I'm in the process of my municipal budget every year, and obviously the thing that always comes up is overtime. And basically in police department, there's two forms of overtime. There's late call overtime, which is an incident happened at the end of your shift and you need to remain to get it cleaned up, get it done, get the reports done. And then there is backfill overtime. So we have minimum staffing numbers that have to be met for safety and to meet our response capabilities. And when somebody calls out, somebody's out injured, somebody's on vacation, and we don't have enough bodies, those people get ordered in. So now you have an officer that's already worked maybe 2 days in a row at 16 hours a day. They're getting called back to work again for another double shift. And you're seeing, obviously, you're putting people in danger because they're not at their best.
And can that officer say no if he has plans with his family? Can he say,
No,
no, I don't want to
they
work today?
cannot.
He cannot.
No.
So this is sort of the point that I think my colleagues need to understand that this is a snowball rolling down a hill. Because I heard recently, my friend here represents Bridgeport. I heard the Bridgeport Police Department had a female officer leave recently because she's working 80 hours a week back to back, and she just didn't want to do it anymore. So this understaffing, and correct me if I'm wrong, is a perpetual and snowball effect because you're understaffed and now you're running people out because they're being ordered into work 80 hours a week. And then you talked to today very well about the mental health aspect of it. And we're asking these people to see, unsightly things for 80 hours a week and never giving them time at home with their family to decompress and take a break, get some rest. So they leave the profession in that way too. Is that happening?
Absolutely. And I will tell you, I just had a situation where I had hired a lateral transfer from a very large urban department. And the reason that person left was because they were being ordered to work at least 80 to 86 hours a week because they didn't have the staffing. So perpetual order ends. Unfortunately for us, didn't work out for us because I guess in a larger department, you have a very narrow lane. And if you're in a small department like mine, you have to wear like 12 hats. Couldn't handle the workload. And that person is now out of the profession. So 2 years on with a major urban police department, and then made it about 10 weeks with us, and then just decided this is not working out and left the profession. And a very good person too. Very good person. Not your typical police candidate that we would normally see, but I really believe in getting a good, diverse workforce so you can have that level of experience and then different viewpoints when you're dealing with your community, because it's not just your community, not your sitting community. It's anybody that's traveling through your community, anybody that's visiting, people that work there. So, having the same cookie cutter all through doesn't work. I want young, I want old, I want different religions, I want different races, I want different philosophies. But I all want commitment, and I want a commitment to service. I want a commitment to professionalism, and I want a commitment to humanity. I want people that care about helping others.
Thank you. Thanks, Chief. Thanks for your constant advocacy for this. I sincerely appreciate it. Thank you.
Thanks.
Thank you. And any additional questions? Yep. Oh, Representative Shake, how can I forget you again?
You won't. Thank you, Mr. Chairman. Chief, thank you for your testimony and information and giving background. I am in support of Senate Bill 1492. However, I don't know if you were in the room before, I represent Stratford, and Stratford is not the only municipal, as you described. I think look on your face, I think you know where I'm going, where the municipal had changed from having a pension as an option for retirement benefits to changing over to a 401k. And we have seen a consistent pattern of not only new, whether it's police officers and our firefighters, some of them were grandfathered in, but for our newer staff, the primary driver for why they are leaving is because they do not have a pension. So that lateral move that you're describing, where, for some, you are in public safety, I work in healthcare, that's my background. So whether we're talking about, public safety or healthcare or even education right now, for workers in general, because of the type of work that police officers and firefighters are required to do in order to do their job well, the impetus of not having a requirement for strong retirement options as a primary driver or incentive to attract and retain staff, because it doesn't matter, where you are in the state. There's another bill hopefully moving through the legislature through labor that addresses pensions for police officers and firefighters throughout the state, no matter what municipal they are in. I just wanted to know, because I appreciate your comments, where if we're going to talk about it, let's talk about it, right? So a lot of these sections within the bill are great, but if you can't actually retain the staff, and to your point, experience diversification of who is on that shift is critical, right? For being able to respond appropriately and fast so that we can save as many lives as possible, or structures, whichever it is that we're talking about. Would you, in your opinion, would it be for this bill, for the 1492, to include language about retirement options and pensions? Because right now we have two moving things happening in the legislature. And like I said, I think that this is great. But if the common driver, I mean, we're talking over 20 personnel, the cost of how much it is to train, right? And then go through the research, and then the municipals are losing that funding, right? Because you have, whether it's police officers or firefighters leaving, moving laterally. And I think the other part of the conversation that I think my colleagues need to understand, when you have, because they're all union, when you have workers who have 10 years of experience, that is significant. They are they are sacrificing, they're not risking, they're sacrificing their service of time and their seniority to start over. That is it's a loss for the employee, right? It's a gain for whatever municipal is acquiring those said workers. But you know, if we're going to dissect a problem and actually try and get to the root and heart of it, and to your point, we absolutely need to make sure that within public safety, that we are acquiring the best, the brightest, and those that have the ability to be able to empathize, to be compassionate, to have that humanitarian piece of it. Because, you know, whether it's this room or the other room that I'm in, and I apologize if I'm running in and out of committees all day, that's just the way that this works. We're all trying to help each other and protect each other and to protect our communities. So would you recommend as an amendment to adding in language about retirement options, retirement benefits, pensions, anything? What are your thoughts?
Well, first of all, I'm going to go home and tell my in-laws, because they're Stratford residents, that they got a great rep. So the Police Association of Connecticut would certainly stand 100% behind such language being added to this bill, because I think, again, and you spoke to it, the core is if we don't have the amount of personnel needed to provide the service, everything else is anecdotal. We can address little bits and pieces, but we're still going to be in the same problem of we don't have the people staying. That was never a problem before. You came in, when I came into this profession back in 1989, which is a very long time ago, I know, I understood I wasn't going to get rich doing it, but I understood that if I stayed with the profession, if I did my career, and now I'm probably almost 2 careers done, but you know, I would be secure. I would have a house where, and I could stave off the ups and downs of inflation and other things. So yes, it was a demanding job, a job that I love doing because I want to help people, and I still come to work every day because I want to help people. But that's not this generation. This generation views things in a very different way. So I think they view things in a little bit more of a broader perspective and maybe an economic perspective. I come from, I was divorced. My parents were divorced when I was young. I was raised by the World War II generation. So I'm not really part of my generation. I'm an outcast, a throwback to the World War II generation and the Great Depression, where service was a huge piece of it. And that was instilled in me in a very early age. And it's not to say that our young people don't want to serve today, but I think they're a lot more savvy than we were. They weren't as dedicated to one ideal as some of us might have been. They want to look at it more holistically, and they understand what we're giving away, and they see a lot of the wreckage that's left behind from people that dedicated a long time to this profession. And we can be honest, there's a lot of wreckage. It wrecks. We have a high divorce rate. We die sooner. We have higher substance abuse rates. The job is demanding. You see a lot of things that hurt you, but still, if you do it right, it's the best job in the world. We need to incentivize it for people to stay. And if we can do that at a state level where you can have a set pension system that everyone can participate in, and I know Mr. Scanlon's working on that, I think that is going to be one of the best things you can do to shore this up a little bit, because we're in a free fall. When I came here 4 years ago, I said, we're not really standing at the edge of the abyss. We're almost falling in. Well, we've already fallen in, and it's a long way to get back up. It takes a long time to get proficient at this job. And I think the only thing that you can do to help, and that to me is the best course of action, to hold people into the profession and draw people into the profession, is that if you come in and you stay put and you put in a good, solid career,
that when you come out on the other side, there is a benefit to it. There's a benefit to not jumping ship and moving and going someplace else, just for the short term. You have to incentivize the long term and the stay.
Thank you. Absolutely. And thank you for your comments. I appreciate that. But to we're having a live discussion here. So with young people, the comment of my generation, I guess I'm 41, and younger, I have heard from people who work in public safety who are younger, who don't have a pension, and then also people who work in healthcare like myself, because we don't all have a pension. When you're that young, 23, 24, 25, mid-20s into even 30, because of how quickly the world has changed, a lot of people didn't understand what it meant having a 401k or a defined pension benefit plan until it was 10 years later. And then that's when you start to think about, okay, next 20 years of my life, financially, what does this entail? What do I need to save for in the event of something happening? And I think, with today's economy and market and the volatility, I think a lot of people are acutely more aware because of how hard the market has dropped and what that has done to people who have their retirement in a 401k or 403b or whatever, versus the long-term stability, right, of having a pension. And I just want to comment off of something else that you mentioned, the overtime in municipals, and I think it was Representative Howard's comment of, which I agree, I understood where he was going, where we don't shut down. We're 365 days a year, 24 hours a day, right? In that vein, with the overtime, because right now municipals are going through their budget season, and you hear all kinds of feedback, whether it's from elected officials or whether it's from department heads sometimes, or whether it's from the head municipal, whether it's a mayor or first selectman, whatever, where they're honing in on how much overtime and how expensive that is. Well, you don't have the staff. So if there was a true incentive, a real incentive, a tangible incentive that would attract and retain workers, I personally believe, which is why some of us are fighting so hard to try and have pensions be required by municipals to attract and retain staff, so that it doesn't matter. It shouldn't matter where you want to work within the state if it's a municipal government, right? Where you either have benefits or you don't have benefits in regards to your retirement. Because to your point, it's public service and there is a price that we all pay, which means that we are not going to have the same amount of capital gains, right? Or the amount of income as working for the most part in a private sector. And most of us understand that it is a privilege to be able to do that. But in order for it to continue to be sustainable, one of my police officers, who is the chief of my police officer, but from my town, Officer Zona, who is the president of our local, said, municipal, you're either going to pay now or you're going to pay later, because the municipals are paying out with the training and the costs and then losing and then retaining, and then the overtime, everything. It's a domino snowball effect, as you said. So I appreciate your time and your testimony today. And if you have any questions, I'm available.
Thank you. Representative Lamarck Murrah.
Thank you, Mr. Chair. You're getting better every time.
I'm telling you, I get better and better over time.
Thank you, Chief. I appreciate all the information and the conversation that you just had. I want to go to the bill a little bit.
Sure.
And I will say that I'm not going to call you a rookie, but I went into the field in 1982. So
God bless you. I need some of that. Between LJ and myself, I think, we're about 100 years in.
And I do appreciate the expanding role of police officers from, when I started, although we were doing all the same things. It's just, it wasn't recognized at the higher levels what was happening. And I appreciate all the financial stuff, but I just do want to say that this is the best job. It's like there's still every warm summer day, night, the first warm summer night, I look at my husband and say, I want to be answering 911 calls tonight. Because, you know, it pops off on the first warm night.
Well, I took
But
this job because I wanted to be outside, and now I'm a prisoner in my office for the past 9 years.
But anyway, I just have a couple questions about the specifics in this bill because you did, I think your sort of overall point is that the intent of this bill is great, but it needs, the mechanics of it may not get us where we need to be.
Correct.
The pension issue aside, I think you guys did a good job talking about that, so I'm not going to dip into that. But just specifically, your experience with cadets and explorers, what's your experience in terms of how many of them actually become certified police officers?
I mean, that would be anecdotal. I don't have the numbers on that, but one part of this bill does talk about volunteer police force, which.
We'll get to that.
Yeah, I was going to say, because the PAC is going to be definitely.
We'll get to
we're gonna
that.
be against that.
We'll get to that.
Right. You know, I think I would say that in my 36 years of experience that I understand the concept of police explorers, and it's a very good concept. However, it seems in practice to have lots of faults and lots of problems. And we can go through a laundry list of incidents where it's turned out poorly because of poor behavior on an officer and maybe some other issues that, so to me, I would never have it in my agency because of the risk exposure. And I just don't like the optics of it. When something goes wrong, it tarnishes your whole career. And this is where we sit in law enforcement now, right? A few individuals have tarnished this whole profession to the point where no one wants to do it anymore.
Right. So I agree that in my experience, not a whole lot of cadets and explorers end up becoming police officers. So I do think that it's worthwhile for the kids. It's just to spend money on this program to think that you're going to end up with a wealth of eligible candidates to become full-time certified police officers is a little naive. I mean, this is a great program for kids, maybe fund it through that way.
I would agree with that 100%.
Yeah. And I think in addition to having it just be police supervised, there needs to be an educational component. There should be a teacher there or something like that from the local school. So in section 3, when it talks about grant programs to reimburse police departments for basic training, and you mentioned that you think that money should go to post for police officers. And I understand that most police officers go to post for training, but
All police officers have to be certified by
post, right.
Yes.
But when I came to Connecticut and started working in Hartford, Hartford has a satellite academy that's certified by post, approved by coast, right? But we didn't travel to Meriden. We came here
Correct.
to Hartford.
And I would agree, and that's fine, but just so we're not misunderstanding each other, post is the only certifying body.
certification,
So,
right.
yeah, all the satellite academies have to get approval from post to do theirs. And honestly, I think they're doing a much better job
Right.
at this point in time. The satellite academies are putting out a good product.
Right.
But my point is, why did we take away that funding? Because when I went, you got hired as a police officer, you had to go to post to be certified, and the state paid that. And the municipalities didn't have to budget that.
Right.
And when we're looking at huge numbers of turnover, that's more and more dollars that we have to pay, and we're not getting any return for it. So to me, if you want some low-hanging fruit, why don't we get back to where we were before, where the legislature was supporting law enforcement and paying for that training that they require for our officers to actually operate as police officers in the state.
Right. Now, I'm just thinking that in terms of this language, there needs to be some reference to satellite, or somehow or another that it's just now post, right? That it should be all police
I
officers
think
and satellite academies.
I think the understanding through law enforcement is that post is the certification body, and that those academies are all
Right, but they'd
operated
have
under
to
the
share.
auspice of
Yeah.
post. So, but I mean, yeah, so however you have to slice that up to make sure that, 'cause I think it's a better system, to be perfectly honest
Yeah.
with you, to have a little bit more localized, as long as we have a standard that is being met. I think it's better to have these academies rather than because we haven't had residential academies in a very long time. We've had
Right.
these hybrids back and forth, which again generates a huge cost.
Right,
Um,
and I know the residential academy was always a stumbling block for quite a few people, the police departments that didn't have a satellite academy. I knew a lot of people that came to Hartford just because they wanted to work somewhere else, but they weren't going to live in Meriden for 6 months, right?
Yeah,
So-
I have a cadet right now in the New Britain Police Academy.
Yeah, yeah. So in section 4, when it's talking about courses at a college, the concern I have here is twofold. One is that the way this reads is someone can go to a college and go through the courses and then not have to take them in the academy. And to me, that would be very disruptive. If you have an academy class of 20 and 4 of them have already taken search and seizure and laws of evidence and some other courses at a college, and the rest of the class has to go through it at the academy, it's just confusing. What do you do with those 4 or do they have to repeat it? And then the statute does talk, or this bill does talk about an individual, so it seems like it would be on an individual basis. But I do like your idea of actually bringing in academics who are subject matter experts to teach at post because of their limited ability to have trainers, and for those trainers, they're all working police officers, so for them to have that level of experience in certain areas would be great. So is that kind of how you were reading it? You weren't reading it as an individual shows up with a
No, I mean,
transcript that says, I
the
took
way I
these 4
read it is
courses.
we're looking at a task force to examine how that should be done. And we could say, okay, just like very much like the state of Florida, you actually go through to an accredited college and they give you a police officer certification. And then you go into the police academy and do
Right.
the actual stress oriented thing. So I think the model already exists and
Right,
may get
California does it.
adapted for Connecticut. But I think you're right. You don't want a bunch of people that are all at disparate points in a process coming in. It gets disruptive. So, and you want to build some cohesion.
Right.
And everybody understands that we all have to work together and we're all working together. So part of that experience is the bonding that you're going to get with your fellow law enforcement officers to know that if I'm in trouble, it may not be the same town, it may be a town over, but they're going to come and help me.
Right, right. Yeah, and I think that would have to be thought through a lot more, because if we did go to that model, which said, basically you'd have to go get an associate's degree with these courses, then it's, tuition and who pays for that.
Well,
and-
and I think that's why, one of the things that we had proposed early on was the tuition reimbursement to say, we will pay, the state of Connecticut will pay for your education so long as you provide Connecticut law enforcement with 5 years, 10 years, whatever you were decided it was going to be.
Mhm.
So we could get people their degrees, we could get them their education, and then we would get some commitment back
Right.
to say, now, okay, you served, and if you leave, then you have to pay us back.
Right, exactly. And then in the other section that talks about giving grants to the top 10 most populous municipalities to increase salaries, I'm guessing in order to retain those police officers. It seems like the problem they're trying to get at is a problem that every police department in the state has. So is there, based on your experience, why would it be the top 10 most populous? And understanding that Hartford is probably going to be one of those, and that was my PD, but
I mean, obviously, it's politics. You have a lot of numbers in urban areas. They experience a lot more of the crime that we see that's recorded through the FBI's reporting system. So that is just a logical place to where people are going to want to send their money. It's
right, but I'm guessing, I understand
Yeah,
why they came up
correct.
with the top
So,
10.
but I'm gonna say
What
that-
I'm asking is, do you think that's going to solve the problem?
absolutely not.
Okay,
It hasn't in the past.
Right.
And we've been doing it forever, so it hasn't fixed it.
right. And then, I'm sorry for going through these, but I'm just going to fire them
No
off.
worries.
So, recommendation for scheduled bonuses to be awarded upon individuals entering the service of police officers. So, a signing bonus, how do you think that's going to, what do you think that's going to do?
I mean, you may see a little increase in people signing on, but if you don't have some assurances of how long people are going to stay there, and how's that going to get funded? Is that going to get funded through the state? Is it going to be forced upon the municipality? How are we going to pay for that? Is a huge question that would come up.
And would the bonus be the first day in the academy when when you raise your hand? Would it be
Correct.
graduation of the
And,
academy? Would it be completion of your FTO? Or would it be completion of your probationary period?
Or,
Like at what
or
point?
2 years or 3 years is
Or 3 years.
graduated, I don't know. Again, you'd have to ensure that you're going to get some return on investment. What's the ROI? If you're just going to say, all right, it's a $5,000 sign-on bonus, we're going to give it to you now. And then after you get out of the academy and get your post-certification, now you jump to the next town because they have a pension and you only have a 401k.
And you get another signing
Yeah, so
bonus.
I just got another bonus, right? And,
Right.
and that's what we're seeing. We have to stop this trend. And as I said, in South Central, nearly 50%, like 44% of all the hires are lateral entries. They're lateral entry. And if you add in comparative compliance, which is officers coming in from another state, we push that up to 50.
Okay. And does your police department or your area, do they already offer tuition reimbursements and, salary percentage of, if you have an associate's degree, you get an extra 3%, bachelor's,
So, yeah,
master's? Do you already have that?
Our union contract does incentivize education, so we do have payments, which is a percentage payment for associates, for bachelors and masters.
Right. I can't, I think most municipalities through their police departments have that. I think it's a good idea. I was just wondering if it was already I know it's already in existence.
It's usually
in-
kind of like a standard clause. It's been in there
Yeah.
for a long time. It's nowhere near the Quinn Bill of Massachusetts, but it's a start.
Okay, the other question I had was, hold on. So the task force to study auxiliary policing. So the question I have is auxiliary police officers in general. So
The
I'm not
state-
sure,
Yeah, the state of Connecticut no longer has that.
right, so I'm not sure what tasks they would perform that would enable a police department to then better use its certified police officer staffing resources. I mean, I guess they could work teleserve and work in the records department and administrative tasks like that, but is there anything else maybe some booking functions?
I mean, I think there are other avenues to pursue use of civilian volunteers to supplement your operational capacity that don't involve an auxiliary police force. I think it opens the municipality and the profession up to a lot of risk exposure. You're putting people that are not normally trained and not normally working on a regular basis in positions that are highly volatile and could become dangerous and have a lot of liability and risk associated with them. So why would we do that? The state of Connecticut got rid of
Right.
the auxiliary program pretty much for that reason. You got somebody who rolls in once a month to go work a shift. That person is not up to snuff, up to speed, and they have very little buy-in with the agency. They're not supervised regularly. It presents, I think it's just opened up Pandora's box again, and we don't want to make mistakes to say, well, we need bodies, so let's just try everything. It has to be a gauged response. We still need properly trained officers to do the job that we're requiring of them. And it's becoming ever more difficult to do that because there's more and more constraints, there's more and more oversight, there's more and more restriction on our ability to do our job. So you can't bring in somebody, on an ad hoc basis to do that job and expect that we're not going to have collateral damage or we're not going to have bad outcomes. And we can't suffer any more bad outcomes. So
Right.
if you want to have volunteers in policing, then there's already programs established for that. You have, community emergency response teams that help you with traffic during emergencies, and they can help do traffic during events. You have volunteers in police service or VIPs that can help you in your records division. And I think Florida does a great job of this. There's a huge number of departments in Florida that employ this. And they go a little bit further, but they have retirees as a big part of their process. So, even their volunteers may be working 25 or 30 hours a
Right,
week.
they have
So,
the understanding of what they can do and what
you're
they
not gonna,
can't
I don't
do.
think we're not gonna realize that here.
Right,
Because
right.
our volunteers will go to Florida
Yeah, I just
for the
thought,
winter and then come back.
I just saw huge liability issues and I really just don't know what they would do. And I mean, I know there are certain functions that police departments, especially larger police departments, can privatize, but they always bump up against the union and those seem to, die an early death. But still with auxiliary, I just didn't see,
I think if you're looking at it from a risk management paradigm, the, you know, the outcomes, the likelihood of negative outcomes far outweighs whatever benefit you would derive from it.
I think that if we're going to invest, if the legislature is going to invest in a task force or a working group to look at something, rather than looking at supplementing police departments, we really should be looking at the understaffing issue.
Correct.
And there's a lot of, it's a nuanced conversation and it's a nuanced problem. It's not as easy as saying, you know, let's give them health care or cut back on mandatory overtime. I mean, it goes from young people just have a different view. I mean, I have a lot of friends that still work in police departments and they're part of the hiring process, you know, the testing process, and they get to the interview process and people drop out because they don't want to work weekends or they don't want to work nights or they don't want to work or they told me they have people that tell them they don't want to wear a uniform. And it's like, well, have you ever met a police officer? Like, so there's that issues of, right, like the younger generations coming in and having a different paradigm of what a career and working is all about. And I really think we should be looking a little bit at, I think there's an untapped population. It's those second career people, right? Someone in their 30s, early 40s who's done a job and just wants to switch. And I think that's a good resource that we're not looking at, because those people come in with some maturity and experience and they're going to look at the job differently than someone in their early 20s, right? Like, I mean, you've been in the job a while. I mean, you show up on a domestic and, you know, you have someone who's 22 trying to talk to two people who've been married for 40 years.
Well, they
Like,
text you, they
it's
text them,
not
they
gonna-
get their number to text them.
Yeah, yeah, a lot of times it doesn't go real well. But I think if we're going to spend some time investigating an issue, maybe auxiliary police isn't the best use of our time. It might be better spent really understanding what's driving.
We would fully agree with you. And the Police Association of Connecticut was formed in 1902, and our mission was the betterment and protection of the law enforcement officers of Connecticut and improving the facilities in which they deliver service. So I think we're good partners with you with that. And I think, honestly, again, to get to the root of the problem that we've all been talking about is if we don't have the bodies to do this job, we can't deliver the service. There's the tipping point. Okay, less capability just means less delivery of service. Less resources equals less capability. And the outcome of less capability is people get hurt, and that's.
And my last question, chairs, really, is in here, the section in here about retired officers working part-time. I know there's just only, I think, less than 5 police departments that really have part-time officers, but I kind of like that idea of a certified police officer who retired from full-time work, maybe working part-time in their hometown or a town close by, or the district that I represent, our population swells in the summertime. We're a tourist district down on the shoreline.
That's us.
So having part-time officers who can work from, you know, May to Halloween or Thanksgiving would be a benefit. And what do you think about that?
I'm sure you're not averse to manpower, and if you have a trained certified police officer that maintains their certification, and obviously you have the right ones, you know, some people, we can't wait till they retire, unfortunately, as chiefs. But, you know, there's a lot that leave you that you don't want to leave, but they're done and they still can provide a service. They still have the desire to serve. So it may be just a few months of the year and it may be in the summer when you need them most. I
Right.
think it is a viable resource and certainly a stopgap measure for where we sit right now, because it's going to take a long time to correct course for us and get us back to the staffing levels across the profession that we need.
Right. Well, thank you very much for all your information. I appreciate it, and good luck, and thanks for all you do. And back to you, Mr. Chair.
Thank you so much. Any additional questions? Yep, Representative DG Giancarlo.
Chief, good afternoon.
Sorry, sir.
I'm going to be quick because I don't want to beat a dead horse here. But first on the healthcare comment, it is as simple as healthcare, because in Waterbury, once we took our healthcare away from our retired officers, the floodgates opened and we lost a tremendous amount of officers to other towns. We were talking about the poaching before. we had the poaching law, and these little towns would gladly take a well-trained officer from the Waterbury Academy, which runs under post and is probably one of the, I think, I'm biased, but one of the finer academies in the state. And they'll gladly pay 50% to take an officer that we've trained, that we invested our time, our backgrounds and everything into. So I believe the retention starts, and I'm going to be honest, at the town or the city that you work in. In Waterbury, we were under a 300-man force. Again, I don't want to keep repeating, but went down to about 240 something. At that point, the decision was made to really raise the pay of the officers in the Waterbury Police Department. Unpopular decision, had to raise taxes, with some of the taxpayers, but once we invested in our officers and got the pay up, that stemmed the tide of the outflow. It also took away the holdover after holdover after holdover, which was depleting our department anyways, because nobody wanted to work that much in a busy city. We're not in, no offense, Stonington, where, you're going nonstop to each call. But we in Waterbury, we've raised our pay. We've changed our schedule for our officers. We've taken in laterals to help fill the spots of the officers that we've lost. But I will say this, you are a city or town and you want to get rid of your pension and you want to go to a 401k, your officers and your firemen are leaving. If you want to, to get rid of the healthcare, which listen, healthcare is expensive. We are paying the price of healthcare in Waterbury. But again, we can talk retention and retaining and recruiting all we want, but that city and town has to be vested in their officers and their firemen. They got to be willing to spend the money. They got to be willing to raise the taxes, because when you sit there at $60,000 with, a 401k and that officer's not staying. So I think it's up to each town. Like, again, we did it in Waterbury, and I know New Haven absolutely stepped up their recruitment and their
Chief Jacobs is very happy.
Their contract is
To get that
absolutely,
stem the tide.
terrific. So I just want to make that statement. Nothing we're going to do here at the state level is going to help a town or city unless they're vested in their police officers, their firemen, and they're willing to spend the money.
Well, I would say to that, sir, that I certainly agree that we're talking about the root of the problem, right? Incentivizing the profession so people are going to be attracted to it. The proper good people are going to be attracted to it and stay in it. I would say that you can, at the legislative level, put in financial support systems which would incentivize these municipalities to provide that. So I think there is an avenue there for real support. And a lot of the smaller, municipalities that don't have a lot of money, or even some of the larger urban areas that don't have the funds. So if the state could realize and put a priority on public safety, we need to support this, we need public safety, and these are the things that we're going to do. These are the programs that we're going to provide to the municipality, so long as you meet whatever parameters, then I think it's a huge help. So that's why I'm here, because I think that you have the opportunity to support us and to support, I get it, Connecticut's a home rule state, right? Everybody's their own little fiefdom. But it's a statewide problem. Public safety is a statewide problem. We don't have enough. We only have 5,800 officers statewide and a population of nearly 3 million, right? That's a big task. We need the support system. We all need to work together. And I think we're here again, trying to provide avenues to make that work. So as the largest police officer association in the state of Connecticut, that's what we're here to do. We realized all along that we're partners in public safety. We're here to work with you. We all want the same things. We want this to be the safest state. We want people to feel comfortable here. We want them to feel safe and secure here. And we need the right people to do the job. And we're in a crisis now. We need help.
Agreed. And my final comment is, obviously, us getting back to 300, to the number we should be at, opened up the doors for a federal grant, which pays for our next 15 police officers for the next, I don't know the year timeframe, I apologize, but it's a huge advantage for us to stay above that number now, and it's incentivized us to really try to stay over there, because they pay whatever is over 300. So again, federal help, state help will definitely help a lot of the big cities, but also our cities and towns all have to do their part too. So thanks. Chief.
Absolutely. No, 100%, sir.
Thank you. Chief, you referenced Florida a couple of times during your presentation and the sophistication of what they're doing there. Today, you make me proud to be a native Floridian who happens to be a sophisticated public safety chair in the state of Connecticut. I also wanted to, you mentioned something about Stratford. You had folks that live there. Please let them know if they can't vote for me, at least they can come to some of our town halls in Stratford. And thank you for all that you shared today. It was very informative. And thank you for the great work that you continue to do to advance the law enforcement arena, and wish you very well. Any additional questions, comments? Seeing none, thank you, and hope you have a wonderful day.
Appreciate the opportunity. Thank you.
You're welcome. I also wanted to just remind members of the committee that we still do have a robust agenda, and there are a litany of people that signed up online and also in person. And so if we can be a little conscientious about streamlining our questions, I would appreciate it, and also giving some of our other members opportunities to engage in discussion with the members that may come before us. Also, I wanted to remind our clerks for the 3-minute rule. Please set the timer as we continue to engage, because we want to make sure that people are at least able to get home to get their kids off the school bus and to have some dinner with their kids. Alec Slatke.
Good afternoon. My name is Alex Slacky. I'm the Managing Director of Public and Government Affairs for AAA Northeast. I'm here to testify in support of Section 1 of House Bill 7204, the bill related to blue lights on tow trucks. You heard a lot earlier from Selena, who gave a great bit of testimony about why this is a good idea. At AAA, in our public affairs department, we try to advocate for safety. That's our job in the community, with the media, and with policymakers. And I think the most important part of that job is doing as much as we can to protect the men and women that work for us and all the other tow truck companies around the state that are out there doing the work they do to keep drivers safe. So I don't want to repeat any of the testimony from earlier, but I do want to just highlight a couple stats and studies that I think you might find interesting. The AAA Foundation for Traffic Safety did research related to near-miss reporting for roadside responders, and pretty much every type of first responder reported an alarming level of near misses from cars passing them. But the tow truck drivers reported the highest rate of near misses. More than 50% said they experienced a near miss every week. 30% said they experienced a near miss every day. You heard earlier the hair-raising stories that thankfully didn't result in a fatality, but very unnerving. Another AAA Foundation for Traffic Safety study found that over 60% of fatalities among tow truck drivers and roadside workers occur at night, implying lighting would help. I've submitted testimony with a few studies that show that blue lights are effective in communicating to drivers that there's an elevated level of risk and makes them more likely to move over and slow down. One from Texas, one from Minnesota, and one from New Zealand. And there's probably more out there that I didn't include. So I'm happy to share more about those. There are more than 10 states that allow blue lights on tow trucks, and we certainly do not want any confusion with police officers. I like the idea earlier of saying, hey, this is just rear facing, right? That's what New York has. The New York law says that this is just rear facing, because we don't want a tow truck driving up and trying to get cars out of the way and pretending they're, a police vehicle. Certainly not. So I think the fact that the bill says this is stationary, or says that the fact that the bill says this can only be in place when the tow truck is stationary, it makes sense. I think if you wanted to add this is rear facing only, that could make sense. I think if you wanted to say this is only when police officers aren't there, that makes sense as well. I know in New York, our drivers, our AAA drivers say that they think the blue lights do help. Certainly not a panacea. Certainly not going to, it's not going to eliminate risk, but we hope that it will help to reduce risk, and would be happy to work with the committee to hopefully come up with language that works for everyone, that keeps our tow truck drivers safe. So thanks for having me.
Thank you. Any questions from members of the committee? Representative Howard.
Very quick, Alec, thank you for being here. Thanks for your testimony the other day in transportation. I appreciated that.
Absolutely.
And I was going to ask you about rear facing. I'm glad to say you support it. The near misses. We have a law in this state under 14283B that requires people to move over, right? Does AAA consider that to be a moving violation?
Yes.
Thank you, Howard.
Absolutely.
Appreciate it.
Thank you. Any additional questions from members of the committee? Seeing none, thank you so much for joining us today, and we appreciate your hard work and all that you do.
Thank you.
Teresa Fanning from AAA, Territory Manager. Welcome to the Public Safety Committee. Teresa? Okay. Shia Gregg, Dr. Shia Gregg, or Shay, Connecticut State Trauma Committee.
You're correct, Senator. It's Shay.
Shay, what a nice
Pleasure to
name. I
meet you.
like that name. Thank you, Doctor.
So thank you all. Thank you to the members of the Committee of Public Safety and Security. Thank you to my esteemed co-advocates that are in the audience today. Thank you to Representative Haynes, who was here earlier. And it's an honor to be with you today to present supportive testimony for HB 7200, an act concerning bleeding control training in kits. My name is Dr. Shay Gregg. I'm chair of the State Trauma Committee, and I'm a practicing trauma surgeon, and I'm chair of the Department of Surgery, St. Vincent's Medical Center down in Bridgeport, which is a level 2 trauma center, one of the 15 trauma centers in the state. So to preface my testimony, I would like to offer the following real stories that happened over my career during my 17 years of service here in Connecticut. Number one, while traveling down the highway, 2 off-duty EMTs saw a horrific motorcycle crash where a young woman was thrown from her motorcycle. When they stopped, they saw that one of her extremities was amputated and she was bleeding to death. Acting quickly, they were able to find a tourniquet and place it immediately, thus significantly reducing bleeding. The responding ambulance arrived and placed a second tourniquet per protocol, which stopped the bleeding. By the time the patient arrived at the emergency department, she was able to answer questions, follow commands, and was stable despite the amputation. She would not have been stable and able to answer the questions if they didn't stop the bleeding. Number 2, while outside in the garden, an older woman turned suddenly and suddenly dislocated her lower leg at the knee. While falling to the ground, the injury lacerated the back of her knee area and her popliteal artery. Immediately, firefighters responded and recognized the severity of the bleeding and quickly placed a tourniquet on her thigh, which stopped the bleeding, and actually used wood on the yard to splint the injury. She was transported rapidly and to the emergency department and was in stable condition, where we took her to surgery emergently. Because they stopped the bleeding, she was stable enough to get to surgery. Number 3, a father was assisting his son with a car repair on the side of the road. While walking between the cars, a rear car was struck by a motor vehicle traveling at a high rate of speed, sort of relevant to the other testimony provided here today, pinning the father's legs between 2 parked cars, causing severe open fractures. The injuries caused secondary lacerations in the skin and injuries of the arteries, which led to significant bleeding. The son placed immediate pressure on the area. When the police arrived, the police placed the tourniquet, which controlled the bleeding in the lower extremity. We were able to save both of that individual's legs, and he walked out of the hospital. In these 3 stories, I'm happy to say that positive outcomes resulted from the form of lives and limbs that were saved as a result of quick actions of medical and non-medical bystanders practicing basic techniques and leading to bleeding control. However, bleeding-related deaths continues to be responsible for 40% of all trauma mortalities, with over 50% occurring before people even reach the hospital. Although we can't stop all bleeding at the side of the highway or in the kitchen or at high-risk workplaces, extremity and some truncal hemorrhage can be stopped, and this is where HB 7200 can make a difference. On December 14th, 2012, the shooting of elementary school students and their teachers at Sandy Hook Elementary, followed by a terrorist bombing in Boston, at the Boston Marathon, shocked the nation and stimulated the American College of Surgeons and its Committee on Trauma to convene a panel of experts ranging from the DoD, the FBI, Homeland Security, and professional associations of emergency physicians, EMTs, firefighters, and police chiefs. The meeting took place here in Hartford, Connecticut, and led to the Hartford Consensus. It was ultimately the basis for the Stop the Bleed Hemorrhage Control Program, which has trained 4.7 million individuals worldwide with 170,000 instructors. Today, we are looking for the state of Connecticut to enact legislation that was passed successfully in 4 states, being Texas, California, Indiana, and Arkansas. And through HB 7200, we aim to make hemorrhage control education mandatory for certain public safety officials, high school students, and support the installation of hemorrhage control kits in state-owned buildings to provide equipment to control hemorrhage. We really hope you can help us make a difference. I'm open to questions, and thank you.
Thank you, Dr. Shea. I hope to not visit you in the St. Vincent's Hospital. However, the only pull I have here in the legislature is to give you an additional 30 seconds to sort of wrap up if you need to, because you're from Bridgeport. So I know you may have a little bit more to say.
Actually, I'm more interested in listening at this point.
Absolutely. All right. Representative DG Carlo.
Thanks, Doctor. Good afternoon. Just a comment. One of our officers was shot a few weeks back, got hit very high in the leg in a very location very close to the femoral artery. And those officers immediately got to the officer, put a tourniquet on him, and absolutely took care of the area while getting him in the car and transporting, which obviously, thankfully, it didn't hit the femoral artery, but it's something that we would not have carried on us 10 years ago. So
Right.
I'm obviously a big supporter of the bill, and it is definitely something very important to a lot of us in certain fields. So be glad to support it. And thanks for your testimony.
Thank you. Thank you for offering.
Any additional comments from members of the committee? Dr. Shea, thank you so much for representing the great city of Bridgeport. I also represent the city of Bridgeport, and very much familiar with the president of your hospital, who used to serve at Bridgeport Hospital and is doing such a Herculean job there. So please relay my regards. And thanks for the work and for being a healer for folks who so desperately need you in times of crises. Thanks for joining our committee today. Have a wonderful day.
Thank you, everyone.
Do we have Katerina Fetetko? Katrina? Okay. I am a professor, so I should know students and people's names. Selena? Okay. All righty. Josiah with CT, Kenna Warriors? Online.
Hello. Good
Hello.
afternoon.
Welcome.
Can you hear me okay?
I can hear you just fine.
All right. Good afternoon to the respected members of the Public Safety and Security Committee. I'm here today to testify in behalf of amending this bill to strike Section 7 and just remove all that language, because this language has already been ruled unconstitutional for burnt cannabis in Illinois and unconstitutional for the odor of cannabis in Maryland, the odor of cannabis in Massachusetts, and the odor of cannabis in Pennsylvania. Even though it's not even legal in Pennsylvania, they still consider it unconstitutional. I am totally against DWI intoxication. I think it is reasonable to look for the odor of burnt cannabis, but not unburnt cannabis, because this opens up a window to, if you look closer at Section 7, for example, dispensary employees, legal employees at a dispensary being pulled over who smell like cannabis and being searched and their car torn apart. And if someone has cannabis in proximity to, without even proof that there's cash, if they think there's cash near $500, they're able to search the vehicle. And then this just undoes the entire basis of legalizing cannabis in Connecticut, is stopping the targeting of the most vulnerable, the minorities. So I would strongly advise just striking this entire section, focusing on only the odor of burnt cannabis, like people who are driving and using cannabis intoxicated, that's dangerous. But certainly not the odor of unburnt cannabis. And I welcome any questions, because I did a lot of research into what states this is constitutional or not in, and what other states are doing about this. And I appreciate your time.
Thank you so much. Any questions from members of the committee? All righty, seeing none, thank you so much for sharing your testimony on today. We really appreciate your time. Anne Marie Rosado, online.
Good afternoon.
Good afternoon.
Good afternoon. Well, it's good afternoon. Good morning. Or I got the days wrong here. Good afternoon, distinguished members of the committee. My name is Anne Marie Rosado. I am the founder of Higher Health. We provide medical evaluations and certifications for those wanting to enter the Connecticut Medical Marijuana Program. I have also been the cannabis education consultant for the last 3 green labs here in Connecticut. I am also a member of the Impaired Driving Task Force. I am a dispensary owner in Massachusetts. I am also a medical marijuana patient, but most importantly, I'm here to speak on behalf of those who may not be able to speak for themselves or may be too timid. I started off in the cannabis industry as an advocate. I wanted to ensure that there was an alternative for opioids. And in 2020, chronic pain was added to the list of qualifying conditions to get your medical card. Myself and other amazing advocates you will hear today have given many individuals a second chance and an alternative. Unfortunately for me and so many other families, we suffered tragic losses. I became a widow at the age of 46, along with losing 2 other family members to opioid overdoses. All of these deaths were at the hands of trusted physicians that overprescribed. This bill is disturbing for those of us working in the cannabis industry, medical patients, and consumers. If you work in the cannabis industry, you will smell like cannabis. Second, medical patients suffer from severe ailments. PTSD is one of the most common conditions that we certify for, and I am very outspoken about my PTSD diagnosis. Certain situations, like the threat of a pullover, will trigger your PTSD. No one should be operating a vehicle under the influence of anything. Most accidents here in Connecticut have been under the influence of several substances. Unfortunately, cannabis stays in your system for approximately 30 days. So this means the chance of most people being testing positive for cannabis, that will be so, especially medical patients. Unlike alcohol, there's no widely accepted field test to determine if someone is under the influence of cannabis. More research is needed to accurately determine this. Inaccuracy will have severe negative influence on a person's life. Continuing green labs and trainings for officers are the only way to determine impairment. Funds are an issue. There's also a social equity fund. That's supposed to be for education and prevention. I'd like to see those funds used for that. Pulling over individuals without cause is against their Fourth Amendment right. Cannabis has healing and medicinal properties, and I have not come across any of these in alcohol, yet every session there is a knife put to the throat of my industry, a continued stigma. Last year, hemp-derived drinks were put in package stores, yet poly usage is the real issue here. I'm sure a lot of these officers that were here today can agree with that. Again, a trusted leader's decision. This encourages the mixing of substances. Lawmakers, law enforcement, and the community can all work together if we are all heard. I thank you all for your time today.
Thank you. Any question? Yep. Representative DGO Von Carlo.
Hi, good afternoon. Thanks for testifying. You just stated getting pulled over for no reason is against your constitutional rights. If I'm drinking a beer and I'm driving down the road and I get pulled over, I was stopped for a reason. Would you agree I may not be impaired, but I'm definitely drinking a beer and I can get pulled over by a police officer, correct? Do we agree on that?
Yes, if that beer is definitely seen as a beer.
Right. So if I clearly see you smoking marijuana, I have a heavy odor of it, you're the only person in the car, I'm following you, I see smoke billowing out, you don't think that that person should be pulled over?
I'd like you to clarify marijuana There's also there's CBD that can smell exactly like
Yeah.
marijuana.
Marijuana, whatever you want to determine as that, I pull you over, and that also can be kind of no harm, no foul, right? When I pull you over, and if you say that, and whatever it is, but I just think that there's the concept that or the belief that, hey, I'm just smoking whatever, but I'm not impaired. You are impaired. You're smoking a drug that is impairment. I do agree with you on the how long it stays in your system. So if you definitely have not smoked in a couple of days and you get in an accident, and it's maybe a horrific accident, and there's a cause, I agree with you on that one. There's no really strict way of letting us know how long you've or it's been since you smoked the marijuana. But I think that even the medical marijuana, you're not supposed to drive
Correct.
hard, and people do, and I understand you do, but there's that belief that, I have the right to smoke marijuana and not get pulled over, but the guy that was drinking the beer down the road has, he gets pulled over. So I think it's just it's a fairness thing. I don't think I'm pulling you over for no reason. I'm thinking that maybe I would pull you over because I think you're a danger on the road. You may harm somebody. And I think that's where the disagreement is with a certain group, and then my belief. I believe that you're smoking marijuana driving down the road, you got a good possibility you're impaired already. And so
I'd like to, if I could, I'd like there to be a little bit of clarification around this bill. I think what's happening is that there's certain things that want to be striked from it. There's certain things that want to be implemented in it. I agree. The smell of burnt cannabis, making sure that it is burnt cannabis, there being the absolute reason for a pullover. At the end of the day, there's so many versions of the bill. There's so many assumptions. You have to have reason to pull over, correct? It's your right to not, there has to be reason to be pulled over. So in this bill, first of all, it says the smell of cannabis. So when you work in the industry, whether you're working in a grow house or for me in my dispensary, if I'm in my vault all day, I'm going to come home smelling like cannabis. I do not consume and drive. This is why I got involved in officer training, because I love that aspect. I am the last person that is going to get on the road under the influence of anything. No one wants to get into the car with me because I am such a fearful driver. So it's not a person like me that you have to worry about. However, I do have medical patients. I give everyone a safety course when they come to my clinic. So I am a safety freak, but I know that there's people that are going to break the law every day. This is why we're here. But I just don't want anyone to get pulled over because it's let's see if they're smoking weed. Let's see what's in the vehicle. And I'm sure that you're all feeling the same, but I think the language in this bill is just very confusing for individuals. And I think it has to be very black and white. Are we pulling people over because they smell like cannabis, or we have to see if they have it in the vehicle? And I think that's what we're trying to understand.
Sure. And I'm going to leave you with this. There's nothing more frustrating than you're working in front of a school and a parent pulls up, drops off their child or children, opens that door, and a cloud of smoke comes out of there like Cheech and Chong are inside the vehicle, and nothing you can do about it. To me, that's all. I see risk of injury. I got to be honest with you. You can't smoke cigarettes around children, but we can fill a car up with marijuana smoke, drop them off to school, and then just drive away. To me, I have an issue with that. Maybe we disagree, but thanks for you testifying. I appreciate it.
No, I agree with you. You're very welcome.
Ranking Member Howard.
Thank you, Mr. Chairman. Thank you, Anne Marie, for being here. I just want to add some clarity. I was in the room negotiating the marijuana bill when we legalized it in 2021. So let's backtrack a little bit. To your point, police officers in this country, because of case law, can only pull vehicles over when there's a reasonable suspicion of a crime or a motor vehicle violation. We're in agreement about that, right?
Mm-hmm.
Okay. When marijuana became, under the Carroll Doctrine, Carroll v. U.S., police officers can search vehicles on the side of the road when they have probable cause. Prior to marijuana being legalized, the odor of marijuana was probable cause of a crime because marijuana was illegal. We agree on that?
Yes, sir.
Okay. So once we legalize marijuana, the odor of marijuana is no longer probable cause to search a car because it's not illegal. It's no different than smelling a, I don't know, dirty gym bag or a bologna sandwich. It's an observation you make, but there's no probable cause to search the car because it's now legal. We agree on that.
Correct.
Okay. The problem is, well, then when we passed the marijuana law, we said it's illegal to smoke marijuana while driving a car because it impairs you in the moment. Do we agree on that?
Correct.
Okay. When we passed that bill, we said a police officer who observes somebody smoking marijuana driving a car cannot pull them over just for that. Do you think that's appropriate?
No, I don't, because, I think it's just there's so many gray areas here. I agree with you. No one should be smoking under the influence of anything. But to say, hey, look, there's just the smell. I just want, and it's not just me. I think it's unfair to say, hey, look, we have an open container law in Connecticut. I think it's the language in the bill that's confusing. And I think I'm going to leave it at that. I think the language needs to be more clear, because until we have a determining factor of what is under the influence, how can we determine what is under the influence? I would hate to see someone, it's not just about the pullover. I'd hate to see someone get a DUI when we can't determine what is intoxication and what is more dangerous, what substance is more dangerous than the other.
Well, that's not addressed in this bill. When we
But
passed
it's a
marijuana-
snowball of it, right? Because if you're still going to be pulling people over and hitting them with a DUI after that pullover, it's still a snowball of that bill. But yes, to your point, what is the actual language of this bill? The smell of cannabis or burnt cannabis?
Well, when we passed marijuana, we created zero tolerance, right? So if you're actively smoking marijuana, you have marijuana in your system, regardless of the measurement. Can we agree on that?
Yes.
Okay. So the DWI aspect is not addressed in this bill. What this bill is seeking to do, and I can appreciate that the language can be a bit confusing if you weren't there to negotiate the whole thing and don't understand the case law. But the bottom line is the mere odor of raw marijuana, absent the action of somebody smoking it, or smoke, as my colleague said, bellowing out of the car, in a court of law, in my opinion, and I have significant experience in this, would not hold up. If a police officer says the car went by and I smelled marijuana, so I pulled it over, didn't see any smoke coming out, didn't see the driver actively smoking, or the passengers actively smoking, because that's prohibited by law too, then it's a bad stop. And anything that happens after that is called fruit of the poisonous tree, and it's out the window. So while the language may be confusing, what this basically is doing, just to clarify for you, is it's eliminating the provision in Public Act 21-1 that says police officers who see people actively smoking marijuana and driving a car are prohibited from stopping that car solely for that reason. It seeks to limit that prohibition in the interest of traffic safety. Does that make you feel more comfortable with the language?
A little bit, but I think I understand it for myself, but I do want to make patients feel more comfortable that they're just not going to be wrongfully pulled over because they may have gone to the dispensary, have some cash in their car, and have product in their car that may smell.
Well,
you have to understand, I'm also working with a population that is very vulnerable. You have to understand there's sick people, there's debilitating people, and these laws, the way they're written, are very confusing. I can understand. You can make me understand. You can explain it to me, but I need it to be explained in an elementary form where the general population will understand. Does that make sense?
Well,
because these are very scary for people.
Well, I would say this, if I was in your shoes, knowing what I know about these laws, I would say this to my patients. If you smell like marijuana, you're not illegal. If you are using marijuana, you're not illegal. If you are smoking marijuana while driving a vehicle or operating a vehicle while under the influence of marijuana, which can be determined by drug recognition experts, there's not many of them, but they could, then you are illegal. So if it was me, I would say to my patients, here's your marijuana, smoke your marijuana, don't drive while you're smoking, and don't drive under the influence, and you've committed no crime. And if a police officer arrests you for committing no crime, you just got very, very rich, courtesy of the state of Connecticut. That's what I would say.
Got it.
Thank you. Thank you, Mr. Chairman.
Thank you. Any additional questions coming from members of the committee? All righty. Seeing none, thank you so much for sharing your testimony today and for advocating on behalf of your patients and those that you consider to be most vulnerable. I appreciate it. At this time, we'll have Frank Vumbaka from the International Association of Firefighters to please come forward. Thank you for joining us.
Good afternoon, chairpersons, ranking members, and members of the Public Safety and Security Committee. My name is Frank Vumbaka, and I represent the International Association of Firefighters, Local S15. I'm an e-board member and a steward. We proudly serve the firefighters and fire inspectors at both Yukon Stores and Yukon Health, as well as all the other state agency fire departments. I'm here today to speak in strong support of House Bill 7201, an act concerning a supplemental paramedic. Currently, Yukon operates an advanced life support ALS service at Yukon Health and a basic life support service at Yukon Stores. However, Yukon's paramedics frequently work at stores for various operational reasons. Despite their qualifications, when they are assigned to stores, they are not permitted to practice at their paramedic level, leaving them in a moral and professional dilemma, forced to not be able to give the best care to their patients that their training allows. To illustrate the problem, I want to share a specific incident. One of our paramedics at Stores was questioned for noting in a report that they had interpreted an EKG of a patient. While performing an EKG is within an EMT scope, interpretation is a paramedic level skill. They were essentially asked to ignore years of training, education, and experience, not because of medical necessity, but because of regulatory barriers. This is a disservice to our patients, and it's a contradiction to the very reason why we train our paramedics at such a high standard. This legislation provides critical benefits to the region by enhancing emergency medical services without negatively impacting existing providers. Wyndham Hospital paramedics are highly skilled professionals who provide excellent patient care. However, they are often stretched too thin. At times, only one paramedic unit is available to cover over 300 square miles, leading to delays in response times. The current average response time for a Wyndham paramedic to arrive at Yukon Stores campus is over 12 minutes. Though not their fault, but simply due to the vast area they are required to cover. In contrast, Yukon ambulances have an average response time of just 3 minutes, which if able to have an operational paramedic on board, would immediately save 9 to 10 minutes. This bill does not replace or displace Wyndham Hospital paramedics. It supplements them. Wyndham can still respond to calls on campus if they choose to, but this legislation ensures that Yukon's highly trained paramedics can provide immediate, life-saving ALS care when seconds matter. A common concern with EMS legislation is the financial impact on existing services. This bill does not reduce Wyndham Hospital's financial viability in any way. Since Wyndham Hospital remains the nearest receiving facility, they will still receive the same patient at their facility regardless of who the paramedic provider is. House Bill 7201 is a win-win scenario. It ensures fast ALS care for students, faculty, staff, and visitors at the Yukon Stores campus. It alleviates pressure on an already overburdened regional EMS system. It protects Yukon paramedics by allowing them to perform within their full scope of practice without fear of liability or professional repercussions. It does not take away any financial benefits or diminish the role of Wyndham's hospital paramedic program. This legislation is about saving lives, strengthening emergency services, and ensuring that every paramedic can provide care they are trained for. For these reasons, I urge you to support House Bill 7201 and help us make this a much-needed improvement to emergency medical care in Connecticut. Thank you for your time and consideration. I'm happy to take any questions.
Thank you. Any questions from members of the committee? Seeing none, thank you so much for your testimony. Have a wonderful day. Oh, so sorry, Representative Jenga. You moved that hand slow today. Normally, you're pretty fast.
Tough.
Tough today.
Tough.
Absolutely. Thank you, Representative.
Thank you. Thank you for your testimony. Can you give us any specifics or any statistics on the amounts or the individuals who've been getting less than the best response from EMS?
I can just tell you that with the statistics that Wyndham paramedics take about 12.8 minutes to get on campus and that's for ALS calls, obviously. And our
The interim chief testified about 9 to 12 minutes.
9 to 12, yeah. I've done some statistics myself, and it was about 12.8. I think Chief Renshaw,
Is that on an average?
that is on an average over a year.
Okay. And what would this process cut that to?
The going through the legislative route rather than
The process you're promoting?
it would decrease the on-scene time to approximately 3 minutes if the paramedic's on the ambulance with the crew. So you're talking anywhere saving, 10 minutes, give or take.
Can you tell me if a call is made and the primary paramedics are tied up, and how long it would take to get the backup?
I don't have that data readily available, but I can tell you anecdotally that our next paramedic would be out of Rockville Hospital, which is in the exact opposite direction to Wyndham. So obviously there's going to be a delay, and first of all, our dispatch center calls WW, their dispatch center, asks if they're available. They have to come back with an answer. If they're not available, then they have to start going to TN and ask if the Rockville medic's available. If they're not available, we're going to ASM, we're going to East Hartford, so on and so forth. So there's that built-in delay going through other paramedic services to see who is available.
You say they would go to East Hartford?
That's a possibility if
About
there's,
3 miles away.
I know
Has
it's,
that happened?
that has not happened, but what I can tell you has happened is a Manchester Fire Department engine has been requested for a paramedic. So ultimately, you're right, that's probably not going to happen, but that's the way that the process would work. Obviously, the further you go out, the farther you have to go out to find a paramedic, which is a finite resource.
But you don't have any data on this?
I do not.
Okay, thank you.
Thank you, Representative. When I was looking over data at one point, I did see the QV medic had been dispatched to campus a few times, which is coming
Correct.
from the other direction, which is still quite the distance to travel as well. So,
Correct.
Representative Quinn online.
Thank you, Mr. Chairman. Frank, good to see you. Sorry I wasn't able to stick around in person. How many students does UConn have on the Storrs campus?
Oh, well, this year is one of our highest freshman classes. I want to say during the day, obviously during the day, it varies compared to at night. So we have all those commuters come on campus. I would have to get back to you on those numbers, but I believe the number for daytime occupants with the commuters is around 30,000, and then at night it's about 20.
Right, and then at night you'd add on another 10,000 if there was a basketball game going on. I mean, I just don't think it's acceptable that it's a 12.5-minute response time when you've got that many people in such a small area. And whether it's done this way through the bill or you get it through OEMS, I mean, I completely agree. It's a matter of the UConn Fire Department being able to provide the best service, and having the ability to have a paramedic right then and there at 3 minutes is makes so much of the difference depending on the severity of the injury. Thank you.
Thank you, Representative.
Thank you. Any additional questions, comments from members of the committee? Representative Shake.
Thank you, Mr. Chairman. Question for you. Have there been any instances that you know of where if there's been an event or an occurrence of someone needing medical attention, that there has been a delay of intervention? Any negative or near miss outcomes at UConn?
So what I can testify on is that there has been times where paramedics have not been available, and my members have had to make the decision to transport the patient rapidly to get them to the hospital. So there is that delay in care, but we do what we can.
Absolutely. My question was not intended to, throw fault to those that are responding. It's the circumstances, it's the system that's basically being a hindrance. And legally, in healthcare, if there's a delay, and I'm sure you're all aware of this also, if there's a delay of intervention, then that said organization or what have you, they can be held responsible for the reason as to why there was a delay of intervention, because time is everything when it comes to being able to respond and save someone's life or limb or structure, whatever the case may be. But in this case, we're talking about paramedics, so we're talking about people. So there have been instances, you don't have to go into detail about it, but having personnel in place that are qualified, which is the intention of this bill, to be able to respond would decrease the possible occurrence of, whether it's, I don't know who would be held liable, if it would be the institution, this case being UConn, or if it would be, surrounding municipals of whatever capacity that may be. So, which then opens up for me, as we're having this conversation, for UConn itself. I mean, do they have staffing concerns also for their personnel? Are you able to speak on that for emergency services? I don't know, so.
Well, so yeah, I believe UConn's obviously on board with this. We had Michelle Williams speak earlier today in support of this. I believe they see the concerns. I think the bigger concern is that we have people and the equipment, for the most part, right there, and those individuals, my paramedics, can't utilize their skills and help those individuals sooner.
Thank you.
Thank you. Any additional questions? Alrighty. Seeing none, thank you for your time today. We really appreciate you being here. Brian Anderson from Council for AFSCME, Legislative Director. Welcome.
Thanks, Chairman Herron and members of the Public Safety Committee. My name is Brian Anderson. I'm Legislative Director for AFSCME Council 4. We have 2,000 municipal police officers. There are 3 bills I want to testify on, so I'll keep it brief. Our union really appreciates the work you've all done on Senate Bill 1492. This is the police recruitment and retention bill. I could give you an example why this bill is needed. The lack of police officers in the city of Bridgeport is profound. There's supposed to be 400 police officers on duty. Right now, there are 270. That's a disturbing shortage. This leads to overworking and burning out our current officers, and Bridgeport isn't alone in this respect. I'm told that other cities, particularly the bigger cities, are in a similar position. We support many sections of this bill. Section 6, I think, is a really important bill. This section is based on the Education Enhancement Act that Connecticut passed in the 1980s when there was a severe shortage of teachers on the job. The state stepped up and realized money talks, and the state had to come up with funds to help the towns out to get and retain qualified teachers, which they were losing at an alarming rate. I would submit to you the same thing's happening with police officers. I've heard folks speak about the fact that the top 10 towns might not be the way to do it. We're open to any ideas, but we were told, come up with an idea that doesn't cost so much at a time when the state is facing big financial difficulties, particularly predicting what's going to happen with cash flow that normally comes from federal grants. This was our idea to affect the market. If you went to the top 10 towns and provided, for instance, a 10 grand payment to increase officer pay, you would be able to make a big difference in retaining officers, keeping them in those towns. One of the problems the cities face is officers can leave a difficult, stressful city job, go to a suburban police force and get a $10,000 raise in pay. That makes it really difficult to keep police where we probably as a society need them most. Well, that wouldn't help out every officer. It would affect the market. So if you help those 10 municipalities, no doubt you're going to help rise all boats for police officers around the state. Section 7, the bonuses, is in the same vein. That's very helpful. The higher ed sections of this bill to help officers get additional higher ed is much appreciated. Section 13, Section 14 to help officers acquire property is great. Section 15, the drop plan, our members are supportive of a drop plan. At this time of officer shortage, we think it helps. We are opposed to Section 17, which restricts a union's ability to bargain over the reemployment of full-time or part-time retired officers. We don't see any reason to restrict the collective bargaining process in regard to officer reemployment. The mental health sections of the bill are excellent. One of the things that is troubling is, as was mentioned today, the longevity, occupational longevity problem that officers face. Depending on the study you look at, officers die between 66 or 59 years of age. That's about 20 years earlier than the average citizen. So like Representative Shake spoke about, it's important for workers like this, with that kind of disastrously awful occupational mortality rate, to have a light at the end of the tunnel. And we think that'd help. I heard the bill. I'll summarize. Regarding Senate Bill 1489, regional police forces, we're not opposed to that, but we do want protections for existing officers. We think that allowing language in there that would allow for coalition bargaining would strengthen the bill. So often with regionalization, we've seen it done as an attempt to cut salary or benefits. Also, House Bill 7204, Section 12 is a really important section that would allow an officer to see video from their body cam or their dashboard before
Mr.
having to make any
Anderson, your
formal
time
statement
has
or go
expired.
into
Please summarize.
disciplinary proceeding. And I appreciate your time. Happy to answer any questions.
Thank you. Senator Ciccarella.
Thank you. Thank you for coming to testify. I know there's a bunch of bills up and you're trying to get through all of them, but you touched on a couple of them. And one of which was Section 20 that talks about the mental health support. You turn on the news, you see incidents all the time that are terrifying. And I know you represent a lot of officers, and I'm sure you hear stories all the time. And make sure that the officers really could cope with the things that they're seeing on a daily basis, I think it's really important. But if you were to take a guess, you know, how many times a day or a week that these officers are seeing horrific things when it's responding to domestic violence, car accidents, or some of the things that we see, on the news. Again, it's not always talked about on the news. So can you just elaborate how often these officers are subjected to such horrific things and how Section 20 would be able to help them?
Senator, that's a great point. This area has actually been studied a lot, and I can't remember, but off the top of my head, I think 20% of officers have suffered from PTSD. Some short term, some long term. I actually know an officer who was told by his psychiatrist that he had to quit the job. This officer had been involved in 2 justified shootings that resulted in fatality, and it broke him. So it at a 20% rate, occupationally, that's really high. I mean, I appreciate this section because I really do think that early mortality rate's a policy failure and that we could do something better. Section 20 helps address that.
Absolutely. And I do agree with you. And I think you're kind of segue into my next question that, that kind of stress on the mind does affect the body. You talk about a mortality rate of 20 years prior to the average profession. We see it in a lot of the first responders, police, firefighters, correction, and the life expectancy just isn't there. But what comes along with unfortunately, the passing of someone up until that point, sometimes there is medical visits, doctor visits, et cetera. And this talks about additional benefits, health benefits after retirement. I know a lot of individuals who go into the profession because they want to serve, they want to protect, they're doing it for their community, but they also see a light at the end of the tunnel, as you speak of. They talk about, working hard for 20 years, they're going to get a pension, they'll have health benefits, and we see a lot of towns getting away from that just because of the cost. How important is that, those benefits, those health benefits for them and the family, and that pension to the officers?
I'm told by our Bridgeport officers that when Bridgeport took away medical retiree insurance, that officers started to migrate out of Bridgeport. That's vital. To lose medical retiree insurance, it is awful, especially as we've talked about, for a job that can involve a lot of physical injury, but certainly a lot of stress-related injury.
Sure. And I know this is a very large bill, has a lot of sections. We've been talking about this for 4 or 5 years now, finding a way to address the problem of the shortage we have with our first responders, especially our police officers. We keep talking about it, but a lot of these sections are expensive, right? So if you were to say there's a couple that you think are a priority, can you just highlight 1 or 2 that you believe would make a huge difference to make sure these individuals are staying in the profession, more importantly, going into the profession? We hear too often that we have 2nd, 3rd, 4th generation police officers saying they don't want their child to go be a police officer because of the job, just the climate around the profession. And if you were to pick 1 or 2 of these, that would be the biggest deterrent to the problem that we're seeing here before us when it comes to the shortage of officers. What would that be?
I would say salary, pension. The discussion we heard on pension was really important. We can see towns like Middletown that pay a decent wage and have good pensions. They're not having a retention or recruitment shortage. Then you go to towns with cities with bigger financial difficulties like Bridgeport, where they're more than 25% staff short. I mean, that's awful. That's like on the verge of a disaster, I would say. If you took, for instance, just back to the envelope math, there's about 7,000 municipal police officers in Connecticut, or there's supposed to be. If you took $20 million, you could give 2,000 officers an extra $10,000 a year, target that to the areas that are most in need. make a giant difference. And like I said, there are some towns that can afford to pay more. You would force the market up, I think, in a positive way, similar to the state's Education Enhancement Act that stopped the teacher shortage.
I appreciate you for answering those questions, and we do see that around certain towns. North Haven specifically, they brought back the traditional pension system because officers were leaving, going to surrounding towns. And the first selectman realized how important public safety was and made that investment. And I think the state should do the same in making sure we're retaining qualified officers that do the job that's so needed to be done for our public safety. I want to take the time just to thank you, for your advocacy for the profession and testifying here today. Thank you.
Thanks, Senator.
Thank you. Any additional questions, comments from members of the committee? Mr. Anderson, I want to just thank you so much for all your advocacy on behalf of the city of Bridgeport and just underscoring the criticality of the needs of what's happening there and at other police departments across the state. And just really always appreciate your testimony before the committee. Thank you.
Thanks, Senator.
Also, I was benevolently scolded by my clerk, letting me know that I'd missed someone, so I really apologize for being unfocused. Alice Marie, would you please come forward to offer your testimony? Again, I apologize.
Good afternoon, everyone. My name is Alice Marie Tenner. I am here to speak on the proposed bill 7200. The reason I am here today is because I have factor 10 deficiency, which is a rare 1 in a million bleeding disorder. A symptom of factor 10 deficiency is when I start bleeding from any mucosal surface such as my nose, mouth, throat, and especially my internal organs. I cannot stop. My body does not have the ability to stop the bleed on its own because while my body can form clots, but it cannot hold them in place, making even minor bleeds dangerous. My bleeding disorder requires specific time-sensitive medication and treatment to ensure that the bleeding stops and I am safe. In a serious case, I don't have hours or even minutes to wait for treatment. If I was in a situation where I was traumatically injured, my body would not be able to stop bleeding on its own without intervention. Having a kit like this and people around me trained to stop the bleed could be the difference between life and death in my case. These training programs and kits will ensure firefighters, paramedics, and even civilians have the basic understanding and training and tools to safely and effectively treat all people who have a bleed, no matter if they have a bleeding disorder or not. I believe this program, if approved, will save many lives and is very important to the safety of all people moving forward. Thank you.
Yeah, thank you. First, for your patience of sitting around all day as we're talking about a bunch of different topics, as well as your testimony and your thoughtfulness when delivering that as well. So we appreciate you sticking around for that. Questions from members of the committees? Representative Howard.
Not so much a question. I just want to say, much like I did to earlier speaker, Waylon, it's just that you're so impressive to me. And you sat there. I hope you learned something about your government today. One, that it can be boring sometimes and very long, but it's all important work. And the two of you being here today has really really added a lot of fuel to this bill going forward. And I feel confident we can get it out of our committee, and the chairman and I will work together with our colleagues in the General Assembly to try to keep this moving forward before you. And it's not just folks like you that have these preconditions, but everybody. I think, like I said, and you heard testimony from a doctor earlier of how many people die from hypovolemic shock where they lose too much blood. So it's super important, and to see young people have so much care and concern is amazing, and it's really refreshing. So thank you so much for being here.
Apart, whether if you do or do not have a bleeding disorder, that those kits will help people in a traumatic injury, such as having an open wound.
Absolutely. Or falling. We have stairs out here, for example, falling down, banging their heads, head wounds especially, all kinds of accidents. So thank you so much. What a great point. Thank you. Thank you, Mr. Chair.
Thank you, Vice Chair.
Just a quick follow-up to Rep. Howard. You two have been terrific, you and Waylon, outstanding. Raised this bill to the top of my list, and I've already co-sponsored it. So good luck to both of you. You guys were both tremendous. So thank you for your testimony.
Thank you.
Thank you, Representative Shake.
Thank you, Mr. Chairman. I just want to say thank you so much for coming up and testifying. I am so impressed with how organized and eloquent and clear your voice is. And, you know, however this proceeds, I think you have overwhelming majority support from everyone here. But I also look forward to hearing and seeing you in most likely leadership roles in the future. So we hope to see you again soon, and thank you so much.
You're
Thank-
welcome.
Thank you, Representative Pools.
Hi. I want to echo the sentiments of my colleagues, congratulate you as well. I'm a high school teacher, and at my school, we have AED machines, and in all schools they have them, and we're trained how to use them. And I'll tell you, a couple of years back, someone had a heart attack, and people knew what to do, and they saved the person's life, a father of two, and they saved his life because there was training and there was equipment. And I think Representative Howard said earlier that everyone could have a bleeding injury. It's not just students or young people or old people with rare diseases. And so I view this on the same line as those AEDs. And people fought hard. They came to this legislature to make that a law. And so I just think it's a testament to you and your friend there to come here and advocate. And you have my support, and I wish you the best.
Thank you.
Thank you, Representative. Any other questions or comments from members of the committee? Again, thank you for your patience and your testimony today. Thank you. Next is number 27, which is Paul Pancia, I believe, online. If I pronounced that correctly.
Close enough, Panisha.
Excellent. The floor is yours, sir.
Thank you. Mr. Chairman, members of the committee, ladies and gentlemen, good afternoon. My name is Paul Panisha. I'm a state resident, town of Southington, father of two, husband, and a daily user of our illustrious Interstate 84. And I'm here today to provide testimony in favor of proposed bill 7204, specifically on safety corridors. Several months ago, I met with Representative Poulos to discuss the idea of a highway safety corridor on I-84. This was not the first time I spoke to or met with Representative Poulos, but I felt it was my duty to pitch the idea, considering the tremendous loss that we all felt when Trooper Pelletier and, of course, our DOT employee, Di Domenico, lost their lives on our interstates. Of course, there are names those are names that everyone across the state and perhaps even the region have come to know. And unfortunately, they are sadly not the only folks who have needlessly perished away on our roadways. A couple of stats: per the Connecticut DOT, calendar year 2024 alone saw 314 deaths, and as of January 19th of this year, we are at 20 deaths on our highways and interstates, which puts us on track for another 300 plus fatality year. It's also most likely that this number will increase this year, 2025, as well, as more and more of our employees are now returning to the office, since we're now in the endemic stage of the COVID crisis, meaning there's going to be even more people using our infrastructure in the state. Listen, the simple fact is this, one death is tragic, and more than one death, in my opinion, is inexcusable. While we all know that, the establishment of this safety corridor will certainly not eliminate fatalities, it will serve more to make folks aware that where you are traveling is a high accident prone area, that they need to refocus their attention to the road, their surroundings, and to be hypervigilant when traversing this particular stretch of interstate. This proposal, in my opinion, is a prime example of both the individual citizen and the state government working hand in hand. The individual contributes to success by paying attention to the signage, obeying the rules of the road, and being hypervigilant. And the government contributes to its success by obtaining funding to install safety features, reassigning assets to patrol this area, and committing to what I'm deeming a continuous improvement plan, meaning that we just don't settle for good enough. We always want to be the best that we can be. Personally, I personally know the benefits of the highway safety corridor. For 3 years, my wife and I resided in North Mississippi. I was relocated there for work. Every other month, we would make the 18-hour drive back to Connecticut. And I mean, come on, who can say no to Modern Pizza? You know, we'd have to come back for some Modern Beats. And there was a straightaway stretch of Interstate 90 in Ohio. I want to say it was Cuyahoga County. That was designated as a safety corridor. It's like a 9-mile stretch of road. And each and every time we would hit that stretch, we would see law enforcement in that stretch of interstate monitoring traffic and, yes, enforcing the law. But more noticeably, even the long haul drivers, such as commercial, drivers like truck drivers, who are following us along on our route because they were making the trek from the Midwest to Northeast. We noticed that they'd slow down to the speed limit. Maybe they were on cruise control for 75, 80, they'd go back down to 55 or 60. At least for us, maybe we would put our phones down, make sure the Bluetooth was on. And at least for my wife and I in the car, depending on whose turn it was on the radio, maybe it was her listening to Taylor Swift, maybe it was me listening to REM, we turned the volume down and just pay attention to the surroundings because we knew that, well, with the proper signage and everything else, oh, wait a minute, we should probably pay attention here because there are signs all around us telling us, wow, this is somewhere we should pay attention. Let's pay attention to the surroundings. And, if anything, the corridor kind of breaks up the monotony of a long drive, and maybe not even a long drive. I mean, maybe just
Paul, your time is up. Can you please summarize?
Sure. All I'm saying is that this is going to be the easiest yes vote you'll have. So just support House Bill 7204. That's all.
Thank you. And I know Representative Pujols has some questions. I will yield the floor.
Hi, Paul. Thanks for your testimony. I've enjoyed our past conversations and appreciate what you shared today. In particular, the data that shows and demonstrates the severity of safety situations on our highways. I got a couple questions for you just to follow up. In one of these corridors, what impact do you think a clearly marked traffic sign announcing the corridor would have in terms of providing awareness with compliance of traffic laws?
So in my experience, when people see the signage, lights have come up a bunch in this committee meeting today. Even state trooper vehicles or, law enforcement vehicles, instinctively, they slow down, especially if they are made aware that potentially there is fines that have increased because you're going into this area. We see it, at least I see it in construction zones. I've seen it construction zones in Connecticut. I've seen it in traffic safety corridors. Like I said, like when I lived out of state and we were driving through that stretch of I-90 in Ohio. But I just think that, again, it just makes people aware. It breaks up that monotony of, oh, I was just sitting in mixed master traffic on 84 for 45 minutes to go a mile. And now I just want to speed home. But actually, I really can't because I see these signs and I see the cops and I'm like, oh, boy, like I don't want to, it re-level sets the driver. And not even just the driver, but the inhabitants of the vehicle, because they could tap on the shoulder and say, hey, Dad, hey, Mom, look at the cops. And we're like, whoa, wait, the what? And then all of a sudden we become refocused again. Not saying that we shouldn't be focused, but you get what I'm saying. So I think that's just it. It reinvigorates the driver to level set and, okay, yes, here I am. Yes, it's a dangerous area. Let me make sure I'm at 55. The lights are on, the radio's turned down, blah, blah, blah,
Thanks, Paul.
Sure.
So how do we ensure that people don't get used to these corridors and then maybe they get a comfort level, they're used to going through them, and then maybe they start to ignore or try to bypass, kind of defeating the purpose of them? Like, how do we keep them relevant?
Yeah, that's a great point. So I see it in two different ways. The first is, we ask our state police to monitor accident data in targeted areas that, we might have established as a safety corridor. And if we're starting to realize that the accidents are going down in the established corridor, but all of a sudden they're starting to go up somewhere else, we have the agility and the flexibility to move those corridors as appropriate. And, maybe we do have to move them periodically. And this should be, different from a from like a seatbelt check or like a, the day before Memorial Day or Memorial Day weekend where, they're checking, they have these checkpoints at the entrances to the interstates, and I think those are very effective, at least for me. But by having the corridors on the highway, you're really paying attention to facts. We're seeing an increase of accidents between mile marker here to here, and not so much in these mile markers. So now we have to move this corridor effectively and get some data behind it. The other thing too, I believe University of Connecticut has forgive me, I don't know what the exact terminology is, but I think they actually have like a crash data warehouse or anything that focuses on highway safety or road safety. And, we could give that task to them. They analyze the reports that come in, they enter in the data. Perhaps we look at our affiliates with AAA or any of the insurance companies and we just populate that data and make it, a decision based on it. It certainly doesn't have to solely be on the state police to do so, but I think collectively there's enough folks that we can look at this data and make the best recommendations if we need to.
Thanks. I got one last question. In addition to the additional enforcement corridors, do you see a role for public awareness or advertising with the corridor concept?
Oh, definitely. A statewide like public awareness campaign should certainly accompany the implementation of safety corridors. It's a proactive measure to ensure safety. And we also have to consider the adverse effect of, people might say, oh, well, this is another way that you're going to try and get a ticket. You're trying to ticket me to collect money for ticketing. That's we want to be upfront about it. We want to make sure that these folks are realizing, no, like we're giving you as much time as you need to know that these are where the corridors are going to be. This is really just here to make sure that you can get from point A to point B in one piece. Because unfortunately, we see what happens when we don't have that. We have folks that sadly die on the highway, and it just shouldn't happen. It just should not happen.
Well, Paul, I appreciate you spending the day listening to this hearing and taking the time to share your experience and knowledge with us. Thanks a lot.
Of course, my pleasure. Any other questions?
Thank you, Representative. Any other questions from members of the committee? Hearing none, thank you for your testimony.
Thank you. Cheers.
Next is Patrick Roy, First Selectman of Roxbury. Let's see if he's online. I do not see him online. We'll go to now Christina Chapton.
Hi, it's Christina Capitan. Thank you very much.
Welcome.
Welcome. Thank you. Thank you. Good afternoon, chair members of the Public Safety and Security Committee. My name is Christina Capitan. I'm a resident of Broadbrook, Connecticut, and I'm the co-founder of CT Can Warriors, a grassroots advocacy cannabis organization here in Connecticut. I'm providing my testimony today in strong opposition to Section 7 of HB 7204. Which I believe seeks to repeal critical legal protections by allowing law enforcement to use the mere odor of cannabis as probable cause for stops and searches. This proposed change recriminalizes smelling like cannabis and puts countless Connecticut residents at risk, including medical patients, employees of licensed cannabis businesses, home growers, dispensary staff. The original cannabis legislation language that was deliberately crafted carefully by members of this very legislature to prevent the undue intrusion by law enforcement based solely on the odor of cannabis. The removal of these protections opened the door for widespread discrimination, harassment, and unconstitutional searches. The policy could have severe consequences. I'd like to put faith in law enforcement that they will not unduly search and harass people who are consuming not people who are consuming cannabis while driving, because we don't believe that is very smart at all. And I believe that Section C, which is in that, which is in Section 53, I'm sorry, let me go back and look at it, which is in that section of the Connecticut General Statutes, actually does allow a police officer for reasonable suspicion to pull a motor vehicle over. So reasonable suspicion being that somebody is openly very in plain sight using cannabis while driving. And I'd like to believe that our police officers will not just pull somebody over because they have dreadlocks or because they have tattoos with cannabis plants on them, or because the person is known activist that fights for cannabis. But unfortunately, the concern still lies that, in my opinion, law enforcement hasn't been duly positively trained on cannabis consumers and being sensitive to the needs of Connecticut patients. You know, and the interpretation can still be left up to maybe somebody who isn't well versed in actual cannabis consumers and patients. So that's concerning. Home growers that are following the state law will be placed at risk. Furthermore, the change will disproportionately impact Black and Brown communities, as data has consistently shown that cannabis-related stops and searches have been used as a pretext for racial profiling, and unfortunately, that is still very real in our state. Undoing these protections will deepen racial disparities in policing, contradicting the very principles of the equity that guided cannabis legalization in our state. And shout out to Robin Porter and Gary Winfield for standing up for that. Section 7 may also conflict with federal anti-discrimination laws, which is concerning. And people who work in that industry are protected by those ADA and other workplace laws. So it could get Connecticut in trouble, and we don't want to see that either. So in short, I want to just encourage you to strike Section 7 of HB 7204. I think it's a dangerous step backwards. It contradicts the intent of cannabis legalization. It invites an abuse of power. It undermines the rights of thousands of Connecticut residents. And I urge you to reject this harmful provision. I'm definitely open to questions. I do have concerns that was stated that this is actually looking to make it so that police can pull people over who are actively consuming cannabis while driving. I'm not seeing that language. So unless I'm misunderstanding, I don't believe that striking this entire section of the statute is necessary. Thank you. Sorry.
That's all right. And I know some other members of your organization testified earlier. Just to be clear, are we in agreement that if you are consuming cannabis while driving, that is that should be against the law? Are we in agreement on that part? If you're
I do agree.
while
I
driving,
absolutely do agree. Anybody consuming any product while driving, whether it's cannabis or alcohol, that is a probable cause to stop somebody and say, hey, are you okay to drive? That's reasonable.
so if the officers randomly to my left and right, you can guess which one's left and right. You give it
Yeah.
hard to tell. See somebody driving down the road and they are actively consuming, that should be grounds for a traffic stop.
So while I believe, yes, if they can determine from whatever they are, which is potentially unlikely, that that's not a cigarette or a cigar that's being consumed by somebody, then yes, right? If there's a billowing smoke and they, smell the burnt odor of cannabis, absolutely, they should check into that. I think that is a public safety issue, but I think striking all of this complete section that was put there very intentionally by the people who crafted this legislation to protect patients, consumers, people who work at facilities is absolutely inappropriate.
Okay, thank you for your testimony.
Thank you.
Representative Howard.
Thank you, ma'am. So following up on your conversation with Representative Boyd, so you think it should be illegal to smoke marijuana while driving, and provided the police officer can articulate that he knew that the individual was doing that, he should be able to pull that person over. We're in agreement about that.
Absolutely.
Okay, I would refer you to Public Act 21-1, Section 112, subsection C. That was the bill that legalized marijuana, and it says specifically, so in Section A, it says that it's illegal to smoke marijuana while driving. Subsection C says no peace officer shall stop a motor vehicle for a violation of this section if such violation is the sole reason for such stop. That means that if a police officer sees somebody smoking marijuana, wearing a sign that says this is marijuana, and they can smell it, and they can see smoke bellowing out, and that's the only reason for the stop is illegal. That's what the current law is. Striking this language seeks to remedy that. But as I understand you disagree. Is that true? You disagree with Section 7?
So I disagree with striking the entire section just to address a subsection.
When LCO, when the legislature passed this is where it got put in. Would you agree with me that searching a vehicle on the odor of cannabis, no evidence that the driver would be unreasonable since marijuana is not illegal.
Yes, I think it's unreasonable to search a motor vehicle just solely based upon the incidence of the smell or odor of cannabis. Absolutely.
Right. So I don't know that we need language in statute saying that it's prohibiting police officers from using the smell of marijuana as probable cause for a stop, because marijuana is not illegal. So probable cause means facts and circumstances that lead a reasonable person to believe there's contraband in the vehicle, but marijuana is not contraband, right?
Well, eliminating this entire section looks like it opens up that interpretation to law enforcement and doesn't create, codify it to give them direct action, which I think is a big part of why we are where we are now. Not, no directives, no direct directives. So if there was something stating, strike that particular subsection, I would be open to supporting that.
There's a document in Washington, D.C., and there's amendments to it. And the fourth one says that you're protected from unreasonable searches and seizures. The court ruled in numerous cases, beginning with Carroll v. U.S., that police officers can search vehicles when there's probable cause of a crime. If marijuana is not illegal, then the smell of it does not probable cause for a crime under our Constitution. Wouldn't you agree?
I would agree that, but I do believe that patients, up until legalization, patients were protected by those very same constitutional laws, and they were absolutely getting pulled out of the car. They were getting their cannabis dumped out, and they would call me crying. So, respectfully, I do understand that we have those constitutional rights, but in reality, in real life, without proper, positive education for law enforcement and the judicial branch and all of these other agencies, the interpretation being left up to them is just not a good look. There's still very much bias against cannabis and cannabis consumers as a whole. If they can utilize that, that as reasonable suspicion, which they've done in the past, just to condemnify or hurt Black and brown individuals or people they suspected of crimes, I don't think that that's going to change. It's currently illegal to smoke cannabis while driving. Nobody is, against telling people they should not be doing that. But I do have a problem with removing protections for everyone. I think it's smart of Connecticut to put those in there in the first place, and I'm sad to see them go.
Okay.
So I hope
Your testimony has been very clear, which is helpful. So thank you very much.
Thank you. I appreciate you.
Yeah. Any other questions from members of the committee? All right. Hearing none, again, thank you for your time and your patience.
Thank you. You too.
Next is Olivia Wrinkles. Olivia online, I believe. Welcome back to the committee.
Thank you, and good afternoon, and thank you to the Public Safety and Security Committee for the opportunity to testify. My name is Olivia Rinkus. I'm from the town of North Stonington, Connecticut, and also an undergraduate at the University of Connecticut studying political and cognitive sciences. I'm testifying today as a taxpayer and advocate for the complete decriminalization and destigmatization of cannabis in opposition to several portions of HB 7204, to begin with the changes made in Section 7. Connecticut has only recently legalized cannabis in an effort to undo the harms of the drug war. We still have a lot of work to do in regards to ensuring that access to safe, quality, and affordable products are available to recreational and medical consumers, and that home growers and caregivers are fully protected by the law and not criminalized to prioritize corporate profit, and also to reverse the criminal convictions and incarcerations of individuals convicted for cannabis. We need to ensure that the sense of smell, which can be very subjective and cannot be effectively measured in any way, is not used as a reasoning for a traffic stop and/or search, and that any legislative changes do not open the door to this. This is essentially recriminalizing cannabis for users. This also does not take into account the many reasons that this practice was stopped, which includes the higher rates of stops for Black and brown drivers. It is also fully legal for an officer to pull someone over who is exhibiting signs of impaired driving and driving unsafely. Therefore, utilizing the odor of cannabis or the presence of large amounts of cash in the proximity of cannabis as pretext for a search should not be warranted. In addition to the criminalization of cannabis, I am also opposed to other portions of this bill, including Section 2, which increases the penalty for tinted windows to potential incarceration. There's absolutely no need to increase the rates of incarceration, which is a cost to taxpayers, and can create trauma and increase barriers to quality of life for individuals who experience incarceration. I'm also opposed to Section 11 and the use of GPS tracking deployment devices by law enforcement vehicles. The use of tracking devices at the discretion of law enforcement officers, and without a warrant is unlawful and a violation of the Fourth Amendment right against illegal searches. Finally, I would like to testify as a mental health advocate in opposition to HB 7202, an act concerning law enforcement training, in particular Section 4, which requires training for law enforcement officers when interacting with individuals with mental health and physical needs. While it is important for officers to recognize mental health needs to be able to forward an interaction to the appropriate professional resource, no amount of training is sufficient to replace adequate mental health resources. I am also opposed to combination of mental health resources and social services with law enforcement, which can result in increased stigmatization and coercive and punitive treatments. I urge legislators to vote no on these bills and to instead prioritize directing resources towards accessible and affordable mental health professionals and care. Thank you again for the opportunity to testify.
Thank you. Any questions, comments from members of the committee? All righty, seeing none, thank you so much for your testimony today. Evelise Correa Brown from BLM 860 and Connecticut Kenna Warriors. Welcome.
Hello, I have a question before I begin my testimony. So when I read through the bill, this is for those blinking lights. This isn't for the Christmas lights people have been putting on their cars, right?
It is not addressing the Christmas light issue. It's
Okay.
dealing with fire apparatus and tow trucks.
All right. Okay then. I'd like to thank the committee for allowing me to speak today. I'd like to begin with my request that Section 7 of this bill be eliminated. My car will always smell like cannabis, and I should not lose my Fourth Amendment rights because I enjoy hotboxing my vehicle in my driveway before going to bed. Also, 5 ounces is about 3 weeks of personal use for me. I suffer from medication-induced acid reflux and chronic ankle joint pain after bone fractures and multiple surgeries. Massachusetts, our neighbor to the north, allows 10 ounces for personal possession. Yet here we are focusing on the wrong things during an opiate crisis. I don't support driving high, but please focus on drunk drivers, the actual danger on our roads. Driving under the influence of cannabis is already illegal. The state of Connecticut spent thousands in taxpayer funds for billboards that said drive high equals DUI. If someone is swerving, driving erratically, speeding, or other driving habits, that should be a better indicator of someone driving under the influence than someone possibly smoking a Newport 100 being mistaken as a joint. Police don't need to smell liquor to see someone swerving or speeding. If someone is driving under the speed limit, obeying the law, then what's the issue? Why is unsafe driving already not probable cause? While I am not a cigarette smoker, I quit smoking about 7 years ago, I can still see this being an issue for tobacco users. I was hit by a drunk driver. It changed my life. My friend also killed my cousin in a wrong way accident, and she was impaired. I don't drive impaired. But police shouldn't have the ability to draw blood at these sites either. I'm afraid of needles, and if asked for my arm, I'd rather drive under suspension than let a cop stick a needle in my arm on the side of the highway. The wording is too broad. Protections for both genetic identity nor my medical history is addressed under this law, and police are already expected to be police, social workers, and a million other things. Let's not add nurse aid to the plate. Thank you very much for the committee. Thank you very much to the committee for allowing me to speak today, and I'm happy to answer any questions, especially about Section 7 of this bill.
Thank you, Representative DGO Von Carlo.
Help me out with a hot box. You just go in your car and you smoke and then you go back in the house.
Yeah, that's it. So a hot box, I close all of my windows in the car. It gets you a little higher. So me and my husband over here before bed, we roll up the windows, kids can't smell anything, and we smoke.
Early morning, late at night, or?
Late at night,
Okay.
sometimes early morning.
Morning,
If
you don't
I'm not
drive?
going to be driving for the next 2 hours, sometimes the Capitol Garage.
I was going to ask you, after hot box, you're not going to, of course, you're not going to drive for a while, right? Because you just
No.
hot box, then you're probably impaired. Okay.
Yeah, so
I was just,
while a high lasts me about 45 minutes usually, I like to play it safe, and same thing with, like, if I have a beer on a full stomach, I'm still probably not going to drive because I'm scared. It's a really big responsibility.
Okay, thank you.
Thank you. I just wanted to ask a couple of questions for you, if I might. Do you believe that marijuana impairs one's judgment?
I do believe that it can be a factor in someone's judgment when, or in the impairment of someone's judgment, yes.
Okay. Would you also believe that marijuana may slow down one's reaction time in terms of how they might respond to a situation that might be dire?
Yes. I do believe that. I mean, if you're taking a test in school and you're high, if you're driving while high and somebody darts, like you're expecting the stop sign because you know the street. You're not expecting a kid to come chasing the ball. So
You do believe, though, however, that individuals should not be behind the wheel of a vehicle driving
with
impaired,
any
whether
type
that
of
is
impairment.
alcohol or whether or not that's with marijuana. You agree to that?
I agree to that. I mean, I'm not even a fan of, people driving sleepy, but we can't legislate that out of existence. My life was changed by a drunk driver. I wasn't able, my son's 13 now. He was a month old when a drunk driver slammed into me in Manchester. She was going about 70 miles an hour on a residential road. Her car flipped over, slammed into a telephone pole, and took out the lights and cable to everyone on that block. She lost, all I had were physical injuries, so I was able to deal with the muscle issues. She lost all her front teeth and she was uninsured. I felt so bad for her, but she didn't have full coverage anyway. She only had liability. So my injuries and my new vehicle were covered. But that I don't ever want to relive that night, and I don't want to cause that night for anyone else. And I do support legislation to reduce incidents of driving under the influence, whether it be under cannabis. I don't want people smoking crack while driving. I mean, I'm against allergy medicine depending on how it affects you. So if you don't know how certain medications are going to affect you, then stay home. We do need better paid leave laws, but until then, no, I don't think people should drive under the influence. I think you can kill someone. That's how I've lost people.
Thank you. I really appreciate that. Just yesterday, I was having a conversation with my students. I'm a professor at a university here in Connecticut, and I did a poll of 47 students in my class, and I asked them how many of them use marijuana, and nearly 78% of my class said they use marijuana. Then I said, well, how many of you drove to campus today? And about half of the class raised their hand. And I said, well, how much did you have? And they said over an eighth. And I can tell you that, likely they are impaired and they're probably over the 0.8 limit that would be commensurate to what a person that may be consuming alcohol. And I really do care about the safety and well-being, not just of my students, but also, folks that's driving on our roads. We have a lot of accidents happening here in the state of Connecticut, and many of it is attributable to people that are impaired. And so we do have a responsibility to make sure that folks who are driving on our roadways are safe. And I appreciate the fact that you do agree that individuals should not be driving while they are impaired, whether or not they are on high doses of medication coming from the doctor, dealing with acid reflux or what have you, what you just mentioned, or if they are, consuming alcohol coming from a bar, et cetera. So I appreciate your testimony today. Any further comments, questions from members of this committee? Representative Howard.
Thank you. Elise, so follow up. So you said that people should not be able to smoke marijuana while driving, but you don't think the police should be able to pull people over for that.
How do you know it's weed?
Well, I think I've been a police officer for a long time. And I asked this question when we legalized marijuana. How many people are being pulled over and the police officer says, oh, I thought that was weed, but it was actually a cigarette. And the answer I got from many advocates was none that they know of. I mean, how do you know that somebody is drinking a Coors Light and not an Arnold Palmer? How do you know that somebody isn't wearing their seatbelt because it's under their arm and not over their shoulder so you couldn't see it? There's a multitude of of things, but police officers under the law have to articulate their reasonable suspicion. So if you have a police officer in the state that is pulling over, you know, a bunch of cars and none of them, because he claims that he thought that he saw weed, but they're all cigarettes, we deal with that officer. The law prohibits any police officer, even if they see it, if they're wearing a sign that says this is marijuana, hey, I have weed, it smells like weed, it's bellowing out of the car, they can't pull the people over. Do you agree with that or not?
I mean, if you want me to be honest with you, police officers are pretty good at finding a reason. So if the person who has smoke billowing out of their car has an air freshener hanging on the back of their window, that's probable cause right there. Or not back of the window, back of their rearview mirror. I'm sorry.
So you think that the legal standard for a traffic stop is probable cause?
I think that the legal standard when it comes to this type of situation should be visible impaired driving, because I know as a former cigarette smoker, if you pulled me over after a long day of work and I'm sucking down my Newport 100 and I get pulled over, I'm not going to be happy.
Well, I don't think anybody's happy when they get pulled over, but you've yet to answer my question. Do you think police officers should be able to stop people that they knowingly see smoking marijuana? Yes or no?
I think that it would be a high ask. So
Should the law prohibit it? Should the law prohibit a police officer from
I
stopping
don't,
somebody?
I think the law as is should be enforced rather than amended.
So the law as is that a police officer cannot pull somebody over that they see actively driving and smoking marijuana. You don't think that should be changed?
I think that that could also be a cigarette or a cigar, and that's when it starts getting a little sketchy with the Fourth Amendment. So this isn't the equivalent of watching someone shoot up or watching someone hit a glass pipe. So I mean, if you see them smoking a bong in their front in their, you know, front seat as they're driving, that you know, you can sit there and say maybe they're swerving because you can't hit a bong without swerving.
Well, I think
But
you probably
to
could.
risk pulling people over, especially when the most populated and dense areas are going to be Black and brown areas, we're looking at increasing traffic stops and violating civil rights, especially for smokers. So unfortunately, the inner city was targeted by Newport and other companies. So we're looking at, you know, a possible stop and negative police interaction for a cigarette or a cigar. We can't ever be 100% certain unless you're watching the person hit a bong, hit a crack pipe,
So,
inject right in the front seat. So if we're not seeing that and they're not driving erratically, there's missing children to save.
So you're here on behalf of Black Lives Matter 860, right?
Yes.
So I'm asking you, as a representative of that organization,
Yes.
does your organization support a prohibition against police officers stopping people who they see smoking marijuana? I'm just looking for a yes or no. What is the BLM 860's position?
Now, just to be clear, BLM 860, as well as all other chapters, are not affiliated with the national organization, with the exception of 16 nationwide. So BLM 860, as vice president of the Hartford chapter, and becoming part of the larger grassroots coalition later in the year, the national grassroots coalition, as it stands now, we are against the traffic stop unless there's other probable cause. So if there's not erratic driving, speeding, or a secondary infraction, we would be opposed.
Okay.
But the unsafe driving, children in the car I mean,
Well, there's a lot of
did
other.
we ever pass that law anyways with no smoking in the car when there's
that's
kids?
not
Because I mean,
enforced
that's an easy way around this. If there's kids in the back seat and you're smoking, then at that point,
No, we haven't.
maybe we should do that instead.
Well, we tried, but several people voted against it, unfortunately.
Oh.
So Black Lives Matter 860's position is that police officers should not be able to pull people over solely for smoking marijuana while driving. Thank you for clearing that up.
Yes.
You talked about phlebotomy, and you said that the police officers would be sticking their needles in people's arm on the side of the road. Is that your understanding of how that operates?
Well, I guess now there's a little bit of clarification that it would still be conducted in a medical facility, but why are we pulling cops away from their actual job to do the job of a nurse?
So you don't
Or a
think it's
paramedic?
you don't think it's a job of a police officer to enforce DWI laws in our state?
Do you guys don't have the breathalyzer machine?
Sometimes blood is a better option. And even under current law, when people have to get a blood test, this notion that is absolutely false, that's being pushed, that police officers can go back to work to do their jobs and not do the job of nurses, is factually untrue. In order for a blood test to be done now, the police officer who has that person in custody has to drive them to the hospital and wait with them. You understand that?
Okay.
My other question is,
Do they get paid overtime if they go over their shift?
of course,
Okay.
which it brings me to the point that it takes much longer to go to hospital than just do it in the booking room. The other question is,
I'll be honest with you. If I'm not gonna let a cop draw my blood, I'd rather get my license suspended. And even if I haven't drank, I'm
Well,
terrified of needles.
you
I
have
can
a
barely
right
get
to
a nurse to do it.
you have a right to refuse the blood test, don't you?
Yeah, I can't. Is there an alternative method built into this law? Because I didn't see it. Like, I would rather just blow into that little straw thing.
Well,
Because
there's
I've
not-
never
there's-
driven under the influence.
There's not an alternative method into this law, but under 14227B subsection 2, which this law doesn't change, you have a right to refuse a blood test, don't you?
Yeah, and I mean, how are you going to deal with the religious exemptions anyways? I mean, you get a Jehovah's Witness, and right there, that's a civil rights violation
How is it a civil rights violation?
because they're supposed to protect their blood and DNA. So same
Again-
reason they can't accept a transfusion.
Again, 14227B subsection 2 affords every single person in the state of Connecticut arrested for DWI the right to refuse a blood test, in which case the police has to choose another test. You agree with that exists, right? I mean,
Okay.
you work in policy, don't you?
A little bit, yeah.
Okay, so
And I worked over at the community court for a while, so
right, so you agree that that's the law.
I guess I don't think it should be a pilot that's expanded. There's other non-invasive routes to go. You don't need to stick a needle in my arm.
So you think we should do away with blood tests altogether?
Unless it's done in a controlled lab.
Labs. Okay, thank you, Mr.
So I don't think that police should become phlebotomists. I don't think that police should come anywhere near me or regular citizens with a needle, especially when there's nothing written in law to protect me under HIPAA. You guys aren't nurses, you guys are police. And what's to stop police afterwards from running my DNA against a database?
Well, what's to stop it now? If a police officer arrests you for DWI and drives you to the hospital and the nurse draws the blood, they give the blood to the police officer. So what stops it now?
I wouldn't consent. I'd tell them, give me a breathalyzer. And I mean, I smoked cannabis sometime this morning, right? If
Did you
I
drive here?
Huh?
Did you drive here?
I smoked in the thing in the garage this morning. So
In
I'm
Uber.
sober now.
Okay.
It, it helps kill the time between testimony because I'm in 2 rooms today. But I mean, if you draw my blood next week, I'm going to come up positive for cannabis, even if I don't consume between now and next week. What's to stop police from giving me a DUI then?
Well, again, they wouldn't have your blood until you're already arrested when you failed the test. I think we're convoluting the process, but I thank you for your answers. Thank you for being here. Thank you, Mr. Chairman.
Thank you so much. I don't want to go down a continuous rabbit hole here. So if we have any questions, please make it germane to the issue at hand. So any additional questions from members of the committee?
I'm happy to answer them.
All righty. Yep. Representative DG Von Carlo.
And I'm sorry, I just, you commented you'd rather have us move in violation, some kind of infraction, some kind of violation, and pull you over for that reason. So,
I
right.
thought if I refused, you guys suspend my license for 6
no.
months and then I got to get a work-only license.
Totally different subject here. I'm saying to stop you, you commented that you think it should be a violation or a violation, we have a lot of ways of stopping you, right?
It should be coupled with violation. I should have to run a stop sign, speed, swerve, something.
Correct.
Because then afterwards, maybe I'm not smoking a Newport.
Right.
Maybe then I am under the influence, and that at that point should be probable cause.
So to your point, isn't that a little bit of a pile-on effect, right? You want me to make sure I pull you over for something instead of maybe pulling you over and say, hey, listen, I see you smoking, knock it off, and maybe you're on your way because you're not impaired. If you're talking to me like you are right now, maybe I do let you go, right? Because you're talking fine, you don't seem impaired, but maybe I just want to stop you and say, not too smart. You know what you're doing. You now know it's against the law, but you'd rather have me pull you over, probably give you a violation now because I pulled you over rather than just that's what I don't understand about that argument is, and it's the same thing with drinking, right? I got to see a moving violation or another kind of offense, right, to pull you over to start my investigation there. But to me, if I'm going to get pulled over, especially inner cities, 90% of the time we're going to probably say, hey, knock it off and be on your way. I think that you guys you have a different opinion of policing than I do, so we'll agree to disagree. But the fact that you want me to almost make up a traffic stop to pull you over that's been the argument I hear a lot, and it's confusing to me. I'd rather just pull you over and say, hey, knock it off. I'm right behind you. I can smell it. At least have enough common courtesy to not smoke when you're right in front of a cop. That's all. I mean, I can gladly pull you over for 2 or 3 things, give you that nice ticket, and then maybe still have that discussion. So in my book, I would say that just, maybe the guy with the beer, right? Hey, knock it off. Pour that beer out, get out of here. You don't seem impaired, right? I mean, it would fall into the same, right?
I gotta disagree with you there.
Oh, so the guy that has the beer.
The guy that drinks a beer, he'd better leave his keys where he is and call the lift in front of the
Why is
cop.
that? He's not impaired.
Oh,
He has a beer. He took 1 sip out of his first beer. I'm talking to him. He's fine. He seems great. Nothing shows that he's any signs of indication that he's intoxicated. So why can't I do that? I don't have discretion.
Did you test to make sure it's just 1 sip? Maybe this is his first sip out his second beer.
Just the same way I would pull you over and talk to you when you smoking and I see you smoking. You seem okay to me. You seem normal. What am I going to test? Also, I'm not a drug officer, so I can't do that 13 thing test on you that we have in place for someone smoking marijuana, right? So I don't have that
You should
ability.
just be able to look in their eyes, the
Well,
pupils.
it's not that easy. So, but my point to you is, so you support us pulling you over for more reasons than we really should be. That's what you're basically saying, right? So just pull me over for anything, officer, because I want you to check if I'm smoking. I want you to pull me over and continue increasing traffic stops, right? And violations.
I don't think that would increase traffic stops. I mean, this is just me being honest here. If you need actual reasons to conduct the traffic stop, there's going to be some sort of surveillance. There's going to be some sort of something, red light camera, whatever it is, that's going to justify the stop.
Yeah, no surveillance. We don't survey. We're just.
Because I mean, in Hartford, there's like a camera on every street.
Yeah. Okay. Well, we're gonna end this because I'm just saying it's kind of counterproductive, I think, when you say, hey, pull me over for these 3 reasons in order to check for that I have the fact that I might be smoking marijuana when I could maybe just pull up to you, check you out and say, oh, I'm sorry. Well, I thought you were smoking marijuana, be on your way. But
Because
Thank you, good
we
representative.
don't want to stack like things that didn't happen on a traffic ticket either. So we got to keep that in mind that, maybe it's a Newport and I ran a stop sign. So now you justifiably stop me. You give me a warning. And then afterwards, I'm like, I think I'll just smoke when I get home.
Thank you so much for your testimony today. Just one follow-up?
Let me just say one more
Sure.
thing. And to my point, that's exactly what happened. If I stop you and maybe you have that little bit and I say, hey, why don't you do that at home and be on your way instead of saying about the stops. That's my point, exactly what you just said. So, okay? You understand what I'm saying?
Okay.
All right. Thank you.
Thank you so very much. I appreciate it. No further comments from members of the committee? Seeing none, we appreciate your time today. Thanks for coming.
And thank you for all you guys do, because you guys are, I don't know how you guys get through these 6 months.
Thank you so much for the compliment. We appreciate it. Matthew Solek from Willimantic Police Department, Administrative Division, Lieutenant. Lieutenant, thanks for joining us on today.
Good afternoon. Thank you. Honorable chairs and co-chairs of this committee, I'm honored to be here and I appreciate your time. I'm going to keep my comments very brief this afternoon. Since my partner at the SWLE project, Dr. Isabel Logan, did such a fantastic job earlier today unpacking the important work we're doing at the intersection of police and social work. I've been a police officer in Willimantic for the last 20 years. And since 2020, I've been working with Dr. Logan closely at the intersection of police social work, which is an emergent field here in Connecticut. Subsequent to the passage of an act concerning police accountability in the summer session of 2020, Section 18 stipulated that police departments shall begin working with social workers and mental health professionals to increase the efficacy of community outcomes. And that's how Isabel and I first met. It has been a great opportunity working with her for the last 4.5 years. And I firmly, professionally, as well as personally believe that police social work is here to stay in Connecticut. For the first 12 or 18 months of our collaboration, Dr. Logan and I spent time working to see if this was going to be a sustainable model of collaboration across these important sectors, or whether it was just going to be a one-off or a temporary fix or a trend. Police social work is here to stay, and it makes a lot of sense because when I can introduce a well-trained, well-recruited, well-vetted, and well-sourced social worker or mental health professional into a police call for service involving a person in mental health crisis, substance use overdose, unhoused, any number of conditions that we're all familiar with, I immediately reduce the risk of arrest and the risk of use of force because the social worker cannot arrest anyone and the social worker won't use force. So these partnerships make a lot of sense. And Section 2 of Ray's House Bill 7202 formalizes and sustains this practice in Connecticut. And I firmly believe that Connecticut is well positioned to be a leader in this field in 2025. Thank you all for your time, and I'd be happy to take any questions.
Representative Howard.
Thank you, Mr. Chairman. Lieutenant Solek, thank you for being here. Thanks for waiting, and thanks for your work on this. I just wanted to ask you, just to clarify perhaps some confusion that my colleagues may have. In your model, you don't send social workers out to people in crisis, actively in crisis, putting them at risk, correct?
No, sir.
And what you do in this model is the social workers either accompany a police officer to a call or follow up when the person's not in crisis on an ongoing basis. Is that right?
Yes, sir.
Okay. And so so what we're trying to do is incorporate social workers in a safe manner, controlled manner, but also educate and train our police officers so when they have to go in because it's not safe for social workers, they're better equipped to deal with these folks with mental health and address those issues to get the acute problem under control so we can bring the social worker in. Is that a fair depiction?
Yes, sir, it absolutely is. And it's to amplify on that. The partnership model that Dr. Logan and I have created and worked deeply on here in the state of Connecticut draws from the best of both professions. It draws from the best practices in the social work field as well as the best practices in the law enforcement field. And when Dr. Logan and I teach and instruct and work with police officers and social workers, we constantly do it together to give full efficacy and credit to both important professions. But our number one non-negotiable is safety. And we preface every training and every piece of work that we do with safety as first.
And what you've done so far has had pretty good results in the limited work that we've done. We're trying to expand that, but it's been the results have been extremely positive. Is that right?
Yes, sir.
All right. Thank you, Lieutenant. I appreciate you being here, and I appreciate you waiting it out with us. Thanks so much.
Thank you, sir.
Thanks, Lieutenant, and thank you, Representative. Anybody else? Any additional questions, comments? Seeing none, thank you, Lieutenant, for joining us today, and we appreciate the work that you're doing.
Thank you, sir.
Have a good day. I promise you I'm going to get you out of here by 5 o'clock. We still have some more folks here on the agenda. Please don't pack up and go home yet. Avante Bonilla from Kittle Global Solutions, Director of Communications and Government Relations. Welcome.
Hello, good afternoon. Senator Gaston, Representative Howard, and members of the committee, thank you for giving me the opportunity to testify in favor of Senate 1490, an act concerning the sale of battery-powered smoke detectors in the state. So when we think of house fires, one of the issues is people don't think it's going to happen to them. Actually, according to the American Red Cross, 40% of people believe that they're more likely to win the lottery or get struck by lightning than experience a home fire. Yet the National Fire Protection Association estimates a house fire occurs every 88 seconds in the United States. Smoke alarms are essential to protect Americans in their homes. Now, with synthetic materials and open floor plans, fires are burning faster and hotter than they ever did, and gives people only 2 minutes to escape a house fire safely, making detection critical as every second counts. A working smoke alarm nearly doubles the chance of successful escape from a fire and also helps protect our firefighters. Nearly 3 out of 5 home fire deaths are in homes with no working smoke alarms. And when you look at the details of that, the number one cause of a smoke alarm failing to function is because the battery has been either disabled, removed, or otherwise tampered. Smoke alarms equipped with sealed 10-year battery prevent tampering and can save lives. These devices also eliminate the potential for human error during battery installation. By requiring the sale of smoke alarm devices that are tamper-proof and that would have to be fully replaced every 10 years, the number of people who tamper with batteries in their smoke alarm devices would decrease. The requirement would ensure that more smoke alarms in the state are operational and so reduce home fire deaths. We suggest an 18-month phase-in, which would also help with transition, as similar to other states have implemented. So thank you for your time.
Thank you. Representative DG Von Carlo.
So good afternoon. Thanks for hanging around. I do like the bill. I know in Waterbury we've had countless incidents where the tenants just steal the batteries out of the smoke detectors. You have a landlord trying to do what they're supposed to do, and the batteries are taken out of them. I also think it helps our seniors that, you know, maybe don't have that ability to change those batteries all the time. So I also like the phase in, but I do like the bill. I think it's a very you know, I think this is something that, as Wayland said, if one life, it could save one life, this would save many lives, I believe. So I definitely like the bill, and thanks for your testimony.
Thank you. Representative Howard.
Just one question. I don't know if you had stepped out when the firefighters were here, fire marshals. I get them all mixed up.
I was here.
Yeah.
I heard him.
They were asking for 2028. You think that's too long?
I think that's too long. If we look at other states, for example, Michigan, they're in the middle of this, and they implemented it 18 months once the act was.
And the language in the bill provides that at that effective date, that 2020, wherever we land on it, right now it says 2025, that any inventory there can still be sold, or any orders placed can still be sold. You okay with that?
Yeah, that's actually how it's written right now, but
right.
it's kind of too early to make all these changes. So that's why we propose a phased in.
Okay. All right. Thank you so
Yeah.
much, and thanks for
You're
being
welcome.
patient.
Thank you. Any additional questions, comments from members of the committee? All right. Seeing none, thank you so much for your testimony today and for hanging out with us. At this time, we will call on Charles Jackson. Constable Jackson, please come forward. Okay, I don't see Constable Jackson. I'm sorry, Mr. Jackson, but I am for real. We're moving on. Gregory Allard from Association of Connecticut Ambulance Providers. All right, Gregory, are you online? Madam Clerk, am I able to move on or no? Thank you. Gregory,
Yes, sir. Can you hear me?
turn your volume up just a little bit so we can hear you a little better.
All right. How about now?
It's better. Thank you.
All right. You're welcome. Good afternoon, Senator Gaston and other distinguished members of the Public Safety and Security Committee. Thank you for the opportunity to talk here today. I did submit written testimony, and I appreciate, again, the opportunity to summarize that opportunity. I'm here to testify today on House Bill 7201. The testimony I'd submit is in opposition of the proposed bill, and it's not necessarily the concept of the quicker care that I testified about today with verbal and written testimony. What I'm really trying to emphasize through our association is that there's an established process through the Department of Public Health, and we feel as though that is what should be followed by the Yukon Fire Department. I understand that they did file a written application, and that's great. I know in years past that they hadn't, and I think that that's a change, and I think that this committee should allow them to have that opportunity to go through the process. I think that if this committee acts favorably on this bill, it would be precedent setting which has a potential to really impact other organizations and municipalities, how they add or change or expand their services, their EMS services. And that could be problematic. I think DPH is where that's supposed to occur and should remain. So that's really all I have to summarize on my testimony. My testimony, again, is written and it basically reflects the same thing. So we would encourage you not to support this bill as it's written and let it go through the process that DPH has in place. And while I have a minute left, I'd like to also add that we are supportive of HB 7200 in the Stop the Bleed process. So thank you for the opportunity, and I'm happy to answer any questions you may have.
Thank you, Mr. Allard, for testifying, your patience today on a pretty long agenda. Just so we're on the same page, you're testifying on behalf of the Association of Ambulance Providers, not Hartford Healthcare, correct?
Correct.
Hartford Healthcare, to my knowledge, has not weighed in on this one this time. I don't know, do you anticipate them to?
The only thing that I'm aware of is through seeing the written testimony that was submitted by the AFT, the union that represents the Wyndham Hospital paramedics.
Yeah, I did see the local union was against it, over the parent union was not. So you probably heard some of the testimony earlier, and you and I have had this conversation kind of on the side. One of the arguments is that the system, the regulatory approval system set up by DPH, is not designed for this application. Do you know of any other supplemental ALS permits or certifications that are out there that are not for a municipality as a whole, that are for a portion of the municipality or some subset that's out there? Because I know back in the day, KB Ambulance was a supplemental for the town of Killingly, and then down the road, became a regional provider. But that was for a group in the municipality. UConn's kind of argument is that what they're asking to be hasn't been done before, so therefore it is precedent setting. You've been doing this for a long time in lots of different capacities. Can you just kind of opine upon that, if it is unique, or there's some other precedent in the state that has happened that may not be in the top of the modern mind?
Yeah, it may not be something that is in place. It might be the unique situation. It might be the first situation for DPH to handle at the ALS level. I know that they've handled it at other levels, lower levels of providers with industry. So while it might be unique in that it's an ALS provider, I don't think the process itself would be unique for them to go through. I think, they may just be looking at it a little bit differently with a little more scrutiny or whatever, because of the intricacies of the ALS care that's going to be provided.
Sure, thank you. I know when we were digging through the statutes, the statutes talk about, supplemental first responders, which is a fairly common thing out there, but the statutes themselves are fairly silent on supplemental ALS, which has really been placed into process through regulation at DPH. So it's not defined in statute as a thing. I know it's a thing because I've seen it happen before. But even regardless of how this plays out, I think we have to somehow clean the statutes up when it comes to the supplemental piece, because part of it's done through regulation in that process, and some of it is established by statute. And obviously the whole regulation process is authorized by statute. I guess long story short, it's a mess when we try to dig into it to try to figure out what is the most appropriate path. And I don't necessarily disagree with you that going the DPH process is the process. I'm just not convinced that what UConn is asking is anywhere near the norm of what anybody else has ever asked before. Therefore, does it fit cleanly in that process? And is that process set up to deny them an approval because it's just so far outside the box of what would normally come before them with a subset of a PSA or a municipality? So I don't know if you have thoughts on that.
Yeah, again, that's really, beyond my purview to say what they would decide, because it would certainly be within the responsibility of the hearing officer that would hear it within DPH and their legal team to review the application in that process. So I really, don't know whether or not, how they would decide or what the outcome would be. I would say that the system is not necessarily perfect, but it's what we have to work with at the moment. And if there's, an opportunity to improve what's written as far as regulation or statutes, that would be, an opportunity, to improve upon the system the way that it's currently written. would like to be part of that if that were an opportunity.
Yep. Thank you. And Greg, if I were to make a top 10 list of most knowledgeable people in EMS in the state, you'd certainly be on it. So I appreciate your testimony. I am slightly disappointed that DPH has not come to testify or submitted testimony. And so it's a conversation we're looking to have with them in a very short order. So I appreciate your time, Greg.
Well, thank you. Appreciate the opportunity to talk for you today. Thank you.
Any other questions from members of the committee? Representative Jenga.
Thank you, Mr. Chair. Thank you for your testimony.
You're welcome.
In your professional opinion, do you see how this could provide any improvement in patient care or rapid response time to medical emergencies?
I think with somebody being on site or right there at the facility, certainly there's an opportunity to provide, quicker patient care, and that's definitely not a bad thing.
Thank you.
You're welcome.
Thank you, Representative. Any other questions from members of the committee? Hearing none. Greg, thank you for your time. Appreciate it.
Thank you.
Next is Haley Messier, who I believe we skipped over by accident. So with deep apologies, the floor is yours.
Good
Welcome.
evening. Thank you. I've submitted written testimony, so I will be brief. My name is Haley Messier, and I'm a Master's of Social Work student at the University of Connecticut, concentrating in policy practice. And I'm here today because I strongly support House Bill 7202. As someone who's studying policy practice and social work, I see every day how crucial it is to address the complex challenges facing our communities. The Social Work and Law Enforcement, also known as SWLE project, is a meaningful and necessary initiative to bridge the gap between social work services and law enforcement. I truly believe it can make a difference. Social workers bring unique skills like empathy, cultural understanding, and a deep commitment to community engagement. I've seen firsthand how these roles can transform lives and build stronger, more resilient communities. The Willimantic Police Department was among the first to integrate social workers into its team, and they loved it so much that they hired a fire department social worker. So shout out to them. And they enhanced their community center approach. Funding the SWLE project at Southern Connecticut State University is the first step towards creating safer and stronger communities across Connecticut. With this support, we can expand social workers to more police departments and ensure that our law enforcement agencies are given the extra support that they need. I ask for your support in funding the SWLE project because this is an investment in the future of our communities. It's about creating a system that addresses the root causes of crises, offers healing solutions, and promotes the safety and well-being of every person in our state. Thank you for your time and considerations, and I'm happy to answer any questions you may have.
Thank you for your testimony. And you're at the Storrs campus?
I'm at the Hartford campus.
Hartford campus. So I can't ask you to opine if there should be paramedics in Storrs. How's your experience been?
It's been good.
Excellent, excellent. Questions from members of the committee? All right, hearing none. Thank you for your testimony. We appreciate it.
Thank you.
Next is Duncan Markovich. Duncan Markovich? Nope. Ryan Sarshuni? Ryan Sarshuni? Nope. Betsy McCumber? Nope. And Michael Femetti. If I mess that up, Michael, please correct me. He's online. Michael, I see you're online.
Good afternoon.
Oh, there you go.
I am. Can you guys hear me okay?
We can, yes. Your camera is not on, however.
Oh, how about now?
Nope, but you can testify without your camera. We'll be last one. We'll let you go.
Okay. Good afternoon, everyone. I am my apologies for jumping on. I work as a captain in the New Haven Police Department. I am recently tasked with overseeing professional standards and administration. I previously testified on a couple of other bills as a lieutenant in the New Haven Police Department. I wanted to come on today to voice my support for SB 1492. What I've seen over the last few years in the New Haven Police Department is that a lot of the things that were brought up in this bill have been instrumental or would be instrumental in helping us recruit and retain quality police officers.
Nope. You there? Oh, we lost you for a second there.
My apologies. I must have cut out where I am. Can you guys hear me okay?
All right, keep going. Oh, we can see you now too. Excellent.
Great. The items that have been added to this bill, I think, have been instrumental or will be instrumental in helping us recruit and retain quality law enforcement police officers, especially in the city of New Haven. We recently, there was some chatter. I've been in and out all day listening to different testimony, but there's been some chatter about the New Haven police contract and the impact that it's had on our ability to recruit and retain people. And I can say that the impact was almost immediate. The feeling in the department is totally different. We struggled without a contract for 2 years, and now our officers are being compensated at a competitive rate compared to other agencies in the state. That has been a huge impact on us. We've also been able to limit the amount that officers are being held over, and so the work balance here has been improved greatly as a result of a contract. I'm happy to see that there's language throughout the bill that would also encourage those similar types of things happening across the state. One section that I was that the New Haven Police Department and myself support greatly is section number 20, talking about mental health resources for police officers. In New Haven, we've taken a number of steps to help officers deal with the amount of trauma and the high volume of calls for service. The city of New Haven officers answered over 160,000 calls for service last year. If you add up all of the agencies that surround the city of New Haven and multiply it times 3, they still don't meet that same amount of calls for service. And so those officers are routinely going to shootings, stabbings. We had our first administration of Narcan, where an officer saved an individual's life a couple of days ago by using Narcan. And so we're giving the tools that officers need to be able to perform the ever-changing duties of a police officer in an urban environment. I think that when I think about some of my colleagues who served in the armed forces, one of their driving factors to joining the military on top of service was some of the benefits that they received, whether it be through education or education for their children. And so I think adding in sections of the bill that would allow that, I think this job is an amazing job. I think it's the best job.
Oh, Michael, you there? We have lost Michael. Oh, I spoke too soon. That's right.
So obviously, we have to work on safety in the city of New Haven. Can you guys still hear me or no?
Go ahead.
Yeah, so I would say that there's a number of different things that we're in this bill that I think the police department and I both support moving forward to recruit and retain quality police officers across the state.
Thank you, Representative Palillo.
Thank you, Mr. Chair. Captain, thank you for the work that you do in New Haven and throughout the state with different policy initiatives. Can you talk a little bit about some of the mental health initiatives that you've undertaken in New Haven with both the community, but also for the benefit of officers?
Thanks, Representative Palillo. Yeah, we've done, so I think in the city of New Haven, we've tried to put an emphasis on, we really recognize that there is a mental health crisis going on in our city. And so what we've done is the police department collaborates on the regular with a number of different programs for crisis response, and then maintaining that crisis response and case management with individuals and kind of watching them throughout their progression. Officers routinely, we do, I think, a very good job of training officers in interacting with people in crisis. We also do a very good job of collaborating, I believe, with nonprofit organizations, the city and state entities to try to get people the mental health services that they need. In addition to that, through those collaborations, we've developed a number of different programs to help officers deal with the traumatic things that they see and experience. And so we're working to break down stigma where that's concerned. I personally see a therapist every week. I don't think there's any shame in that. I think that we have we've created an environment where we send people to go to very difficult things, some of the worst things that human beings have to see and experience, and then we tell them, well, just bury it down and keep trucking forward, and maybe you make it 20 years and get a pension. And so I think now what we're doing is having open conversations with officers about their sleep habits, how challenging it is to navigate work-life balance and having young families and trying to make everything come together on top of serving and doing a very challenging, oftentimes thankless job. And so we've installed, we have a brand new gym that we were able to get funding for in our police department to encourage officers to maintain health and wellness where that's concerned. We have a number of different education programs. We've collaborated with city wellness specialists to come in and talk to officers about all kinds of things related to health and wellness. We actually it sounds silly, but we put a refrigerator in the police department that's a vending machine that allows officers to have healthy food options to them throughout the day. We also were able to get a federal grant to have a mental health police psychologist just for the police department. We will be launching an RFP for that in the coming weeks, and then we'll hopefully have the first full-time mental health professional assigned to a police department just for police officers. We've had officers that struggle with substance use and mental health issues for a very long time, and I think rather than burying our head in the sand and saying, well, it's not something that happens here, the people that had it happen to them were just outliers. I think addressing mental health in law enforcement is one of the challenges, I think, of this generation's law enforcement. And I think in New Haven, we're taking it head on. And I think that Section 20 helps us do that.
Thank you, Captain. Thank you for your leadership there. And just one follow-up question. It's been talked about today. Around your new contract, we've talked about compensation and pension and health benefits. Can you just give, just in the last several months since that contract has been signed, can you talk about attrition and interest in laterals coming to the New Haven department, considering the new contract and the benefits that you now have? So can you talk about the impact on both retention and folks being interested in the New Haven Police Department, where maybe over the last several years they may not have been interested in coming to New Haven?
Yes, sir. Thank you for that question. So we routinely have had, the last couple of years, we have 20 people sign up to take a test to become police officers. When I signed up to take the test in New Haven, there were thousands of people that took that same test. Now, as a result of it, we haven't done any formal media campaigns or anything to get this information out there, and we've doubled the amount of applicants that are coming into the police department. We also have seen, we don't generally have lateral transfers come into New Haven. Very rarely does that happen in the last few years. And just recently, we have at least 4 or 5 people that are younger officers in other departments that will always say, hey, I would love to work in New Haven, but I'm not going to make $30,000 less than the recruit next to me in the academy. And so that is now that we are competitive in that, individuals are saying, well, I don't mind the work in New Haven. I want to be on a walking beat. I want to do urban style policing. I want to work with PAL and be a member of the community. And so now officers who couldn't take that pay cut to come over are saying, hey, I want to do that work, and you guys pay a little bit less than my department. No problem. I'll do that work. I'll come over and work with you all. And so I think that what we've seen and what I've seen now being in charge of recruitment and backgrounds is that people, there was a representative earlier that talked about people wanting to do police work as a second career, or like as they're leaving another profession, they're in their 30s, and I've seen a lot of that. And I think what's really interesting about it is a lot of people, from what I've seen that apply, are individuals who say, I always wanted to be a police officer. And I think fulfilling that dream for people is something that we can do. I think we lose sight of that this job, people dream of being a police officer from a young age. And I think having a contract sounds silly compared to that. But I think when you can be competitive with a neighboring jurisdiction that makes $30,000 or $40,000 more than you. I mean, at the last time I testified, a police officer in a neighboring jurisdiction, most of the neighboring jurisdictions, I was a lieutenant at the time, a random police officer in a neighboring jurisdiction would make more base salary than I was making as a lieutenant testifying before you all. And so the fact that that playing field is even now has been huge. As far as retention is concerned, we usually have anywhere from 15 to 20 people leave every single year the department. That means generally retire. I think we have maybe, I know it's less than 5. I want to say it's 2 or 3 that are going to leave this year. And so that contract really, really had an impact in helping us retain people. And it sounds silly, but even for 6 months or a year, if we can hold people for that long, that allows us enough time to get new recruits into the academy, to get fresh officers onto the street. And so I think that is that's been instrumental in allowing us to do that. I think on a statewide level, especially for the urban police departments, it could be very, very helpful to help us stay competitive to both adequately staff high crime areas that trickles out into the suburbs as well.
Thank you so much. I know you're in between meetings. Appreciate that input today and appreciate your leadership, and thank you for being here. Thank you, Mr. Chair.
Thank you so much. We really appreciate your testimony. I did make a promise to our committee that we'll be out by 5 o'clock. It's now 5 o'clock. Do we have any questions? Anything? All righty. Seeing none, thank you all so much for a wonderful day today, and you are out at 5 o'clock. So I hope that you get home. No, I'm still talking at 5:01, but you're out at 5 o'clock. It's been adjourned. Thanks.